Same moment, same emergency. On the left, panic, confusion, precious seconds lost. On the right, a plan, a checklist, and calm, life-saving action. Preparation makes all the difference.
It's 2:47 a.m. and you're awake. Your cat is acting strange. Maybe they're hiding under the bed. Maybe they vomited twice today. Maybe they just seem off and you can't put your finger on why. So you're Googling cat symptoms on your phone, getting more terrified with every article that says, could be nothing, could be fatal. Here's what no one tells you. The difference between a cat who needs a vet tomorrow and a cat who might not make it through the night often comes down to recognizing just 5 specific warning signs. And by the end of this video, you'll know exactly what they are, exactly what to do, and exactly how much time you have to act. Veterinarians estimate that 63% of cat health emergencies could have been prevented if owners had recognized the warning signs just 24 hours earlier. Your cat is trying to tell you they're sick right now. Let's learn how to finally hear them. Chapter 1: Life-Threatening Symptoms. The 5-minute rule. Let's start with the scariest truth first. Some cat symptoms mean you need to move right now. Not tomorrow morning when your vet opens. Not in an hour after you finish dinner. Right now. This very minute. And the cruel irony is that cats are so good at hiding illness that by the time you notice something's wrong, they're often already in crisis. So we're going to talk about the 5-minute rule. If your cat shows any of the symptoms we're about to discuss, you have approximately 5 minutes to make a decision that could save their life. Get your phone ready, because you're going to want to save the emergency vet number in your contacts before we're done here. Sign number 1, difficulty breathing or open mouth breathing. Here's what normal cat breathing looks like. Their chest rises and falls smoothly, about 20 to 30 times per minute when they're resting. You shouldn't hear it. You shouldn't see their belly heaving, and you should never ever see them breathing with their mouth open unless they just finished playing hard or they're extremely stressed, like right after a car ride. If your cat is sitting still and breathing with their mouth open, that's a medical emergency. Period. No exceptions. No, let me wait and see if it gets better. A study from the Journal of Veterinary Emergency and Critical Care found that cats presenting with open mouth breathing had a mortality rate of 44%, even with immediate treatment. That number jumps to over 70% if treatment is delayed by even a few hours. Why is this so serious? Cats are obligate nose breathers. Their respiratory system is designed to breathe through their nose efficiently and quietly. When a cat switches to mouth breathing, it means their body is so desperate for oxygen that they've abandoned their normal breathing pattern. This could mean fluid in the lungs, a blood clot blocking circulation, severe asthma, heart failure, or a dozen other conditions that will kill them if not treated immediately. Here's what difficulty breathing looks like beyond just open mouth breathing. Watch for a cat whose breathing is labored, where you can see their whole body working to breathe. Their belly might pump in and out dramatically. Their neck might extend forward as they try to open their airway. They might sit in a hunched position, elbows out, refusing to lie down because lying down makes it harder to breathe. Some cats will breathe rapidly, more than 40 breaths per minute at rest. Count it. Put your hand on your cat's chest and count for 15 seconds, then multiply by 4. If it's over 40 and they're not stressed or hot, that's concerning. If it's over 60, you're already late getting to the emergency vet. Let me tell you about Marcus and Shadow. Marcus called me at 11 p.m. on a Tuesday. Shadow, his 8-year-old black cat, was breathing funny. How funny? I asked. Just kind of fast, Marcus said. Should I take him in tomorrow? I asked Marcus to count Shadow's breaths. 72 breaths per minute. I told Marcus to hang up and drive to the emergency vet immediately. Shadow had a condition called saddle thrombus, a blood clot that was blocking blood flow. He survived, but only because Marcus got him to the vet within 30 minutes. The vet told Marcus that if he'd waited until morning, Shadow would have died in his sleep. What should you do if you see breathing problems? Stop reading this and go. Don't finish this video. Don't pack a carrier carefully. Grab your cat, grab a towel or pillowcase if you can't find the carrier immediately, and drive. If you're more than 20 minutes from an emergency vet, call them on the way so they're ready when you arrive. Some emergency vets will talk you through basic stabilization while you're driving. This is one of the few situations where the stress of the car ride is far less dangerous than waiting. Sign number 2, inability to urinate or crying in the litter box. This one kills male cats with terrifying speed. A blocked bladder is one of the most common emergencies vets see, and it can go from "my cat is straining in the litter box" to "my cat is dead in less than 48 hours. Here's what's happening. Crystals, stones, or inflammation block the urethra, the tube that carries urine from the bladder out of the body. The bladder fills with urine but can't empty. Pressure builds. Toxins that should be eliminated in urine back up into the bloodstream. The kidneys shut down. The heart develops fatal rhythm problems. The cat dies. Male cats are at much higher risk because their urethra is longer and narrower, but female cats can block too. According to research from the American Veterinary Medical Association, urethral obstruction has a mortality rate of about 36%, even with treatment, and nearly 100% without treatment. Most cats die within 48 to 72 hours of complete obstruction. Some die within 24 hours. Here's what a blocked cat looks like. They go to the litter box frequently, sometimes every few minutes. They squat and strain but produce little or no urine. You might see a few drops of bloody urine. They might cry out in pain while straining. Some cats will start urinating or trying to urinate outside the litter box, on tile floors, in the bathtub, on your bed, anywhere cool and smooth. They're not being bad. They're in agony, and they're trying to tell you something is desperately wrong. As the blockage continues, the cat becomes lethargic. They stop eating. They might vomit. Their belly becomes hard and distended because the bladder is filling with urine it can't release. If you gently feel their lower abdomen and it feels like there's a small water balloon in there, firm and round, that's a blocked bladder. In late stages, the cat might collapse, have seizures, or fall into a coma as toxins overwhelm their system. Here's the tricky part that fools a lot of cat owners. A blocked cat will go to the litter box constantly, so people think the cat has diarrhea or constipation. They're straining, so it looks like they're trying to defecate. By the time the owner realizes it's a urinary problem, not a digestive one, precious hours have been lost. So here's your rule. If your cat is straining in the litter box and you're not 100% certain you see normal feces or normal urine coming out, treat it as a urinary emergency until proven otherwise. Jennifer learned this the hard way with her cat Bella. Bella was 9 years old and started going to the litter box frequently one Saturday morning. Jennifer thought maybe Bella had eaten something that upset her stomach. By Saturday evening, Bella was crying in the litter box. Jennifer almost waited until Monday to call her regular vet. Something made her call the emergency vet instead. Bella was completely blocked. She had emergency surgery that night. The vet told Jennifer that if she'd waited until Monday, Bella would have been dead or brain damaged from the toxin buildup. What should you do? If you suspect a urinary blockage, this is another drop everything emergency. The faster a blockage is relieved, the better the outcome. Cats who are unblocked within the first 24 hours have much better survival rates and fewer complications than cats who go 48 or 72 hours. Every hour counts. Get to an emergency vet immediately. Sign number 3, inability to walk or sudden paralysis of the back legs. Picture this. Your cat is walking normally across the room. Suddenly, they collapse. Their back legs don't work. They're dragging themselves with their front legs, crying out in pain and confusion. This is called saddle thrombus, or aortic thromboembolism, and it's one of the most heartbreaking emergencies in feline medicine. A blood clot forms, usually because of underlying heart disease, and lodges at the point where the aorta splits to supply blood to the back legs. Blood flow is cut off. The legs become paralyzed, cold, and painful. According to a study in the Journal of Veterinary Internal Medicine, Saddle thrombus has a survival to discharge rate of only about 30 to 40%, and many cats who survive the initial event will have another clot within months. But here's the critical thing. The cats who survive are almost always the ones whose owners got them to emergency care within the first few hours. Delayed treatment drops survival rates dramatically. How do you recognize this? The cat suddenly can't use one or both back legs. The legs may feel cool to the touch compared to the front legs. The paw pads might be pale or bluish instead of pink. The cat is usually in severe pain, crying or howling. Some cats will pant from pain and stress. In some cases, only one leg is affected. In others, both back legs are completely paralyzed. This can also happen with trauma. A cat who goes outside and gets hit by a car might drag themselves home with a broken back or pelvis. A cat who falls from a high window might have spinal damage. Any sudden inability to walk normally is an emergency that requires immediate veterinary care. But saddle thrombus is particularly cruel because it often happens to cats who seemed perfectly healthy hours before. The underlying heart disease was silent. The cat showed no symptoms. Then suddenly, catastrophe. Rachel's cat, Miso, was playing with a toy 1 minute. The next minute, Miso screamed and fell over. Rachel thought Miso had broken a leg somehow. At the emergency vet, they discovered the saddle thrombus and the underlying heart disease that caused it. Miso spent 3 days in intensive care. She survived, but she's on medication for life now, and Rachel knows another clot could form at any time. What should you do? Immediate emergency vet visit. Don't try to splint the legs or manipulate them. Don't give pain medication from your own cabinet. Just get the cat to the vet as quickly and calmly as possible. Wrap them in a towel to prevent them from thrashing and potentially injuring themselves further. Sign number 4, seizures or collapse. A seizure in a cat looks different than you might expect. You might picture dramatic convulsions, and some seizures do look like that. The cat falls over, their legs paddle, they might drool or lose control of their bladder or bowels. But some seizures are much subtler. The cat might just stare into space, unresponsive. They might have facial twitching, or their whiskers might twitch rhythmically. They might make chewing motions or drool excessively. Some cats have what's called a partial seizure, where only part of the body is affected. You might see one leg twitching repeatedly, or the cat might turn in circles compulsively. After a seizure, most cats go through what's called a post-ictal phase. They seem confused, disoriented, or exhausted. Some cats are blind temporarily. Some are aggressive or fearful. This phase can last from a few minutes to several hours. Then the cat usually returns to normal until the next seizure. Why are seizures an emergency? A single brief seizure in an otherwise healthy cat might not be immediately life-threatening, but it requires urgent veterinary care to determine the cause. Seizures can be caused by epilepsy, brain tumors, liver disease, kidney failure, poisoning, low blood sugar, infections, or head trauma. Some of these causes are rapidly progressive and fatal without treatment. And if a cat has multiple seizures close together, or a seizure that lasts more than 5 minutes, that's called status epilepticus, and it's a life-threatening emergency. The brain can be permanently damaged by prolonged seizure activity. Collapse is related but different. A cat who collapses suddenly might not be seizing. They might faint from heart problems, severe pain, extremely low blood sugar, or shock. Some cats collapse from heat stroke. Some collapse from severe anemia. A collapsing cat needs emergency evaluation to determine why their body shut down. Marcus experienced this with Shadow after the saddle thrombus. Shadow recovered from that crisis, but a few months later, Shadow collapsed while eating dinner, just fell over mid-bite. Marcus rushed Shadow back to the emergency vet. This time, it was a heart rhythm problem related to Shadow's underlying heart disease. Shadow needed emergency medication to stabilize his heart rate. The vet said if Marcus had waited to see if Shadow recovered on his own, Shadow likely would have had a fatal cardiac event. What should you do during a seizure? Don't try to hold the cat down or restrain them. Don't put anything in their mouth. Cats can't swallow their tongues, and you're likely to get bitten badly if you try. Clear the area around them so they don't hurt themselves on furniture. Time the seizure with your phone. Note exactly what you see. Video it if you can do so safely. All this information helps the vet. If the seizure lasts more than 5 minutes, or if the cat has more than one seizure within a few hours, get to the emergency vet immediately. If it's the first seizure and it stops within a few minutes, you still need to get to a vet the same day, even if the cat seems fine afterward. Sign number 5, severe trauma or obvious injury. This one seems obvious, but you'd be surprised how many people delay treatment after trauma because the cat seems okay afterward. Here's the truth about cat injuries. Cats are incredibly good at hiding the severity of trauma. A cat can have internal bleeding, a ruptured organ, or severe internal injuries and still walk around, even eat and drink, for hours or even days before they crash. Any cat who has experienced significant trauma needs immediate veterinary evaluation. This includes falls from height, getting hit by a car, being attacked by a dog, being stepped on or sat on, having something heavy fall on them, or being caught in a closing door. Even if the cat seems fine, even if they're walking normally, even if they ate dinner and are purring on your lap. Internal injuries can be silent killers. A study from the Journal of Veterinary Emergency and Critical Care found that cats with traumatic injuries often have multiple internal injuries that aren't apparent from external examination. A cat might have a small scrape on their face and massive internal bleeding. They might have no external injuries at all and have a ruptured bladder or torn diaphragm. The only way to know is X-rays, ultrasound, and careful veterinary examination. Lisa learned this with her cat Oliver. Oliver fell from a second-story window. He landed on his feet, shook himself off, and trotted back inside like nothing happened. Lisa watched him carefully. He seemed fine. He ate dinner, he used the litter box, he slept on the bed that night. The next morning, Oliver wouldn't eat. By afternoon, his gums were pale. Lisa finally took him to the vet. Oliver had internal bleeding from a torn blood vessel in his abdomen. He needed emergency surgery and blood transfusions. The vet told Lisa that Oliver had been slowly bleeding internally for over 24 hours. If Lisa had brought Oliver in immediately after the fall, they could have detected and treated it before he lost so much blood. Here's a specific type of trauma that's more common than people realize: high-rise syndrome. Cats fall from windows and balconies, especially in warm weather when windows are open. Interestingly, cats who fall from very high up, like 7 to 10 stories, sometimes have fewer injuries than cats who fall from 2 to 6 stories. This is because they reach terminal velocity and spread their bodies out like flying squirrels, distributing the impact. But cats falling from any height can have severe injuries. Never assume a cat is fine after a fall. Another common trauma: bite wounds from other cats. Cat bites seem minor, small puncture wounds, but cat mouths are full of bacteria, and those puncture wounds create perfect little infection pockets under the skin. Within 24 to 48 hours, an abscess forms. The cat develops a fever. The infection can spread to the bloodstream and cause sepsis. Any cat bite, even one that looks minor, needs veterinary attention within 24 hours for antibiotics. What should you do after trauma? Get to a vet immediately. Don't wait to see if symptoms develop. By the time symptoms appear, the cat may be in critical condition. If the cat is bleeding externally, apply gentle pressure with a clean towel. If a bone is visibly broken or a wound is deep, don't try to splint or bandage it yourself. Just keep the cat calm and still and get to the vet. If the cat is unconscious or having trouble breathing, that's a lights and sirens emergency, the 5-minute rule in action. So those are the 5 signs that mean you need to act immediately. Let's review them because these are the symptoms that every single cat owner needs to know. Number 1, difficulty breathing or open mouth breathing. Number 2, inability to urinate or crying in the litter box. Number 3, inability to walk or sudden paralysis. Number 4, seizures, or collapse. Number 5, severe trauma or obvious injury. If you see any of these, you're not overreacting by going to the emergency vet. You're not being a paranoid pet parent. You're potentially saving your cat's life. Here's a statistic that should motivate you. According to veterinary emergency medicine specialists, the survival rate for most feline emergencies is 60 to 80% if treatment begins within the first few hours. That same survival rate drops to 20 to 30% if treatment is delayed by 12 to 24 hours. Now let's talk about what to do in those 5 minutes while you're preparing to leave for the emergency vet. Step 1, stay calm. I know that's easier said than done when your cat is in crisis, but your cat can sense your panic and it will make them more stressed. Take one deep breath. You can fall apart later. Right now, your cat needs you functional. Step 2, call the emergency vet while you're preparing to leave. Tell them you're coming and describe the symptoms. They may give you instructions for the car ride. They'll also prepare for your arrival, which can save precious minutes when you get there. Save your local emergency vet number in your phone right now. Yes, right now. Pause this video, Google emergency vet near me, and save the number. I'll wait. Step 3, get your cat contained safely. A cat in pain or distress may bite or scratch even their beloved owner. They're not being mean, they're scared and hurting. If you have a carrier, use it. If you can't find the carrier or can't get the cat into it quickly, use a large towel or a pillowcase. Gently wrap the cat like a burrito, supporting their whole body. This keeps them secure and prevents them from injuring themselves or you during transport. Step 4, bring any relevant information. If your cat got into something toxic, bring the package. If they're on medications, bring the pill bottles. If you have recent lab work or x-rays, bring those. If you don't have these things readily available, don't waste time looking for them. The vet can work without them. Getting there quickly is more important. Step 5, drive safely. I know you're terrified and want to get there as fast as possible, but you won't help your cat if you get into an accident. If possible, have someone else drive so you can monitor the cat and talk to the vet on the phone if needed. What to expect at the emergency vet. Emergency vet visits are expensive. I'm not going to sugarcoat that. A typical emergency visit might cost anywhere from $500 to $3,000 or more, depending on what's wrong and what treatment is needed. Many emergency clinics require payment up front or a deposit before treatment begins. This is not them being heartless. Emergency clinics have massive overhead costs. They're open 24/7, and they see a high percentage of patients whose owners can't or won't pay. If cost is a concern, be upfront about it. Many vets will work with you to prioritize the most essential treatment. Some accept payment plans or care credit. Some will refer you to lower cost options if your cat's condition is stable enough for transfer. But please don't let fear of the bill keep you from going. There are options. The cat rescue community has resources. Some areas have emergency financial assistance programs. Your regular vet might see you on emergency basis if you explain the cost concern. When you arrive, the vet will triage your cat. In true emergencies, they may take your cat to the back immediately for stabilization before you even fill out paperwork. This is good. This means they're prioritizing your cat's life. You'll fill out forms later. If your cat is not in immediate danger of dying, you might wait while they treat more critical cases first. This is also normal in emergency medicine. The vet will examine your cat and recommend diagnostics. This often includes blood work, x-rays, maybe ultrasound. These tests are expensive but necessary. A vet can't treat what they can't diagnose. If the vet recommends hospitalization, that means your cat is sick enough to need continuous monitoring and treatment. It's not them trying to run up the bill. Hospitalized cats have IV fluids, medications, monitoring equipment, and staff checking on them throughout the night. Some cats will need to be transferred to a specialist the next morning. Emergency vets are amazing at stabilization and crisis management, but some conditions need specialist care. This is normal and doesn't mean the emergency vet isn't competent when it's not one of the big 5 emergencies. Now, those 5 signs are the drop everything, go right now emergencies. But there are plenty of other symptoms that are serious and need veterinary attention, just not necessarily at 3 a.m. The next chapter is going to talk about how to tell the difference between urgent and non-urgent symptoms, how to know if your cat can wait until morning, or if they need to be seen today, or if you can schedule a regular appointment in the next few days. Because one of the biggest challenges cat owners face is that zone of uncertainty, where the cat is clearly not right, but you don't know if it's emergency level, not right, or just regular vet visit not right. Before we move to that next chapter, let me tell you about Sarah and Whiskers. Sarah adopted Whiskers, her first cat, about 6 months ago. Whiskers is a 3-year-old orange tabby with a huge personality. Sarah loves him completely, but she worries constantly that she won't recognize when something is seriously wrong. She's called her vet at least 5 times in 6 months asking, "Is this an emergency?" Twice, the answer was yes. 3 times, it was something that could wait. The first emergency was when Whiskers ate a piece of string. Sarah didn't actually see him eat it, but she found the string toy with a piece missing, and Whiskers was acting lethargic. The vet saw him the same day and did x-rays. The string was in his intestines. He needed surgery. If Sarah had waited a few days, the string could have caused a life-threatening blockage. The second emergency was when Whiskers had diarrhea with blood in it. Sarah's instinct was to wait and see if it resolved, but something made her call the vet. Good thing she did. Whiskers had a severe intestinal infection that responded to antibiotics, but could have become much more serious. The 3 non-emergencies? Once Whiskers sneezed a few times and Sarah panicked thinking it was a respiratory infection. It was just dust. Once Whiskers vomited 1 time and then was fine. Just a hairball. Once Whiskers seemed to be limping slightly. By the time they got to the vet, he was walking normally. Might have been a temporary muscle soreness. Sarah felt embarrassed about the false alarm calls. Her vet told her something important. "I would rather see Whiskers 10 times for things that turn out to be nothing than have you wait on the one thing that's serious. You're learning your cat. You're learning what's normal for him and what's not. That's exactly what you should be doing." And that's exactly right. You're not overreacting. You're learning. Chapter 2. Urgent vs. non-urgent. When to rush vs. when to wait. So we've covered the immediate, drop everything emergencies. But most of the time, cat health issues fall into a gray area. Your cat is vomiting, but not constantly. Your cat is sneezing, but still eating. Your cat seems painful, but is still moving around. These situations require judgment, and that's hard when you're worried and you love this cat and you just want to do the right thing. This chapter is going to give you a framework for making these decisions. We'll talk about common symptoms, what they might indicate, and how urgently they need attention. But here's the most important thing I can tell you up front. When in doubt, call your vet. Even if it's just to talk through the symptoms and get guidance. Most vets would rather you call than wait too long. The 24-hour rule. Here's a general guideline that applies to many situations. If a symptom is mild and your cat is otherwise acting normally, you can often monitor at home for 24 hours. If the symptom persists beyond 24 hours, worsens, or if the cat stops eating, drinking, or using the litter box normally, then it's time for a vet visit. But if the symptom is severe even for one occurrence, or if your cat is lethargic and not acting like themselves, don't wait the full 24 hours. Let me give you some examples of how this works in practice. Vomiting. When to worry. Cats vomit fairly frequently. They have sensitive stomachs. They groom themselves and get hairballs. They eat too fast. They eat grass. A healthy cat might vomit once every week or 2, and if the cat is otherwise acting fine, this is usually not concerning. Here's when vomiting becomes urgent. If the cat vomits more than 3 times in 24 hours, that's concerning. If there's blood in the vomit, either bright red or dark brown like coffee. Grounds, that's urgent. If the vomiting is projectile or forceful, that's more worrying than gentle vomiting. If the cat is trying to vomit but nothing comes up, or if they're drooling excessively and seem unable to swallow, that could indicate an obstruction or poisoning and needs immediate attention. Also, look at what the cat is doing between vomiting episodes. If Whiskers vomits once, but then eats dinner normally and plays with his toys and uses the litter box, he's probably fine. If Whiskers vomits once and then hides under the bed, won't eat, and seems painful, that's much more concerning, even though it's the same number of vomiting episodes. Jennifer's cat, Bella, used to vomit about once a week, usually a hairball. Jennifer knew this was normal for Bella, but one week, Bella vomited 3 times in one day. Jennifer called the vet. They asked, "Is Bella eating? Is she drinking? Is she acting normal otherwise?" Jennifer said Bella had eaten breakfast and seemed fine between vomiting episodes. The vet said to monitor closely and bring Bella in if she vomited again or stopped eating. Bella didn't vomit again, probably just an upset stomach. But if Bella had continued vomiting or shown other symptoms, Jennifer was ready to bring her in. Diarrhea. When to act. Like vomiting, occasional mild diarrhea can happen in cats. Maybe they got into something they shouldn't have. Maybe you changed their food too quickly. Maybe they're stressed. One day of soft stool in a cat who's otherwise fine is usually not an emergency. Here's when diarrhea becomes urgent. If there's a lot of blood in it, especially bright red blood, see a vet the same day. If the diarrhea is constant, like every hour or more frequently, that's concerning. If the cat is straining painfully to defecate, or if they're crying while defecating, that needs attention. If the cat has diarrhea and is also vomiting, lethargic, or not eating, that's more serious than diarrhea alone. And if the cat is young, old, or has other health problems, diarrhea is more dangerous because they can dehydrate quickly. Also consider the duration. 1 day of diarrhea, monitor at home. 2 days of diarrhea, call your vet. 3 or more days of diarrhea, definitely get the cat seen, even if they're otherwise acting okay. Chronic diarrhea can indicate inflammatory bowel disease, parasites, food allergies, or other conditions that need diagnosis and treatment. Marcus dealt with this with Shadow. Shadow had diarrhea for about 3 days, not severe, just soft stool. Shadow was eating, drinking, and acting fairly normal. Marcus almost didn't call the vet because it seemed mild, but 3 days was his cutoff point, so he scheduled an appointment. Good thing he did. Shadow had Giardia, an intestinal parasite. A round of medication cleared it up, but if left untreated, it could have caused weight loss and chronic intestinal inflammation. Changes in urination, the yellow flag. We already talked about complete inability to urinate as a medical emergency. But what about changes in urination that aren't complete blockage? This includes urinating more frequently, but still producing urine, urinating in unusual places, blood in the urine, or straining with urination but still producing some urine. These symptoms often indicate a urinary tract infection, bladder inflammation, or early stages of crystal formation. They're not immediately life-threatening the way a complete blockage is, but they need veterinary attention within 24 hours. Don't wait several days to see if it resolves on its own. Urinary issues can progress quickly, and the cat is in pain. Here's how to tell if it's truly urgent. If the cat is straining and producing absolutely nothing, that's an emergency, as we discussed. If the cat is straining but producing small amounts of urine, especially if that urine is bloody, see a vet the same day, but it doesn't have to be the emergency clinic at 2 a.m. Call your regular vet. First thing in the morning. If the cat is urinating more frequently than usual but otherwise seems comfortable and is producing normal amounts of urine each time, you can schedule a regular appointment within a few days, but don't ignore it. Lisa's cat. Oliver started urinating outside the litter box. Lisa's first thought was behavioral. Maybe Oliver didn't like the litter? But then Lisa noticed Oliver was going to the litter box very frequently and seeming uncomfortable. Lisa took Oliver to the vet the next day. Oliver had a urinary tract infection. A week of antibiotics cleared it up. If Lisa had assumed it was behavioral and didn't address it, Oliver could have developed a more serious blockage or kidney infection. Lethargy and behavior changes. Trust your gut. This is the hardest one to quantify because cats are individuals, and normal varies so much between cats. But generally speaking, if your cat's behavior changes significantly and the change persists for more than 24 hours, that warrants a vet visit. What does significant behavior change look like? A cat who usually greets you at the door but now stays hidden all day. A cat who usually plays enthusiastically but now shows no interest. A cat who usually sleeps on your bed but now isolates themselves in a closet. A cat who usually has a hearty appetite but now picks at their food or stops eating entirely. A cat who usually grooms meticulously but now has a dull, unkempt coat. Here's the challenge. Cats sleep 16 to 20 hours a day normally, so a sleeping cat isn't necessarily a sick cat. But a cat who's sleeping more than usual for them, who's hard to rouse, who doesn't react to things that usually excite them, who seems weak or unsteady, that's lethargy and it needs investigation. Lethargy plus any other symptom moves things into the urgent category. Lethargy plus vomiting, see a vet today. Lethargy plus not eating, see a vet today. Lethargy plus hiding, see a vet today. Lethargy alone with no other symptoms, monitor closely, and if it persists beyond 24 hours or worsens, schedule a vet visit. Rachel noticed her cat Miso was sleeping more than usual. Miso is normally very active and playful, but for 2 days she just seemed tired. She was still eating and using the litter box normally. Rachel wasn't sure if she was overreacting. She called the vet and described the symptoms. The vet said to monitor for 1 more day and bring Miso in if the lethargy continued. The next day, Miso seemed back to normal. Maybe she was fighting off a mild infection or just needed extra rest. But if Miso had continued being lethargic, Rachel was prepared to bring her in. Not eating, the 24-hour hard stop. Cats can develop a serious condition called hepatic lipidosis or fatty liver disease if they stop eating for more than a few days. Their body starts breaking down fat for energy, but their liver gets overwhelmed with the fat and stops functioning properly. This can be fatal, and it can happen surprisingly quickly, especially in overweight cats. Here's the rule. If your cat completely stops eating, you have about 24 to 48 hours before this becomes a serious medical problem. A cat who skips 1 meal is usually not a concern, especially if they seem otherwise fine. A cat who skips multiple meals in a row needs veterinary attention. A cat who doesn't eat anything for 24 hours straight needs to be seen by a vet that day. Also pay attention to how much they're eating. A cat who usually eats a full bowl and now is only eating a few bites, that's a significant decrease even though they're technically still eating. If this continues for more than 2 days, schedule a vet visit. And remember, loss of appetite is often the first sign that something is wrong. Cats who are in pain, nauseated, stressed, or sick will often stop eating before any other symptoms appear. So a cat who stops eating deserves investigation even if you can't see anything else wrong. Sarah learned this with Whiskers when he had the string obstruction. The first sign wasn't vomiting or diarrhea. It was that Whiskers didn't finish his breakfast, which was very unusual for him. By dinner time, he wasn't interested in food at all. Sarah took him to the vet the next morning. If she'd waited several days thinking he was just being picky, the outcome could have been much worse. Respiratory symptoms, sneezing, coughing, wheezing. Upper respiratory infections are common in cats, especially cats who've been in shelters or around other cats. Most are viral, similar to a human cold. Mild sneezing in a cat who's otherwise acting fine is usually not an emergency. But respiratory symptoms can escalate quickly, especially in kittens, senior cats, or cats with other health problems. Here's when respiratory symptoms need urgent attention. If the cat is having difficulty breathing, as we discussed in the emergency section. If there's thick, colored discharge from the nose or eyes, that indicates infection that needs treatment. If the cat stops eating because they can't smell their food due to nasal congestion, that's a problem. If the cat is mouth breathing, lethargic, or has a fever, Those are urgent signs. For mild symptoms, you can monitor for 24 to 48 hours. A little sneezing, clear discharge from the eyes or nose, normal appetite and energy that can often resolve on its own or with supportive care at home. But if symptoms worsen or persist beyond 2 days, schedule a vet visit. Respiratory infections can turn into pneumonia if left untreated. Jennifer's cat Bella started sneezing one day, just a few sneezes, no other symptoms. Jennifer kept an eye on it. The next day, Bella was still sneezing but also had watery eyes. Day 3, the eye discharge was turning yellowish. Jennifer called the vet. Bella had an upper respiratory infection and needed antibiotic eye drops and oral medication. If Jennifer had waited another week, Bella could have developed a more serious infection. Eye problems, when it's urgent. Any sudden change to a cat's eyes warrants relatively quick veterinary attention, though not always emergency-level urgent. Here are the eye symptoms and their urgency levels: sudden blindness or dramatic vision. Changes. See an emergency vet immediately. Some causes of sudden blindness are treatable if caught quickly, especially high blood pressure causing retinal detachment. Eye bulging, eye sunken in, eye looking dramatically different in size or position compared to the other eye. See a vet the same day. Obvious injury to the eye like a scratch or puncture. See a vet the same day. Eye injuries can get infected quickly, and minor injuries can hide more serious damage. Squinting, excessive tearing, pawing at the eye. These can indicate pain or a foreign body. See a vet within 24 hours. Discharge from the eyes. If it's clear and watery and the cat is otherwise fine, you can monitor for a couple days. If it's thick, colored, or accompanied by other symptoms, see a vet within 24 to 48 hours. Cloudiness in the eye, change in eye color, or one pupil larger than the other. Schedule a vet visit within a few days. These could indicate various conditions from glaucoma to uveitis to neurological problems. Marcus noticed Shadow's right pupil was larger than the left one. Shadow was acting normally otherwise. Marcus took Shadow to the vet within 2 days. Shadow had high blood pressure, which can cause unequal pupils among other problems. He needed medication to control it. High blood pressure in cats can lead to organ damage, so catching it early was important even though Shadow seemed fine. Limping or pain depends on severity. A cat who suddenly can't use a leg at all needs same-day veterinary attention. This could be a broken bone, a dislocated joint, or severe soft tissue injury. A cat who's limping but still able to put some weight on the leg can usually wait 24 hours to see if it improves, especially if there's no obvious injury and the cat is otherwise acting fine. What you're looking for is the limping getting better or worse over time. Can the cat still jump, use the litter box, and move around even though they're favoring one leg? Is there visible swelling, a wound, or a deformity? Is the cat in obvious pain when you gently touch or manipulate the leg? If a cat is limping severely, not putting any weight on a leg seems very painful. Or if the limping persists for more than 2 to 3 days, even if mild, that needs veterinary examination. Cats are very good at hiding pain, so a cat who's visibly limping is hurting more than you might think. Lisa's cat. Oliver started limping on his front left paw. Lisa examined the paw carefully and found a small cut between his toe pads. She cleaned it gently. The next day, Oliver was still limping, but the cut looked okay. By day 3, Oliver was walking normally again. The cut had healed. But if Oliver's paw had been swollen, or if the limping had gotten worse, or if Lisa had seen any signs of infection, she would have taken him to the vet. Lumps and bumps, timing matters. Finding a lump on your cat is scary, but not all lumps need emergency attention. Here's how to assess. A lump that appears suddenly and grows rapidly, especially if it seems painful or if the skin over it is red or broken, needs to be seen within a few days. It could be an abscess, which is an infection that needs antibiotics and possibly draining. A lump that's been there a while and suddenly changes, gets bigger, starts bleeding, or becomes painful should be evaluated within a week. A small, stable lump that doesn't seem to bother the cat can be mentioned at your next regular vet visit, but don't ignore it entirely. Your vet should examine any new lump and may recommend fine needle aspiration to determine what it is. Here's the thing about lumps in cats. They're often abscesses from bite wounds, which are painful but treatable. Some are benign fatty tumors called lipomas. Some are cysts, but some are cancerous, and the earlier cancer is detected, the better the treatment options. So never just ignore a lump and assume it's fine. Jennifer found a lump on Bella's side about the size of a grape. It didn't seem to hurt when Jennifer touched it. Bella was acting normally. Jennifer made a vet appointment for later that week. The vet did a fine needle aspiration and determined it was a benign lipoma. No treatment needed, just monitoring to make sure it didn't change. But Jennifer was glad she had it checked. Weight loss, slow, but serious. Gradual weight loss is often overlooked because it happens so slowly you might not notice. But weight loss in cats, especially if they're still eating normally, can indicate serious problems like diabetes, hyperthyroidism, kidney disease, or cancer. If your cat loses more than 10% of their body weight, or if you can suddenly see their ribs and spine prominently when you couldn't before, schedule a vet visit, even if the cat seems fine otherwise. Weight loss is usually a symptom of something that needs investigation. How do you monitor weight? Most cats don't cooperate with standing on a scale at home, but you can weigh yourself, then weigh yourself holding the cat and subtract the difference. Do this monthly for senior cats or cats with health issues. For healthy adult cats, checking weight every few months is reasonable. Rachel noticed Miso seemed thinner. Miso was eating her normal amount of food, so Rachel almost dismissed it. But Rachel weighed Miso and compared to Miso's weight at the last vet visit 6 months ago. Miso had lost almost a pound, which is significant for a 10-pound cat. Rachel took Miso to the vet. Miso was diagnosed with hyperthyroidism, an overactive thyroid gland. It's very treatable, but if left untreated, it can cause heart problems and other complications. Rachel was glad she didn't ignore the weight loss, increased thirst, or urination. Worth investigating. Some cats naturally drink more water than others, but if your cat's drinking habits change noticeably, that can signal kidney disease, diabetes, hyperthyroidism, or other conditions. Similarly, if you're suddenly scooping much larger or more frequent urine clumps from the litter box, that's worth mentioning to your vet. This isn't usually an emergency unless the cat is drinking excessively to the point of vomiting from drinking too much water, or unless they seem sick in other ways. But schedule a vet visit within a week or two. These symptoms often indicate conditions that are much easier to manage if caught early. Marcus noticed Shadow's water bowl needed refilling more often. Shadow was also urinating larger amounts, creating huge clumps in the litter box. Marcus took Shadow to the vet. Blood work showed early kidney disease. Shadow went on a special kidney diet and medication. The vet said early intervention could add years to Shadow's life. The decision-making framework. Let me give you a simple framework for deciding how urgently your cat needs to be seen. Emergency. Go now. Difficulty breathing. Can't urinate. Can't walk. Seizures. Severe trauma. Unresponsive or collapsed. Urgent same day. Straining to urinate but producing some urine. Vomiting blood. Severe diarrhea with blood. Obvious severe pain. Eye injury. Not eating for 24 hours. High fever. See vet within 24 to 48 hours. Vomiting multiple times. Persistent diarrhea. Lethargy plus other symptoms. Mild difficulty breathing. Limping severely. Signs of pain. Behavior change with other symptoms. Schedule appointment within a few days. Mild limping that's not getting worse. New lump. Decreased appetite for 2 to 3 days. Minor wound. Mild eye discharge that's not improving. Persistent sneezing or coughing. Mention at next regular visit. Stable small lump. Gradual weight changes. Mild behavior changes with no other symptoms. Occasional mild vomiting or diarrhea. But remember, this is a general framework. Your cat is an individual. If your gut tells you something is really wrong, even if the symptoms don't seem to fit the urgent category, call your vet. Explain what you're seeing and what concerns you. They can help you decide. What about after hours? Here's a tough reality. Many veterinary emergencies happen at night, on weekends, or during holidays when your regular vet is closed. You'll need to decide whether to go to an emergency clinic or wait until your regular vet opens. Emergency clinics are more expensive than regular vet visits, sometimes significantly more expensive. But if your cat has a true emergency, the cost doesn't matter because your cat could die or suffer permanent damage if not treated immediately. If you're unsure whether it's emergency level, many emergency clinics have a phone triage nurse who can listen to symptoms and help you decide if you need to come in. Some situations can safely wait until morning if your regular vet can see you first thing. For example, a cat with mild diarrhea who's otherwise fine can usually wait. A cat with a small wound that's not bleeding heavily can usually wait. But if there's any doubt, especially if the cat is in pain or distress, go to the emergency clinic. Your regular vet can be a valuable resource for after-hours decisions. Many vets have an emergency line or will return calls even when the office is closed. Call your vet's office number and listen to the voicemail. Often it will give you instructions for reaching someone after hours. Describe the situation and ask if it can wait. If your vet says to go to the emergency clinic, go. If they say they can see you first thing in the morning, that's fine too. But watch your cat closely overnight and be prepared to go to the emergency clinic if things worsen. When in doubt, err on the side of caution. I want to tell you one more story. This is about Sarah and Whiskers, but it's about the one time Sarah almost didn't call the vet and really should have. Whiskers was acting oddly one evening. He was restless, pacing around, vocalizing more than usual. Sarah thought maybe he was bored or wanted to play. She played with him, but he still seemed restless. She thought maybe he wanted food even though it wasn't mealtime. She gave him a few treats. He ate them, but still seemed off. Sarah went to bed thinking Whiskers was just having a weird night. She woke up at 3 a.m. to the sound of Whiskers vomiting. Then he vomited again. Then again. Sarah got up and found that Whiskers had vomited 5 times. And now Whiskers was hiding under the bed, something he never did. Sarah called the emergency vet. They told her to bring Whiskers in immediately. Whiskers had an intestinal blockage from eating part of a toy. He needed emergency surgery. The vet told Sarah that if she'd waited until morning, Whiskers' intestines could have ruptured, which is often fatal. Sarah felt terrible that she didn't. Recognize the early signs. The restlessness and vocalization were Whiskers trying to tell her he didn't feel good. But Sarah didn't blame herself. She learned. Now she knows that when Whiskers acts persistently unlike himself, it's worth investigating even if she can't pinpoint what's wrong. That's the lesson here. You know your cat better than anyone. You know what's normal for them and what's not. If something feels off, even if you can't articulate exactly what's wrong, that's worth paying attention to. You're not overreacting. You're being a good cat parent, building your emergency plan. Before we finish this chapter, let's talk about preparing for emergencies so you're not scrambling in a crisis. Here's what you need. First, know where your nearest emergency vet is and how to get there. Save the address in your phone. Drive there during the day so you know the route. Save their phone number. Many areas have multiple emergency clinics. Know which one is closest and which one is open 24/7 versus limited hours. Second, have a cat first aid kit. This should include a digital thermometer, gauze pads, medical tape, hydrogen peroxide, a syringe without needle for giving medication or fluids, a blanket or towel, latex gloves, a pen light, and a basic first aid guide for cats. Keep this kit in an accessible place. Your vet or local pet store can help you assemble this. Third, keep your cat's medical records accessible. When you go to a new vet or emergency clinic, having your cat's vaccination records, medication list, and recent lab work can be very helpful. Keep copies in a folder or take photos and store them on your phone. Fourth, have a plan for transporting your cat. Keep a cat carrier accessible, not buried in a closet. If your cat is terrified of the carrier, consider having a large towel or pillowcase as a backup containment option. Fifth, consider pet insurance or set aside an emergency fund. Veterinary care is expensive. Emergency veterinary care is very expensive. Having financial resources available means you can make decisions based on what's best for your cat, not what you can afford in the moment. Even setting aside $50 a month builds up to a decent emergency fund over time. Chapter 3. Digestive problems. Vomiting, diarrhea, constipation. Let's talk about something every cat owner deals with: digestive issues. If you've lived with a cat for more than a few months, you've probably cleaned up vomit, dealt with litter box disasters, or worried about constipation. The cat digestive system is surprisingly sensitive, and problems in this area are among the most common reasons cats visit the vet. But here's the challenge. How do you know when digestive upset is just a minor inconvenience versus a sign of something serious? A study from the Journal of Feline Medicine and Surgery found that gastrointestinal complaints account for nearly 15% of all feline veterinary visits, but the underlying causes range from completely benign to life-threatening. By the end of this chapter, you'll understand the difference. You'll know what's normal, what's concerning, and exactly when your cat's digestive issues require veterinary intervention. Understanding normal cat digestion. Before we talk about what goes wrong, let's establish what normal looks like. Cats are obligate carnivores, meaning their digestive systems evolved to process meat almost exclusively. Unlike dogs who are more omnivorous, cats have a relatively short digestive tract optimized for protein digestion. This is why cats don't do well on high carbohydrate diets and why they can develop problems when fed inappropriate foods. Normal digestion in a cat works like this. Food enters through the mouth where it's minimally chewed. Cats don't chew extensively like humans do. They tear and swallow relatively large pieces. The food travels down the esophagus to the stomach, where powerful acids and enzymes begin breaking down proteins. From there, it moves to the small intestine, where most nutrient absorption happens. Finally, waste material moves through the large intestine, where water is absorbed, and then it's eliminated as feces. This whole process takes about 12 to 24 hours from eating to defecation in a healthy cat. The exact timing varies based on what the cat ate, how much they ate, their age, activity level, and individual metabolism. Some cats defecate once daily, others twice daily, some every other day. What matters is consistency. Each cat has their own normal pattern. A healthy cat's vomit, when it happens occasionally, might be clear or yellowish fluid, sometimes with hair, or it might contain recently eaten food if the cat ate too fast. Healthy cat feces should be brown, formed but not rock hard, and slightly moist. It should hold its shape when you scoop the litter box. There shouldn't be mucus, blood, or unusual colors. And your cat should defecate without straining, crying, or spending excessive time in the litter box. Now let's talk about what happens when things go wrong. Vomiting, the most common complaint. Vomiting in cats is so common that many owners consider it normal. And to some extent, occasional vomiting is normal for cats. But chronic vomiting or severe acute vomiting is not normal and indicates a problem that needs addressing. First, let's distinguish between vomiting and regurgitation, because they're different and the distinction matters. Vomiting is an active process. The cat's abdomen contracts. They retch and heave. The material that comes up is partially digested, often mixed with bile, and it may have a strong odor. Regurgitation is passive. Food comes back up shortly after eating with minimal effort, usually in a tubular shape because it never made it past the esophagus. It's undigested and doesn't smell particularly bad. Regurgitation often indicates an esophageal problem. The cat might be eating too fast, or there might be a structural issue with the esophagus like a stricture or megaesophagus. If your cat regularly regurgitates food shortly after eating, especially if they're losing weight or seem hungry all the time, that needs veterinary evaluation. Vomiting has dozens of possible causes. Let's break them down into categories. Dietary causes of vomiting. The simplest cause of vomiting is dietary indiscretion. The cat ate something they shouldn't have. This could be spoiled food, a toxic plant, human food that doesn't agree with them, or a non-food item. Cats are generally more discriminating eaters than dogs, but they still get into things occasionally. Food allergies or sensitivities can also cause vomiting. Some cats can't tolerate certain proteins, like chicken or fish. Some react to additives in commercial cat food. Some don't handle carbohydrates well. If your cat vomits regularly and you can't identify another cause, food sensitivity is worth investigating with your vet. Eating too fast is another common cause. Some cats, especially cats in multi-cat households or cats who were strays and experience food insecurity, will gulp their food down rapidly. The stomach gets overwhelmed and rejects it. You'll usually see the food come back up within minutes to an hour of eating, and it's relatively undigested. Solutions include feeding smaller meals more frequently, using a slow feed bowl, or spreading food on a flat surface so the cat has to eat more slowly. Rachel dealt with this with Miso. Miso would inhale her food like she was in a race, then vomit it back up 10 minutes later. Rachel switched to a puzzle feeder that made Miso work for each piece of kibble. The vomiting stopped immediately. Miso was just eating too fast and needed to slow down. Hairballs. Normal or problem? Hairballs are probably the most common reason for cat vomiting, and most owners consider them completely normal. Cats groom themselves meticulously, ingesting hair in the process. Most of this hair passes through the digestive system and comes out in feces, but some accumulates in the stomach and forms a trichobezoar, the technical term for hairball. Occasional hairballs, maybe once or twice a month, are generally normal, especially for long-haired cats. The cat will make a distinctive hacking sound, gag a few times, and produce a cylindrical mass of matted hair. It's unpleasant but not harmful if it happens occasionally. But frequent hairballs, more than once a week, can indicate a problem. The cat might be grooming excessively due to stress, allergies, or skin irritation. Or they might have an underlying digestive issue that's preventing normal hair passage through the intestines. Some cats develop chronic intestinal inflammation that slows gut motility, allowing hair to accumulate rather than pass through. Additionally, if a cat is gagging and retching like they're trying to bring up a hairball but nothing comes out, that could indicate an obstruction. The hairball might be too large to vomit up, or there might be something else blocking the digestive tract. Treatment for hairballs focuses on prevention. Regular brushing removes loose hair before the cat can ingest it. Specialized hairball formula foods contain added fiber that helps hair pass through the digestive system. Hairball remedies, usually petroleum-based lubricants, can help hair slide through more easily. But if your cat has frequent hairballs despite these measures, talk to your vet about investigating underlying causes. Jennifer noticed Bella was coughing up hairballs weekly. Bella is a long-haired cat, so Jennifer thought this was just normal for her. But when Bella started seeming uncomfortable and vomiting more frequently, Jennifer took her to the vet. Bella had developed inflammatory bowel disease. The IBD was slowing her digestion, causing hair to accumulate. With medication and a special diet, Bella's hairball frequency decreased dramatically. Inflammatory bowel disease and other chronic conditions. Speaking of IBD, let's talk about chronic causes of vomiting. These are conditions where vomiting happens regularly over weeks or months, often accompanied by other symptoms like diarrhea, weight loss, or poor appetite. Inflammatory bowel disease is a common chronic digestive condition in cats. The intestinal lining becomes inflamed, though we don't always know why. Food allergies, bacterial overgrowth, and immune system problems can all contribute. Cats with IBD typically vomit intermittently, have soft stools or diarrhea, may lose weight even though they're eating, and often have a dull coat and low energy. IBD is diagnosed through a combination of blood work, imaging, and often intestinal biopsies. Treatment usually involves dietary changes, often to a novel protein diet or hydrolyzed protein diet, plus medications to reduce inflammation like steroids or other immunosuppressants. Many cats with IBD do very well with proper management, but it's a lifelong condition requiring ongoing care. Chronic kidney disease is another common cause of vomiting in older cats. As the kidneys fail, toxins build up in the bloodstream and cause nausea. Cats with kidney disease often drink more water, urinate more, lose weight, and vomit intermittently. We'll discuss kidney disease in more detail in a later chapter, but if your senior cat starts vomiting regularly, kidney function should be evaluated. Hyperthyroidism, an overactive thyroid gland, affects many senior cats and can cause vomiting along with weight loss, increased appetite, hyperactivity, and increased thirst. Again, we'll cover this more later, but it's a treatable condition once diagnosed. Diabetes can cause vomiting, especially if the cat develops diabetic ketoacidosis, a life-threatening complication. Diabetic cats drink excessively, urinate excessively, often lose weight despite eating well, and may have poor coat quality. Liver disease can cause vomiting, along with jaundice where the skin and eyes turn yellow, increased thirst, and lethargy. Pancreatitis, inflammation of the pancreas, causes severe vomiting, abdominal pain, lethargy, and loss of appetite. Cancer, particularly intestinal lymphoma, can cause chronic vomiting, diarrhea, and weight loss. The point is this: if your cat vomits regularly, more than once or twice a month, or if vomiting is accompanied by other symptoms like weight loss, changes in appetite, changes in thirst or urination, or behavioral changes, your cat needs a thorough veterinary workup to identify the underlying cause. Acute severe vomiting, when to panic. Now let's talk about acute vomiting that comes on suddenly and severely. This is different from chronic intermittent vomiting. Acute vomiting happens rapidly, often multiple times in a short period, and the cat usually acts sick. Causes of acute vomiting include intestinal obstruction from foreign bodies, toxin ingestion, acute pancreatitis, acute kidney injury, severe infections, and intestinal parasites. Foreign body obstruction is common, especially in young cats and cats who like to chew or play with string-like objects. String, yarn, ribbon, tinsel, rubber bands, hair ties, and small toys are common culprits. The foreign object gets stuck in the digestive tract, causing a partial or complete blockage. The cat vomits repeatedly, stops eating, becomes lethargic, and may have abdominal pain. Linear foreign bodies, like string, are particularly dangerous. The string gets anchored at one end, often under the tongue or in the stomach, while the other end travels into the intestines. As the intestines try to move the string along through normal peristalsis, the string acts like a saw, cutting into the intestinal wall. This can cause peritonitis, a life-threatening infection of the abdominal cavity. If you know or suspect your cat ate something they shouldn't have, don't wait to see if they vomited up. Call your vet immediately. Sometimes the vet can induce vomiting to bring the object back up before it causes damage. Sometimes the cat needs endoscopy or surgery to remove it. The sooner you act, the better the outcome, and often the lower the cost. Sarah will never forget the string incident with Whiskers. She found him playing with a cat toy that had a string tail. Later that day, she couldn't find the toy and noticed the string was missing. Whiskers seemed fine, so Sarah thought maybe she'd misplaced the toy. The next day, Whiskers vomited 3 times and wouldn't eat. Sarah took him to the vet. X-rays showed the string in his intestines. Whiskers needed emergency surgery. The vet found the string bunched up in the intestines, starting to cause damage. A few more hours and Whiskers could have had intestinal perforation. Sarah now keeps all string toys locked up and only brings them out under supervision. Toxin ingestion can cause acute severe vomiting. Lilies are extremely toxic to cats and cause acute kidney failure along with vomiting. Antifreeze causes vomiting, neurological symptoms, and kidney failure. Human medications like ibuprofen or acetaminophen can cause severe vomiting and organ damage. Household cleaners, pesticides, and many human foods like onions, garlic, grapes, and chocolate can all cause vomiting and other symptoms. If you know your cat ingested something toxic, this is an emergency. Call your vet or the ASPCA Animal Poison Control Center immediately at 888-426-4435. Don't wait for symptoms. Don't try to induce vomiting at home unless specifically instructed by a veterinarian, because some toxins cause more damage coming back up. Time is critical with poisoning, when vomiting requires immediate vet attention. Let's review when vomiting is an emergency requiring same-day or immediate veterinary care. Vomiting blood either bright red or dark brown like coffee grounds. This indicates bleeding in the digestive tract. Vomiting along with diarrhea, especially if the cat is lethargic, not drinking, or seems painful. This suggests a more serious systemic problem. Vomiting multiple times within a few hours with no relief. 3 or more vomiting episodes in a 12-hour period warrants a call to your vet. Projectile vomiting, where the vomit shoots out forcefully. This can indicate an obstruction or severe gastritis. A cat who is trying to vomit but nothing comes up, especially if they seem distressed or are drooling excessively. This could indicate an obstruction or poisoning. Vomiting in a cat who recently ate something they shouldn't have or got into a toxic substance. Vomiting accompanied by other concerning symptoms like difficulty breathing, collapse, seizures, severe lethargy, or inability to walk. Any vomiting in a kitten under 6 months old. Young cats dehydrate quickly and can go downhill fast, vomiting along with a distended or painful abdomen. Feel your cat's belly gently. It should be soft and non-painful. If it's hard, bloated, or the cat cries when you touch it, that's an emergency. Managing minor vomiting at home. For occasional, isolated vomiting in an otherwise healthy cat, you can often manage at home and monitor. Here's what to do. Withhold food for 12 to 24 hours to let the stomach rest. Continue to offer water. If the cat vomits water, you can offer ice cubes to lick instead, which provides hydration more slowly. After 12 to 24 hours, offer a small amount of bland food. Boiled chicken with no seasoning, plain boiled white rice, or plain canned pumpkin, not pie filling, just pure pumpkin, are good options. You can also ask your vet for a prescription bland diet. Offer just a tablespoon or two. If the cat keeps it down, offer another small amount in a few hours. Gradually transition back to regular food over 2 to 3 days. Mix increasing amounts of regular food with the bland diet. Monitor closely. If the cat vomits again, stops eating or drinking, becomes lethargic, or shows any other concerning symptoms, call your vet. Keep the cat calm and rested. Stress can exacerbate digestive upset. Marcus used this approach with Shadow when Shadow vomited twice one morning, but otherwise seemed fine. Marcus withheld food for 24 hours, gave water, and Shadow didn't vomit again. The next day, Marcus offered small amounts of boiled chicken. Shadow kept it down. Over 3 days, Marcus transitioned Shadow back to regular food. Whatever upset Shadow's stomach resolved on its own. But Marcus watched carefully and was ready to go to the vet if Shadow vomited again or showed other symptoms. Diarrhea, causes and concerns. Now let's talk about the other end of the digestive system. Diarrhea in cats can range from mild and self-limiting to severe and life-threatening. Like vomiting, occasional diarrhea can happen in healthy cats, but persistent or severe diarrhea requires investigation. Normal cat feces should be firm, brown, and formed. Soft serve consistency or pudding-like stool is mild diarrhea. Liquid stool is more severe. Any stool with blood in it, either bright red or black and tarry, is concerning. Mucus coating the stool can indicate inflammation. Unusual colors like green, gray, or yellow can indicate various problems. Small bowel versus large bowel diarrhea. Veterinarians distinguish between small intestinal and large intestinal diarrhea because they have different causes and different urgency levels. Small intestinal diarrhea typically produces large volumes of loose stool. The cat may defecate 2 to 3 times daily, but each time produces a lot of stool. There's usually no straining. The cat may lose weight over time. Small intestinal diarrhea can indicate problems like dietary intolerance, parasites, inflammatory bowel disease, or malabsorption issues. Large intestinal diarrhea produces small amounts of loose stool frequently. The cat goes to the litter box many times a day, strains to defecate, and produces small amounts each time. There's often mucus or blood in the stool. Large intestinal diarrhea indicates problems in the colon, like colitis, parasites, or inflammatory conditions. Acute diarrhea comes on suddenly and lasts less than 2 weeks. Chronic diarrhea persists for more than 2 weeks or recurs frequently over months. Common causes of diarrhea in cats. Dietary changes are a frequent cause of acute diarrhea. If you switch cat food brands too quickly, the digestive system doesn't have time to adjust. Always transition food gradually over 7 to 10 days, mixing increasing amounts of new food with decreasing amounts of old food. Food intolerance or allergies can cause both acute and chronic diarrhea. Some cats can't tolerate certain ingredients. The most common allergens in cats are chicken, fish, and dairy. An elimination diet under veterinary supervision can identify problematic ingredients. Intestinal parasites are common, especially in young cats, outdoor cats, or cats from shelters. Roundworms, hookworms, tapeworms, coccidia, and giardia can all cause diarrhea. Some parasites are visible in the stool, like tapeworm segments that look like grains of rice. Others require microscopic examination of a fecal sample. Deworm your cat regularly as recommended by your vet, and always have new cats tested for parasites. Infections, either bacterial or viral, can cause acute diarrhea. Bacterial overgrowth, salmonella, or campylobacter infections can occur, especially if the cat ate contaminated food. Viral infections like feline panleukopenia, also called feline distemper, cause severe diarrhea, along with vomiting and fever. This is preventable with vaccination and can be fatal, especially in kittens. Inflammatory bowel disease, as we discussed with vomiting, causes chronic diarrhea. The stools may be soft, contain mucus, or the cat may have alternating diarrhea and constipation. Stress and anxiety can trigger diarrhea in sensitive cats. Major changes like moving, new pets, construction noise, or boarding can upset the digestive system. This usually resolves once the stressor is removed. Medications, particularly antibiotics, can cause diarrhea by disrupting the normal bacterial balance in the gut. If your cat develops diarrhea while on medication, contact your vet. They may prescribe probiotics or adjust the medication. More serious causes of diarrhea include pancreatitis, liver disease, kidney disease, hyperthyroidism, cancer, especially intestinal lymphoma, and exocrine pancreatic insufficiency, where the pancreas doesn't produce enough digestive enzymes, when diarrhea requires veterinary attention. Diarrhea needs urgent veterinary care if there's a large amount of blood in the stool, especially bright red blood. The diarrhea is accompanied by vomiting, fever, lethargy, or loss of appetite. The cat is a kitten, senior, or has other health problems. These cats dehydrate quickly. The diarrhea is profuse and watery. The cat is straining painfully or crying while defecating. The diarrhea lasts more than 24 hours without improvement. You suspect toxin ingestion or your cat ate something they shouldn't have. Schedule a vet appointment within a few days if the diarrhea is mild but persistent for more than 3 days, the stools contain mucus or are an unusual color, your cat has chronic intermittent diarrhea, your cat has diarrhea along with weight loss or poor coat quality. Managing mild diarrhea at home. For mild acute diarrhea in an otherwise healthy adult cat, you can try home management. Continue feeding, but offer a bland diet. Boiled chicken and plain pumpkin work well. Some vets recommend temporarily feeding a prescription digestive health diet. Ensure the cat stays hydrated. Dehydration is the main danger with diarrhea. Offer fresh water constantly. You can add low-sodium chicken broth to encourage drinking. Consider a probiotic designed for cats. Probiotics help restore healthy gut bacteria. Ask your vet for a recommendation. Keep the litter box very clean. Cats with diarrhea may avoid a dirty box leading to accidents. Monitor closely. If diarrhea worsens, doesn't improve within 24 hours, or if other symptoms develop, call your vet. Lisa dealt with mild diarrhea in Oliver after she switched his food too quickly. Oliver had soft stools for 2 days. Lisa immediately went back to his old food and added plain pumpkin. Within 24 hours, Oliver's stools were back to normal. When Lisa wanted to try the new food again, she did a much slower transition over 2 weeks, and Oliver had no problems. Constipation, the opposite problem. While diarrhea is about stool coming out too fast and too loose, constipation is about stool not coming out at all. Constipation in cats is less common than diarrhea, but can be more serious if it becomes severe. Normal cats typically defecate once or twice daily, though some healthy cats go every other day. Constipation means infrequent defecation, difficult defecation, or passage of hard, dry stool. Severe constipation is called obstipation, where the cat can't defecate at all. Causes of constipation. Dehydration is the most common cause. If a cat isn't drinking enough water, the colon absorbs more water from the stool, making it hard and difficult to pass. Cats on dry food only, cats with kidney disease, and senior cats are at higher risk for dehydration-related constipation. Megacolon is a condition where the colon loses its ability to contract properly. Stool accumulates and the colon stretches. This can be congenital or can develop from chronic constipation that damages the colon muscles. Megacolon often requires lifelong management and sometimes surgery. Intestinal obstruction from foreign bodies, hair, or masses can cause constipation. If something is blocking the intestines, stool can't pass. Lack of exercise contributes to constipation. Cats who are sedentary, especially overweight cats or arthritic cats who don't move much, have slower gut motility. Painful defecation can create a cycle of constipation. If defecating hurts, perhaps from anal gland problems, rectal polyps, or arthritis that makes squatting painful, the cat avoids defecating. The stool sits in the colon, becomes harder, and then hurts even more to pass. Neurological problems affecting the nerves that control defecation can cause constipation. This can happen with spinal injuries, nerve damage, or certain neurological diseases. Some medications cause constipation as a side effect, particularly opioid pain medications and some antihistamines. Signs your cat is constipated. The cat goes to the litter box frequently and strains, but produces little or no stool. Remember, this looks similar to urinary blockage, which is an emergency. Make sure your cat is actually constipated and not blocked. If you're not certain, treat it as a potential urinary blockage and see a vet immediately. When stool does come out, it's hard, dry, and small. The cat may cry or seem painful while defecating. The cat may have decreased appetite and lethargy. Some constipated cats vomit. This seems counterintuitive, but severe constipation can cause nausea and vomiting. If you haven't seen your cat defecate in 48 to 72 hours and they're acting uncomfortable, assume constipation and contact your vet. When constipation becomes an emergency, severe constipation where the cat hasn't defecated in 3 or more days requires veterinary attention. The cat may need enemas, stool softeners, or manual extraction of impacted stool. In severe cases, hospitalization with IV fluids and intensive care is needed. Megacolon that's not responsive to medical management may require surgery to remove part of the colon. This is a last resort, but some cats need it to maintain quality of life. Never give your cat human laxatives without specific veterinary instruction. Some human products are toxic to cats. The dose is different and you could cause harm. Jennifer's cat Bella developed constipation at age 14. Bella hadn't defecated in 3 days. When Jennifer took Bella to the vet, Bella's colon was completely full of hard, impacted stool. Bella needed sedation and manual removal of the impacted feces, IV fluids, and medication. It was a miserable experience for Bella and expensive for Jennifer. Afterward, the vet put Bella on a constipation prevention protocol: canned food only for higher moisture, fiber supplement, and a medication called lactulose to soften stools. Bella still occasionally gets mildly constipated, but they've prevented another severe episode: preventing and managing constipation. For cats prone to constipation, prevention is key. Increase water intake. Feed canned food, which has 75 to 80% moisture versus dry foods 10% moisture. Provide multiple water sources. Some cats prefer running water, so consider a cat fountain. Add water or low-sodium broth to food. Increase fiber in the diet. Plain canned pumpkin is an excellent fiber source. Start with 1 to 2 teaspoons mixed into food daily. Some prescription diets are formulated for digestive health with appropriate fiber levels. Encourage exercise. Play with your cat daily to stimulate gut motility and keep them at a healthy weight. Keep the litter box pristine. Some cats won't use a dirty box, leading to retention and constipation. Address underlying pain. If your cat has arthritis making it painful to squat, talk to your vet about pain management. If anal glands are causing painful defecation, have them expressed. Consider stool softeners or lubricants. Products like lactulose, Miralax, or petroleum-based laxatives can be used long-term under veterinary supervision. Never start these without vet approval. Monitor litter box habits. Know what's normal for your cat and watch for changes, megacolon specifically. Let me talk a bit more about megacolon because it's a serious condition that often develops from chronic constipation. Megacolon means the colon is abnormally enlarged and has lost its muscle tone. It can't contract effectively to move stool along. Some cats are born with megacolon. Others develop it after chronic constipation stretches the colon beyond the point where the muscles can recover. Cats with megacolon often have recurrent, severe constipation despite treatment. They may need enemas or manual disimpaction regularly. Medical management includes high-fiber diets, stool softeners, medications to stimulate gut motility like cisapride, and sometimes regular enemas. Some cats respond well to medical management and live comfortably for years. If medical management fails, surgical removal of most of the colon, called a subtotal colectomy, is an option. After this surgery, cats typically have soft stools or mild diarrhea for life, but they're no longer painfully constipated. It's major surgery with risks. But for cats who aren't responding to medication and are suffering, it can dramatically improve quality of life. Marcus's cat Shadow developed megacolon after years of intermittent constipation. Initially, Shadow would get constipated every few months and need veterinary enemas. Over time, it became more frequent. Even with medication, Shadow was getting constipated every few weeks. Shadow was miserable, lethargic, and losing weight. Marcus and the vet decided on surgery. Shadow had a subtotal colectomy. The recovery was tough, and Shadow now has permanently soft stools that require frequent litter box cleaning. But Shadow is comfortable, eating well, and his quality of life is much better than it was with chronic, severe constipation. The connection between digestive issues and overall health. Before we finish this chapter on digestive problems, I want to emphasize something important. Digestive issues are rarely just digestive issues. The gut is connected to every system in the body. Chronic vomiting or diarrhea can lead to malnutrition, electrolyte imbalances, and weight loss. Dehydration from digestive problems stresses the kidneys. Inflammatory bowel disease is associated with intestinal lymphoma. Liver disease causes digestive symptoms but affects the whole body. This is why persistent digestive problems need thorough veterinary investigation, not just symptomatic treatment. If your cat has chronic vomiting, diarrhea, or constipation, your vet should be looking for the underlying cause, not just prescribing medication to manage symptoms. A complete workup for chronic digestive issues typically includes a physical exam, blood work to check organ function and look for systemic disease, fecal testing for parasites and bacteria, and imaging like X-rays or ultrasound to evaluate the GI tract. In some cases, endoscopy with biopsies may be needed to diagnose conditions like IBD or cancer. This testing costs money. I understand that. But treating symptoms without knowing the cause often leads to ongoing problems, repeated vet visits, and ultimately higher costs. Getting a diagnosis allows targeted treatment that actually resolves the issue. Rachel learned this with Miso. Miso had intermittent vomiting and diarrhea for months. Rachel's vet initially tried symptomatic treatment with bland diet and medication for nausea. It helped temporarily, but symptoms kept returning. Finally, the vet recommended a full workup. Blood work was normal, but intestinal biopsies showed IBD. With a diagnosis, Miso was started on appropriate medication and a hypoallergenic diet. The symptoms resolved. The workup was expensive, but it gave them answers and allowed effective treatment. If Rachel had just kept trying different temporary solutions without finding the cause, Miso would have continued suffering and the costs would have kept accumulating. Your action plan for digestive health. Let's summarize what you should do about digestive problems in your cat. For occasional, isolated vomiting or diarrhea, monitor closely for 24 hours. Withhold food briefly if vomiting. Offer bland diet, ensure hydration. Contact vet if symptoms persist, worsen, or other symptoms develop. For chronic or recurrent digestive issues, keep a symptom diary noting frequency, timing, what the cat ate, stool appearance, etc. Schedule a vet visit for comprehensive evaluation. Be prepared for diagnostic testing. Follow through with recommended treatment. For severe acute symptoms, contact vet immediately for vomiting blood, bloody diarrhea, suspected toxin ingestion, or inability to defecate. Don't wait to see if it improves. For prevention, feed high-quality, appropriate cat food. Transition foods slowly, ensure adequate hydration, maintain healthy weight through portion control and exercise, regular parasite prevention, annual or semi-annual vet exams. Chapter 4. Urinary issues, utis, blockages, crystals. If there's one category of health problems that terrifies cat owners once they know about it, it's urinary issues. And rightfully so. Urinary problems in cats can go from minor annoyance to life-threatening emergency in a matter of hours. We touched on urinary blockage in the emergency chapter, but now we're going to dive deep into the entire spectrum of urinary tract problems that affect cats. By the end of this chapter, you'll understand the difference between a urinary tract infection, bladder inflammation, crystal formation, and complete blockage. You'll know the warning signs, the risk factors, and how to protect your cat from these painful, dangerous conditions. Understanding the feline urinary system. Let's start with basic anatomy. The urinary system consists of the kidneys, which filter blood and produce urine, the ureters, tubes that carry urine from the kidneys to the bladder, which stores urine, and the urethra, the tube through which urine exits the body. In male cats, the urethra is long, narrow, and has a curve where it passes through the penis. This anatomical difference is why male cats are much more prone to urethral blockages than females. Normal cat urine is yellow to amber in color, has a characteristic ammonia-like smell, and is slightly acidic with a pH typically between 6.0 and 6.5. Healthy cats urinate 2 to 4 times daily, though this varies based on water intake, diet, and individual metabolism. Each urination should produce a decent amount of urine, enough to make a clump in the litter box about the size of a tennis ball or slightly larger. The urinary system does more than just eliminate waste. The kidneys regulate electrolyte balance, blood pressure, and production of red blood cells. They activate vitamin D. They maintain the body's acid-base balance, so urinary problems can have systemic effects beyond just difficulty urinating. Feline lower urinary tract disease, the umbrella term. When veterinarians talk about urinary problems in cats, they often use the term FLUT-D, feline lower urinary tract disease. This is an umbrella term covering various conditions that affect the bladder and urethra. FLUTA can include urinary tract infections, bladder stones, urethral blockages, and idiopathic cystitis, which means bladder inflammation with no identifiable cause. According to research published in the Journal of Feline Medicine and Surgery, FLUT-D affects approximately 1 to 3% of cats annually, making it one of the most common reasons cats visit veterinarians. Male cats, overweight cats, cats eating primarily dry food, indoor-only cats, and cats living in multi-cat households are at higher risk. The symptoms of FLUT-D are fairly consistent, regardless of the specific cause. Inappropriate urination outside the litter box, frequent trips to the litter box with small amounts of urine produced, straining to urinate, blood in the urine, excessive licking of the genital area, crying or vocalizing while urinating, and changes in behavior like hiding or aggression. The challenge is that these symptoms look the same, whether the cat has a minor infection or a life-threatening blockage. That's why any urinary symptoms need prompt veterinary attention. Urinary tract infections, less common than you think. In dogs, urinary tract infections are very common, but cats are different. True bacterial urinary tract infections are actually relatively uncommon in young and middle-aged cats. Research shows that in cats under 10 years old with urinary symptoms, less than 5% actually have a bacterial UTI. Why the difference? Cat urine is more concentrated and more acidic than dog urine, creating an environment where bacteria don't thrive as easily. Also, cats generally have better perineal hygiene due to their grooming behavior. However, UTIs do become more common in senior cats, especially those with other health issues like kidney disease or diabetes. These conditions dilute the urine and make it less acidic, creating a better environment for bacterial growth. Cats with anatomical abnormalities, bladder stones, or recent urinary catheterization are also at higher risk. Symptoms of a UTI include frequent urination, straining, blood in urine, and sometimes urinating outside the box. The cat may also have a fever and seem generally unwell. Diagnosis requires urinalysis and urine culture. The vet collects a urine sample, either by free catch, catheterization, or cystocentesis, where they insert a needle through the abdomen directly into the bladder. The urine is examined under a microscope for bacteria and white blood cells, and then cultured to identify which bacteria are present and which antibiotics will be effective. Treatment is typically a course of antibiotics for 7 to 14 days. It's crucial to complete the full course, even if symptoms improve quickly. Stopping antibiotics early can lead to resistant bacteria and recurrent infection. Lisa's cat Oliver developed a UTI at age 12. Oliver was urinating frequently, and Lisa noticed pink-tinged urine in the litter box. The vet did a urinalysis and found bacteria and white blood cells. Culture identified: E. coli bacteria. Oliver received a 2-week course of antibiotics. Lisa made sure Oliver finished all the medication, and follow-up urinalysis showed the infection was cleared. The vet explained that because Oliver had his first UTI at age 12, they needed to monitor him more closely as he aged, since UTIs can recur in senior cats. Bladder stones, painful and problematic. Bladder stones, called uroliths, form when minerals crystallize in the bladder. The two most common types in cats are struvite stones, made of magnesium ammonium phosphate, and calcium oxalate stones. Struvite stones tend to form in alkaline urine. They're associated with urinary tract infections in some cases, though many cats develop sterile struvite stones. The good news is that struvite stones can often be dissolved with a prescription diet that acidifies the urine and reduces mineral content. Dissolution typically takes weeks to months. Calcium oxalate stones form in acidic urine and cannot be dissolved with diet. They require surgical removal. Cats who've had calcium oxalate stones are at high risk for recurrence, so lifelong dietary management and monitoring are necessary. Symptoms of bladder stones are similar to other FLUT-D symptoms: frequent urination, straining, blood in urine, inappropriate urination. The stones physically irritate the bladder lining, causing pain and inflammation. Small stones can lodge in the urethra, particularly in male cats, causing partial or complete blockage. Diagnosis is made through urinalysis, X-rays, and/or ultrasound. Some stones are visible on X-rays, while others require contrast studies or ultrasound to detect. Analysis of the stone composition, either from a past stone or one removed surgically, tells the vet which type it is and guides prevention strategies. Jennifer's cat Bella developed bladder stones at age 10. Bella was urinating frequently and seemed uncomfortable. X-rays showed multiple small stones in her bladder. Urinalysis indicated they were likely struvite stones. The vet prescribed a dissolution diet. Over 3 months, repeat X-rays showed the stones gradually shrinking. By month 4, they were gone. Bella stayed on a maintenance diet designed to prevent stone recurrence, and she's been stone-free for 3 years now. Crystals versus stones. An important distinction. Let's clarify the difference between crystals and stones because this confuses a lot of cat owners. Crystals are microscopic structures that can be seen in urine under a microscope. Stones are larger, solid masses that form when crystals aggregate. Some crystal formation is normal. Urine is a supersaturated solution, and crystals can precipitate out, especially if the sample sits for a while before analysis. Finding a few crystals on urinalysis doesn't necessarily mean your cat has a problem or will develop stones. However, persistent crystal formation, especially in large amounts, increases the risk of stone formation. It also indicates that the urine pH and mineral content are favorable for crystal formation, which should be addressed through diet. The 2 main crystal types are struvite and calcium oxalate, corresponding to the stone types. Treatment focuses on dietary management to alter urine pH and reduce mineral concentration. Many commercial cat foods are formulated for urinary health, with controlled mineral levels and ingredients that promote appropriate urine pH. Feline idiopathic cystitis, the mysterious one. Here's a surprising fact. In young and middle-aged cats with urinary symptoms, the most common diagnosis is feline idiopathic cystitis, or FIC. Idiopathic means we don't know what causes it. Despite extensive research, the exact mechanism remains unclear, though we know stress plays a major role. FIC is a sterile, inflammatory condition. There's no infection, no stones, no obvious physical cause. But the bladder lining becomes inflamed, irritated, and painful. Cats with FIC show all the classic urinary symptoms: frequent urination, straining, blood in urine, inappropriate urination, excessive grooming of the genital area. What we do know about FIC is that it's linked to the stress response system. Cats with FIC seem to have an abnormal stress response. Their bodies release higher levels of stress hormones in response to environmental triggers. These stress hormones affect the bladder lining, making it more permeable and irritated. Common triggers for FIC flare-ups include changes in routine, new pets, construction or remodeling, owners traveling, moving to a new home, changes in the household, and even weather changes. Some cats are so sensitive that something as minor as rearranging furniture can trigger symptoms. Diagnosis of FIC is made by ruling out other causes. The vet does urinalysis to rule out infection and crystals, imaging to rule out stones, and sometimes blood work to check kidney function. When all these tests come back relatively normal, but the cat still has symptoms, FIC is the likely diagnosis. Treatment for FIC is multifaceted and focuses on stress reduction and bladder health. Environmental enrichment to reduce stress, more litter boxes, vertical space, hiding spots, playtime, routine feeding schedule, increased water intake to dilute urine and flush the bladder, canned food, water fountains, multiple water bowls, pain management during flare-ups, medications like buprenorphine or NSAIDs appropriate for cats, anti-anxiety medications in some cases, amitriptyline or fluoxetine may help cats with severe stress-related FIC. Pheromone diffusers like Feline to create a calming environment, glycosaminoglycan supplements. These may help restore the bladder lining's protective layer. The frustrating thing about FIC is that flare-ups can be recurrent. A cat might be fine for months, then have an episode triggered by stress. Learning your cat's triggers and minimizing them is key to prevention. Rachel's cat Miso has FIC. Miso's first episode happened after Rachel moved to a new apartment. Miso started urinating outside the litter box, producing small amounts of bloody urine. The vet ruled out infection and stones. Diagnosis: FIC. Rachel made environmental changes, added more litter boxes, got a water fountain, established a strict routine, used Feline diffusers, and switched Miso to all canned food. Miso improved within a week. She's had 2 more flare-ups in 3 years, both triggered by stressful events. Once when Rachel had construction workers in the apartment. Once during a holiday when Rachel's schedule was disrupted. Each time, Rachel recognized the symptoms quickly, increased stress reduction measures, and the episodes resolved fairly quickly. Urethral blockage, the life-threatening emergency. We discussed urethral obstruction in the emergency chapter, but let's go deeper into why this happens and what the treatment involves. Urethral blockage occurs when something physically blocks the flow of urine through the urethra. In male cats, the most common blockage is a urethral plug, a mixture of mucus, protein crystals, and cellular debris that forms a paste-like substance. This plug gets lodged in the urethra, usually at the narrow portion near the tip of the penis. Actual stones can also cause blockage, as can severe inflammation that swells the urethra shut. Very rarely, tumors or strictures can cause obstruction. Why are male cats at such higher risk? Anatomy. The male cat urethra is much longer and narrower than the female urethra, and it has a curve. The female urethra is short, wide, and straight. While female cats can develop all the same urinary problems as males, complete blockage is much less likely because the wider urethra allows material to pass that would obstruct a male. When a cat becomes blocked, urine backs up into the bladder. The bladder distends painfully. Pressure builds. Within 24 to 48 hours, the kidneys stop filtering blood properly because there's nowhere for the urine to go. Toxins build up in the bloodstream, particularly potassium. Elevated potassium levels cause dangerous heart rhythm abnormalities that can be fatal. The cat becomes lethargic, stops eating, may vomit, and can progress to collapse, seizures, and death. Treatment requires emergency veterinary care. The cat is usually sedated or anesthetized. A urinary catheter is passed through the urethra to relieve the obstruction and drain the bladder. IV fluids are given to flush the kidneys and correct electrolyte imbalances. Blood work monitors kidney function and potassium levels. The catheter typically stays in place for 24 to 48 hours, while the urethra heals from inflammation and irritation. The cat is hospitalized during this time. Once the catheter is removed, the vet monitors to ensure the cat can urinate on his own. Some cats reblock after the catheter is removed, requiring repeat catheterization. Cats who reblock multiple times or who can't be catheterized may need a surgical procedure called perineal urethrostomy, or PU surgery. This surgery creates a wider opening in the urethra, permanently widening the narrowest portion. It's a last resort because it comes with its own risks and complications, but for cats who keep blocking, it can be life-saving. The cost of treating a urethral blockage typically ranges from $2,500 to $3,500 or more, depending on the severity and length of hospitalization. PU surgery adds another $2,500 to $3,000. This is why prevention is so important. Marcus will never forget Shadow's first blockage. Shadow was straining in the litter box all morning. Marcus thought Shadow was constipated. By afternoon, Shadow was lethargic and vomiting. Marcus finally realized it might be urinary and rushed Shadow to the emergency vet. Shadow was completely blocked. His potassium level was dangerously high. He needed catheterization, 3 days in the hospital, and nearly $3,000 in treatment. The vet said if Marcus had waited another 12 hours, Shadow likely would have died. After that experience, Marcus learned the signs. Shadow blocked again a year later, but Marcus recognized it within hours and got Shadow to the vet immediately. This time, Shadow needed only 1 day of hospitalization because Marcus acted so quickly. Risk factors for urinary blockage. Understanding risk factors helps you know if your cat is at higher risk and needs extra vigilance. Male cats, especially neutered males, are at highest risk. Neutered males have a narrower urethra than intact males. Obesity increases risk, possibly due to decreased activity and increased inflammation. Indoor-only cats have higher risk, likely due to stress and decreased activity. Cats eating primarily dry food have higher risk than cats eating canned food, probably because dry food provides less moisture. Multi-cat households increase stress and competition, raising risk. Previous urinary issues strongly predict future problems. A cat who's had one blockage has about a 50% chance of blocking again. Young to middle-aged cats, 2 to 7 years, are most commonly affected, though it can happen at any age. Certain breeds may be predisposed, though any cat can be affected. Preventing urinary problems. The power of diet and water. The good news is that many urinary problems are preventable, or at least manageable with the right approach. Diet and hydration are your most powerful tools. Increase water intake. This is the single most important thing you can do. More water means more dilute urine, which reduces crystal formation and flushes the bladder regularly. Strategies to increase water intake. Feed canned food exclusively or as the majority of the diet. Canned food is 75 to 80% moisture versus dry foods 10%. Add water or low-sodium broth to food. Start with small amounts and gradually increase. Provide multiple freshwater sources throughout the house. Try a cat water fountain. Many cats prefer running water. Use wide, shallow water bowls. Some cats don't like their whiskers touching the bowl edges. Clean water bowls daily. Cats are particular about freshness. Feed a urinary health diet. Many prescription diets are formulated to reduce crystal formation, maintain appropriate urine pH, and promote urinary tract health. These diets are scientifically formulated and clinically tested. Brands include Hill's CD, Royal Canin Urinary SO, and Purina UR. Over-the-counter diets marketed for urinary health can also be helpful, though prescription diets are generally more effective for cats with diagnosed problems. Maintain healthy weight. Overweight cats are at higher risk for urinary issues. Keep your cat lean through portion control and regular play. Reduce stress. Since stress is a major factor in FEC and can contribute to other urinary problems, creating a calm, enriched environment is important. Provide multiple litter boxes. The rule is 1 per cat plus 1 extra. Keep litter boxes very clean. Scoop at least daily. Ideally, twice daily. Place litter boxes in quiet, easily accessible locations. Provide vertical space like cat trees and shelves. Create hiding spots where cats can retreat when stressed. Maintain consistent routines for feeding, play, and sleep. Use pheromone products like Feline. In multi-cat households, ensure resources are plentiful and spread out to reduce competition. Monitor litter box habits. Know what's normal for your cat. How often do they urinate? What does the urine clump look like? If you notice changes, address them quickly. Sarah now photographs Whisker's urine clumps periodically, so she has a baseline to compare if something seems off. It might seem excessive, but for a cat who's had one blockage, that vigilance could save his life. When to call the vet about urinary symptoms. Any urinary symptom warrants at least a phone call to your vet. Here's the urgency breakdown. Emergency. Go immediately. Straining with no urine production or only drops. Crying out in pain while trying to urinate. Lethargic, vomiting, or seem systemically ill along with urinary symptoms. Distended, hard abdomen, urgent, same day. Blood in urine. Straining but producing small amounts. Very frequent urination every 10 to 15 minutes. Urinating in unusual places like the bathtub, sink, or your bed. Cats often seek cool, smooth surfaces when their bladder hurts. Call vet next business day. Increased frequency of urination, but normal amounts. Mild increase in thirst. Occasional accident outside the litter box with no other symptoms. Even if symptoms seem mild, don't ignore them. Early intervention prevents progression to more serious problems. After a urinary crisis, prevention and monitoring. If your cat has had a urinary blockage, UTI, or bladder stones, prevention becomes critical. The vet will likely recommend lifelong urinary diet to prevent crystal and stone formation, regular urinalysis every 3 to 6 months to monitor urine pH, crystal formation, and detect problems early, strict adherence to hydration strategies, weight management if obesity is a factor, stress reduction if FIC is involved. Some vets prescribe medications like prazosin, which relaxes the urethra, or amitriptyline for FIC management. Follow-up is not optional. These cats need ongoing monitoring because recurrence is common. Marcus learned this the hard way. After Shadow's first blockage, the vet recommended follow-up urinalysis in 3 months. Marcus was busy and didn't make the appointment. 6 months later, Shadow blocked again. Now Marcus is religious about follow-up appointments. Shadow sees the vet every 3 months for urinalysis, and at the first sign of any urinary symptom, Marcus is on the phone with the vet. The emotional toll of urinary disease. Living with a cat who has recurrent urinary problems is stressful. The fear of blockage is always in the back of your mind. You watch every litter box visit, you worry when you're away from home. The financial strain of repeated vet visits and hospitalizations is real. But here's what I want you to know. You're not alone, and there is hope. Many cats with urinary issues live long, happy lives with proper management. The key is education, vigilance, and partnership with your vet. Join online support groups for cats with Flu D. Talk to other owners who've been through this. Share strategies. The community support helps. Be kind to yourself. If your cat blocks despite your best efforts, it's not your fault. Some cats are just predisposed to these problems. You're doing your best. And remember, every day your cat is comfortable and happy is a victory. Focus on quality of life, not just preventing disease. Your urinary health action plan. Let's summarize what you should do. For prevention in all cats, provide ample fresh water. Consider adding canned food to the diet. Maintain healthy weight. Keep litter boxes very clean. Reduce household stress. Know what's normal for your cat's urination patterns. For at-risk cats, male, previous history, indoor-only, obese. Feed urinary health diet. Monitor litter box habits vigilantly. Consider water fountains and multiple water sources. Schedule regular urinalysis with your vet. If symptoms develop, don't wait to see if it improves. Contact vet immediately for straining with no production. Same-day vet visit for blood in urine or frequent straining. Never assume it's behavioral without ruling out medical causes after diagnosis of urinary disease. Strictly follow veterinary recommendations. Attend all follow-up appointments. Don't skip medications or dietary management. Watch for early signs of recurrence. Chapter 5, Respiratory Problems. Sneezing, coughing, breathing issues. When your cat sneezes, it's usually cute. One little sneeze, maybe 2, and you might not think much of it. But respiratory problems in cats can range from minor and self-limiting to severe and life-threatening. In this chapter, we'll explore the full spectrum of respiratory issues cats face, from common upper respiratory infections that are the cat equivalent of a cold to serious conditions like asthma and pneumonia that require aggressive treatment. By the end, you'll know when a sneeze is just a sneeze and when it's time to worry. The feline respiratory system. Let's start with basic anatomy. The respiratory system includes the nose and nasal passages, the pharynx and larynx in the throat, the trachea or windpipe, the bronchi, which branch into the lungs, and the lungs themselves where gas exchange happens. Cats are designed to breathe through their noses. Their nasal passages warm, humidify, and filter air before it enters the lungs. The respiratory rate for a resting cat should be 20 to 30 breaths per minute. You can count this by watching your cat's chest rise and fall. Each rise and fall equals 1 breath. Normal breathing should be quiet, effortless, and regular. You shouldn't hear wheezing, crackling, or loud breathing sounds. Your cat shouldn't be using abdominal muscles to breathe at rest. And as we discussed in the emergency chapter, cats should never breathe with their mouth open unless they're hot, stressed, or have just been very active. Upper respiratory infections. The cat cold, upper respiratory infections, or URIs, are extremely common in cats, especially cats who've been in shelters, catteries, or multi-cat environments. URIs are usually viral, though bacterial infections can occur secondary to viral infection or on their own. The two main viral culprits are feline herpes virus, FHV1, and feline calicivirus, FCV. Together, these account for about 80 to 90% of cat URIs. Both are highly contagious and spread through direct contact, aerosol droplets from sneezing, and contaminated surfaces. Feline herpes virus is similar to the herpes virus in humans. Once a cat is infected, they carry the virus for life. It becomes latent, hiding in nerve cells, and can reactivate during times of stress, illness, or immune suppression. So a cat might have an outbreak of herpes symptoms, recover, seem fine for months or years, then have another outbreak. Calicivirus doesn't become latent the same way, but cats can become chronic carriers, shedding virus intermittently even when they appear healthy. Symptoms of a typical URI include sneezing, nasal discharge that starts clear and may become colored, eye discharge, conjunctivitis where the eyes are red and swollen, fever, lethargy, decreased appetite, and sometimes mouth ulcers, especially with calicivirus. Most URIs are self-limiting, meaning they resolve on their own within 7 to 14 days, similar to a human cold. The cat's immune system fights off the virus and symptoms gradually improve. However, kittens, senior cats, and cats with suppressed immune systems can develop secondary bacterial infections, pneumonia, or severe complications. Treatment for URIs is usually supportive care. Keeping the cat comfortable while their immune system does the work. This includes ensuring the cat eats and drinks. Cats with nasal congestion can't smell their food well and may refuse to eat. Warm the food to enhance aroma. Offer strong-smelling foods like tuna or sardines, and hand feed if necessary. If the cat won't eat for more than 24 hours, call your vet. Keeping nasal passages clear. Gently wipe away discharge with a warm, damp cloth. You can use a humidifier or bring the cat into the bathroom while you run a hot shower to help loosen secretions. Encouraging rest in a warm, quiet environment. Medications as prescribed by your vet. Antibiotics don't treat the virus itself, but may be prescribed to prevent or treat secondary bacterial infection. Antiviral medications like famciclovir can help with herpes virus in some cases. Eye medications may be needed for conjunctivitis. Lysine supplements are sometimes recommended for cats with herpes virus, though research on effectiveness is mixed. Some cats seem to benefit, others don't. Most cats recover fully from URIs. However, some cats develop chronic rhinitis, where the nasal passages remain inflamed even after the infection clears. These cats may have persistent sneezing, nasal discharge, and congestion for months or even life. Treatment focuses on managing symptoms with medications, humidifiers, and occasional antibiotics when bacterial infection flares up. Lisa's cat Oliver came from a shelter and had a URI when she adopted him. Oliver sneezed constantly, had goopy eyes, and seemed miserable. Lisa followed the vet's treatment plan: antibiotics for 2 weeks, eye drops, lots of TLC. Oliver recovered, but to this day, Oliver still sneezes occasionally and has some nasal congestion, especially when stressed. The vet explained this is common for cats who had severe URIs as kittens. The infection damaged the nasal passages, leaving chronic inflammation. It's not dangerous, just a quality of life issue. Lisa has learned to manage it with occasional antibiotics when it flares up and keeping Oliver's stress low, when a URI becomes an emergency. While most URIs are manageable at home with supportive care, some situations require immediate veterinary attention, difficulty breathing or mouth breathing. This indicates severe congestion, pneumonia, or other complications. Complete loss of appetite for more than 24 hours. Cats can develop fatty liver disease quickly when they stop eating. Extreme lethargy or weakness where the cat is barely responsive. Very high fever above 104 degrees if you're able to check it at home. Thick, green or bloody nasal discharge suggesting severe bacterial infection. Eye ulcers, which appear as a cloudiness or divot on the surface of the eye. Herpes virus can cause corneal ulcers that are painful and can lead to vision loss if untreated. Symptoms in a very young kitten or senior cat with other health problems. Jennifer experienced this with Bella when Bella was about 5 years old. Bella developed what seemed like a mild URI, some sneezing and watery eyes. But over 48 hours, Bella's appetite disappeared. She became lethargic, and her breathing sounded congested. Jennifer took Bella to the vet. Bella had developed pneumonia as a complication of the URI. She needed hospitalization, IV fluids, injectable antibiotics, and nebulization treatments. It was scary and expensive, but Bella recovered fully. The vet explained that sometimes a simple URI progresses to pneumonia, especially in cats with weakened immune systems or very severe infections. Feline asthma, the chronic cough. Asthma in cats is more common than many people realize. It's estimated that 1 to 5% of cats have asthma, though many cases go undiagnosed because owners mistake the symptoms for hairballs. Feline asthma is a chronic inflammatory disease of the small airways in the lungs. The airways become inflamed, narrowed, and hyperreactive. When exposed to triggers like dust, smoke, pollen, or other irritants, the airways constrict, making it difficult for the cat to breathe. Symptoms include coughing, which is the most common sign. The cough might sound like the cat is trying to bring up a hairball with a hacking, gagging motion, but no hairball comes up. Wheezing can sometimes be heard, though not always. In severe attacks, the cat may have open mouth breathing, rapid breathing, extension of the neck, and severe respiratory distress. Between attacks, asthmatic cats may seem perfectly normal, or they might have subtle signs like exercise intolerance, tiring easily during play, or occasional coughing. Diagnosis is made through a combination of history, physical exam, chest x-rays, showing a classic bronchial pattern, and ruling out other causes of coughing and breathing difficulty. Sometimes the vet performs bronchoscopy or analysis of airway fluid to confirm the diagnosis. Treatment for asthma focuses on controlling inflammation and opening the airways, corticosteroids to reduce inflammation. These can be given orally by injection or ideally via inhaler. Inhaled steroids deliver medication directly to the lungs with minimal systemic side effects. Brands like Flovent can be given using a special aero chamber designed for cats. Bronchodilators like albuterol to open the airways during an attack or before exercise. Reducing environmental triggers. Minimize dust by using low-dust litter. Don't smoke around the cat. Use air purifiers. Avoid aerosol products and strong cleaning chemicals. Asthma can't be cured, but it can usually be well controlled with medication. Cats on proper asthma therapy can live normal, comfortable lives. However, untreated asthma can be life-threatening during severe attacks and can cause permanent lung damage over time. Rachel's cat, Miso, was diagnosed with asthma at age 4. Miso coughed frequently, and Rachel kept thinking Miso was trying to cough up hairballs, but Rachel never saw Miso actually produce a hairball. Eventually, Rachel mentioned it to the vet. Chest x-rays showed the pattern consistent with asthma. Miso started on oral steroids initially, then transitioned to an inhaler. The coughing decreased dramatically. Rachel uses an air purifier switched to low-dust litter and doesn't burn candles or use air fresheners anymore. Miso has occasional mild coughing, but overall her asthma is well controlled. Other causes of coughing in cats. Asthma isn't the only reason cats cough. Other possibilities include hairballs, which we've mentioned. If the cat is actually producing hairballs when they cough, that's different from asthma. But chronic hairball issues should still be addressed. Heart disease can cause coughing, though this is less common in cats than dogs. Fluid backing up into the lungs from heart failure can trigger coughing. Lungworm, a parasite that infects the lungs, can cause coughing. This is more common in cats who hunt and eat infected prey. Pneumonia, from infection or aspiration, causes coughing along with fever, lethargy, and difficulty breathing. Lung cancer or masses in the chest can cause coughing. Any cat with persistent or recurrent coughing needs veterinary evaluation to determine the cause. Pneumonia, infection in the lungs. Pneumonia is infection or inflammation in the lungs themselves. It can be bacterial, viral, fungal, or caused by aspiration, where food or fluid enters the lungs. Aspiration pneumonia often occurs in cats with megaesophagus, neurological problems affecting swallowing, or after anesthesia. Vomiting and aspirating vomit is another cause. Symptoms of pneumonia include cough, fever, lethargy, loss of appetite, rapid or difficult breathing, and sometimes nasal discharge. Cats with pneumonia are usually obviously sick, not just mildly under the weather. Diagnosis requires chest X-rays showing characteristic infiltrates in the lungs, plus blood work indicating infection. Treatment involves antibiotics, often requiring hospitalization with IV fluids, oxygen support, and nebulization treatments to help the cat breathe. Pneumonia is serious and can be fatal if not treated aggressively, but with proper treatment, many cats recover fully. Pleural effusion, fluid around the lungs. Pleural effusion means fluid accumulates in the pleural space, the area between the lungs and the chest wall. This compresses the lungs, making it hard to breathe. Causes of pleural effusion include heart failure, cancer, feline infectious peritonitis, FIPC, infections like pyothorax, trauma causing bleeding into the chest, or conditions called chylothorax, where lymphatic fluid leaks into the chest. Symptoms include difficulty breathing, rapid shallow breathing, open mouth breathing, decreased energy, and sometimes coughing. Cats with pleural effusion often sit with their elbows out and head extended, trying to maximize lung expansion. Diagnosis is made with chest X-rays or ultrasound showing fluid. The vet will often tap the chest with a needle to remove fluid for analysis and to help the cat breathe more easily. Treatment depends on the underlying cause. Some causes, like FIP, have a very poor prognosis. Others, like pyothorax, which is a bacterial infection in the chest, can be treated with antibiotics and chest drainage. Heart failure is managed with medications. Cancer may be treatable depending on the type. Any cat with respiratory distress and suspected pleural effusion needs immediate emergency care, nasal polyps, and tumors. Growths in the nasal passages or throat can cause respiratory symptoms. Nasopharyngeal polyps are benign growths that occur more commonly in young cats. They cause sneezing, nasal discharge, noisy breathing, and sometimes difficulty swallowing. Polyps are surgically removed and usually don't recur. Nasal tumors, which are more common in older cats, can be benign or malignant. Symptoms include persistent nasal discharge, often from one nostril, facial, swelling, sneezing, and sometimes nosebleeds. Diagnosis requires advanced imaging like CT scan and biopsy. Treatment options include surgery, radiation therapy, or palliative care depending on the tumor type and location. Reverse sneezing and other odd respiratory sounds. Sometimes cats make strange respiratory sounds that worry owners but aren't actually dangerous. Reverse sneezing is a rapid, repeated inhalation through the nose that sounds alarming. It looks like the cat is gasping or choking. It's caused by irritation or spasm of the throat and soft palate. Episodes last a few seconds to a minute and then resolve. While disturbing to watch, reverse sneezing is generally benign and doesn't require treatment unless it happens very frequently. Snoring in cats can be normal, especially in brachycephalic breeds with flat faces like Persians or Himalayans. Their compressed nasal passages and elongated soft palate cause noisy breathing, especially when sleeping. However, sudden onset of snoring in a cat who never snored before can indicate nasal congestion, polyps, or other issues worth investigating. Stridor is a high-pitched, harsh breathing sound caused by upper airway obstruction. This is not normal and requires veterinary evaluation, preventing respiratory problems. While you can't prevent all respiratory issues, you can reduce risk. Vaccinate your cat. Core vaccines include protection against feline herpes virus and calicivirus, the main causes of URIs. While vaccines don't prevent infection 100%, they significantly reduce severity, minimize exposure to sick cats. If you're introducing a new cat to your household, quarantine them for at least 2 weeks and watch for symptoms before mixing with resident cats. Reduce environmental irritants. Don't smoke around cats. Minimize use of aerosols, perfumes, and harsh cleaning chemicals. Use low-dust litter. Run air purifiers. Maintain good overall health. A strong immune system fights off infections better. Provide high-quality nutrition, regular vet care, and stress reduction. For cats with chronic conditions like asthma, strict adherence to medication and trigger avoidance is essential. When to seek veterinary care for respiratory symptoms. Here's your guide. Emergency. Go immediately. Difficulty breathing, open mouth breathing, or blue-tinged gums. Collapse or severe weakness with respiratory symptoms, choking or gasping for air. Urgent same day, persistent cough lasting more than a few hours, rapid breathing at rest, over 40 breaths per minute, noisy breathing or wheezing, lethargy and fever with respiratory symptoms, not eating for 24 hours with respiratory symptoms. Schedule appointment within a few days. Sneezing persisting more than 2 to 3 days. Nasal or eye discharge that's colored or persistent. Mild cough that comes and goes. Reverse sneezing that's frequent. Mention at next regular visit. Occasional sneeze with no other symptoms. Mild snoring that's been consistent. Your respiratory health action plan for prevention. Keep vaccines current. Minimize environmental irritants. Provide stress-free environment, ensure good nutrition. If symptoms develop, monitor respiratory rate and effort. Watch for difficulty breathing. Ensure cat continues eating and drinking. Contact vet promptly for persistent symptoms. For cats with chronic respiratory conditions, give medications exactly as prescribed. Monitor for flare-ups. Keep environment as trigger-free as possible. Maintain regular vet follow-ups. Marcus's cat Shadow has had both a URI and a brief scary episode where Shadow had difficulty breathing that turned out to be stress-induced. Marcus now knows Shadow's normal breathing rate and pattern. Marcus counts Shadow's breaths regularly just to stay familiar with normal. The first time Shadow's breathing seems labored or rapid, Marcus will be on the phone with the vet immediately. After Shadow's near-death experience with the saddle thrombus, Marcus isn't taking chances with any symptom that could be serious. The takeaway on respiratory health. Respiratory problems in cats range from minor annoyances to life-threatening emergencies. The key is knowing what's normal for your cat, recognizing when symptoms cross from mild to concerning, and acting quickly when needed. Most respiratory issues are treatable, especially when caught early. A cat with a URI will likely recover fully with supportive care. A cat with asthma can live comfortably with proper medication. Even serious conditions like pneumonia can be successfully treated if addressed quickly. What you absolutely cannot do is ignore respiratory distress. A cat struggling to breathe is a cat in crisis. Don't wait. Don't hope it gets better on its own. Get to a vet immediately. And for the minor symptoms, the occasional sneeze or the rare cough, stay alert but don't panic. Monitor, make note of patterns, and consult your vet when symptoms persist or worsen. You're learning. Your cat's normal, and that knowledge is the foundation of good health care. Chapter 6. The Big Three: Diabetes, Kidney Disease, Hyperthyroidism. If your cat lives long enough, there's a decent chance they'll develop at least one of what veterinarians call the Big Three chronic diseases of senior cats: diabetes mellitus, chronic kidney disease, or hyperthyroidism. These three conditions are so common in older cats that some vets joke every senior cat either has one, will get one, or is being screened for one. According to a study published in the Journal of Veterinary Internal Medicine, approximately 30 to 40% of cats over age 10 will develop at least one of these conditions. The good news? All three are manageable with early detection and proper treatment. Cats with these diseases can live for years with good quality of life. The bad news? Left untreated, all three can be fatal. And the symptoms can be subtle at first, easy to dismiss as normal aging. By the end of this chapter, you'll know exactly what to watch for, how these diseases are diagnosed and treated, and how to give your cat the best chance at a long, comfortable life, even with a chronic disease diagnosis. Diabetes mellitus, when blood sugar goes wrong. Let's start with diabetes. Feline diabetes is remarkably similar to type 2 diabetes in humans. The pancreas either doesn't produce enough insulin, or the body's cells become resistant to insulin, or both. Insulin is the hormone that allows cells to absorb glucose from the bloodstream for energy. Without adequate insulin function, glucose accumulates in the blood while cells starve for energy. Diabetes affects approximately 0.5 to 2% of cats, but the incidence is increasing, likely due to rising obesity rates. Overweight and obese cats are about 4 times more likely to develop diabetes than lean cats. Male cats are slightly more prone than females. Most diabetic cats are over age 7, with peak incidence between 10 and 13 years old. The classic symptoms of diabetes. There are 4 hallmark signs of diabetes in cats, and they're remarkably consistent. Increased thirst and urination. This is usually the first symptom owners notice. The cat drinks much more water than normal. You're refilling the water bowl constantly, and consequently, the cat urinates much more. The litter box clumps are huge, sometimes the size of a grapefruit. You're scooping enormous amounts of urine multiple times daily. Why does this happen? When blood glucose exceeds a certain threshold, the kidneys can't reabsorb it all, so glucose spills into the urine. Glucose in the urine pulls water with it through osmosis, causing excessive urination. The cat becomes dehydrated from all this urination and drinks excessively to compensate. Increased appetite with weight loss. Many diabetic cats eat ravenously yet lose weight. This seems paradoxical, but makes sense when you understand the metabolic problem. The cat cells are starving because glucose can't enter without insulin. The brain interprets this as starvation and signals increased hunger. The cat eats more, but the calories can't be used properly, so the cat loses weight despite eating. Some diabetic cats have decreased appetite instead, especially if they've progressed to ketoacidosis, a dangerous complication we'll discuss shortly. Weakness in the hind legs. Some diabetic cats develop a condition called diabetic neuropathy. They walk with their hocks touching the ground instead of up on their toes. This gives them a plantigrade stance, like they're walking on their ankles. It looks like weakness or lameness in the back legs. This happens because chronically elevated blood sugar damages peripheral nerves. Poor coat condition. Diabetic cats often have dull, unkempt fur. They may stop grooming themselves properly. Some develop dandruff or matted fur, especially along the back. Rachel noticed Miso was drinking more water about 6 months ago. Rachel thought maybe it was the summer heat, but then Rachel started finding enormous urine clumps in the litter box. Miso was also eating like she was starving but seemed thinner. Rachel took Miso to the vet. Blood work showed a glucose level of 420 mdl. Normal is 70 to 150. Miso was diabetic. Diagnosing diabetes. Diagnosis is straightforward. Blood glucose is measured. A single elevated reading can indicate diabetes, but stress can temporarily raise glucose in cats. That's why vets often measure fructosamine, which reflects average glucose over the past 2 to 3 weeks and isn't affected by stress. Urinalysis shows glucose in the urine, confirming that blood glucose is high enough to spill into urine. Once diabetes is diagnosed, The vet checks for underlying causes and complications. Pancreatitis can trigger diabetes. Infections can worsen glucose control. Hyperthyroidism often coexists with diabetes. Kidney disease may be present. Blood work evaluates organ function. Urinalysis checks for urinary tract. Infection, which is common in diabetic cats because glucose in urine feeds bacterial growth. Treating diabetes, insulin and diet. Treatment centers on insulin therapy and dietary management. Most diabetic cats require insulin injections twice daily for life. The thought of giving injections terrifies many owners, but the needles are tiny. The injections are subcutaneous, under the skin, not into muscle, and most cats tolerate them remarkably well. The most commonly used insulin for cats is glargine, Lantus, a long-acting insulin given every 12 hours. Detamir, Levemir, is another long-acting option. Some cats do well on Pro-Zinc, a veterinary insulin specifically formulated for cats. The vet determines which insulin and what dose based on the individual cat. Insulin dosing requires careful regulation. Too much insulin causes hypoglycemia or low blood sugar, which can be fatal. Too little insulin doesn't control the diabetes. The goal is finding the right dose to keep blood. Glucose in an acceptable range, typically 100 to 250 mmHg for most of the day. Initially, the cat returns to the vet every 1 to 2 weeks for glucose curves, where blood glucose is measured every 2 hours throughout the day to see how the insulin is working. The dose is adjusted based on these curves. Once regulated, curves are done every 3 to 6 months or when symptoms change. Some owners learn to monitor glucose at home using a glucometer designed for pets. A tiny drop of blood from the ear provides a reading. Home monitoring allows more frequent checks without the stress of vet visits, which can artificially elevate glucose. Diet is the other crucial component. Diabetic cats need a high-protein, low-carbohydrate diet. Cats are obligate carnivores designed to eat meat, not grains. High-carb diets cause glucose spikes. Low-carb diets stabilize blood sugar and can reduce insulin requirements. Many diabetic cats eat prescription diabetic diets like Hill's MD or Royal Canin Diabetic. Canned food is generally better than dry because it's lower in carbohydrates. Feeding schedule matters. The cat should eat at the same times daily, coordinated with insulin injections. Typically, you feed the cat, ensure they eat, then give insulin. Never give insulin to a cat who hasn't eaten because without food, the insulin will drop blood sugar dangerously low. Weight loss in overweight cats dramatically improves diabetes. Some obese cats who lose weight and eat low-carb diets go into remission, meaning they no longer need insulin. This isn't a cure. The diabetes can recur, but it's an incredible outcome. Studies show that 30 to 50% of diabetic cats can achieve remission with aggressive diet management and weight loss, especially if treated early. Rachel committed fully to managing Miso's diabetes. Miso gets insulin twice daily, exactly 12 hours apart. Rachel sets alarms so she never misses a dose. Miso eats a prescription diabetic diet, canned food only. Rachel measures, portions carefully. Miso has lost weight gradually, going from 14 pounds down to 11 pounds over 6 months. Miso's insulin needs have decreased. The vet is hopeful that if Miso loses another pound, she might go into remission. Complications of diabetes. Diabetic ketoacidosis, or DKA, is a life-threatening complication where the body breaks down fat for energy in the absence of functional insulin, producing ketones. Ketones make the blood acidic. Symptoms include severe lethargy, vomiting, rapid breathing, dehydration, and sometimes a sweet or fruity odor to the breath. DKA is an emergency requiring hospitalization with IV fluids, insulin, and intensive monitoring. It's often what happens when diabetes goes undiagnosed for a long time, or when a diabetic cat's insulin therapy is inadequate. Hypoglycemia from too much insulin causes weakness, disorientation, seizures, and potentially death. If your diabetic cat suddenly seems weak, wobbly, or has seizures, this is an emergency. Rubby, Caro syrup or honey on their gums to raise blood sugar immediately and get to a vet. Diabetic neuropathy causing the plantigrade stance usually improves once diabetes is controlled, though it can take months. Urinary tract infections are common in diabetic cats and need treatment with antibiotics. Living with a diabetic cat. Diabetes is a serious commitment. You must be home twice daily to give insulin. You can't skip doses. Vacations require planning, either bringing your cat, having someone stay at your house who can give injections, or boarding at a facility experienced with diabetic cats. The financial commitment is real. Insulin costs $100 to $300 per bottle, lasting 2 to 4 months. Syringes cost about $20 for $100. Prescription food runs $40 to $80 monthly. Vet visits for monitoring cost $150 to $300 each time. Annual costs can easily reach $1,500 to $3,000. But here's the important part. Diabetic cats who are well managed can live for years with excellent quality of life. They feel good, have energy, enjoy playing, and maintain normal behavior. The disease is controlled, not cured, but controlled can mean a happy life. Sarah's friend has a diabetic cat who's been on insulin for 5 years. The cat is 16 now, still playful, still cuddly, still very much enjoying life. Yes, it requires commitment. Yes, there are challenges. But for people who love their cats, it's absolutely worth it. Chronic kidney disease, the silent epidemic. Now let's talk about chronic kidney disease, or CKD. This is arguably the most common serious disease in older cats. Studies estimate that 30 to 40% of cats over age 10 have some degree of kidney disease, and the percentage increases with age. By age 15, more than half of cats have CKD. The kidneys perform critical functions, filtering waste from blood, regulating blood pressure, maintaining electrolyte balance, producing hormones that stimulate red blood cell production, and activating vitamin D. When kidneys fail, all these functions deteriorate. CKD is progressive and irreversible. Once kidney tissue is damaged, it can't regenerate. The disease advances from mild to moderate to severe to end-stage kidney failure. However, the progression can be slowed dramatically with proper management. Many cats live for years with CKD, maintaining good quality of life. Causes of kidney disease. Often we don't know what caused the kidney disease. It just develops as cats age, possibly from cumulative minor damage over time. Some specific causes include genetics. Certain breeds like Persians and Abyssinians are predisposed. Polycystic kidney disease, an inherited condition, causes progressive kidney failure. Chronic dehydration and urinary issues. Cats who don't drink enough water over years may gradually damage their kidneys. High blood pressure. Hypertension damages kidney tissue. Dental disease and chronic infections. Bacteria from infected teeth or gums can seed the kidneys. Toxin exposure. Lilies cause acute kidney failure that can progress to chronic disease. Antifreeze is nephrotoxic. Some medications like NSAIDs can damage kidneys, kidney infections or stones, cancer affecting the kidneys. The early stages are silent. Here's the cruel thing about kidney disease. Symptoms don't appear until about 75% of kidney function is lost. The kidneys have enormous reserve capacity. They can continue filtering blood adequately even when significantly damaged. By the time a cat shows symptoms, the disease is already advanced. This is why senior wellness screenings with blood work are so important. Blood work can detect kidney disease before symptoms appear, when intervention is most effective. The earliest sign of kidney disease on blood work is elevated creatinine and BUN, blood urea nitrogen. These are waste products the kidneys filter out. When they accumulate in blood, it indicates decreased kidney function. A newer test called SDMA, symmetric dimethylarginine, can detect kidney disease even earlier than creatinine, sometimes when only 40% of function is lost. Symptoms of kidney disease. When symptoms do appear, they include increased thirst and urination. Sound familiar? This overlaps with diabetes symptoms. Failing kidneys can't concentrate urine properly, so the cat produces large volumes of dilute urine and drinks excessively to compensate. Weight loss and poor body condition. Cats with CKD lose muscle mass and become thin despite eating. Decreased appetite. Toxins building up in the blood cause nausea. Many cats with CKD eat poorly, vomiting. Uremic toxins irritate the stomach lining, lethargy and weakness, bad breath. Uremic breath has a characteristic ammonia-like smell. Poor coat quality, mouth ulcers. Uremic toxins cause painful ulcers on the tongue and gums. In advanced stages, cats may become severely depressed, stop eating entirely, vomit frequently, and deteriorate rapidly. Jennifer noticed Bella was drinking more water around age 12. Bella also seemed thinner despite eating normally. Jennifer mentioned it at Bella's annual exam. Blood work showed elevated creatinine and BUN. Bella was in early stage 2 kidney disease. The vet explained that catching it at this stage was excellent because they could intervene to slow progression. Staging kidney disease. The International Renal Interest Society, IRIS, stages CKD from 1 to 4 based on blood creatinine levels and clinical signs. Stage 1, creatinine normal or borderline high. No symptoms. May have abnormal kidney structure on ultrasound or biopsy. Stage 2, mild kidney disease. Creatinine 1.6 to 2.8 mcDowell. Minimal or no symptoms, often detected on routine screening. Stage 3, moderate kidney disease. Creatinine 2.9 to 5.0 growing diarrhea. Symptoms like increased thirst, weight loss, occasional vomiting. Stage 4, severe kidney disease. Creatinine over 5.0 mDOL. Significant symptoms, poor quality of life. End-stage disease. Additionally, each stage is substaged based on protein in the urine, proteinuria, and blood pressure, both of which affect prognosis and treatment. Treating kidney disease. CKD can't be cured, but progression can be slowed. Treatment goals are preserving remaining kidney function, managing symptoms, and maintaining quality of life. Dietary management is the cornerstone. Prescription kidney diets are formulated with reduced protein, phosphorus, and sodium. Lower protein reduces the workload on kidneys. Reduced phosphorus prevents secondary hyperparathyroidism, a common complication. Studies show that cats eating kidney diets live significantly longer than cats eating regular food. The catch? Many kidney diets are not very palatable. Getting a sick cat who's already nauseous to eat food they don't like is challenging. Some cats refuse kidney diets entirely. The vet may suggest warming the food, adding flavor enhancers like Fortiflora, offering multiple kidney diet brands to find one the cat accepts, or compromising with a higher quality regular diet if the cat absolutely won't eat prescription food. A cat eating regular food is better than a cat not eating at all. Hydration is critical. Many cats with CKD receive subcutaneous fluid therapy at home. The owner learns to give fluids under the skin, typically 100 to 200 ml every 1 to 3 days. This keeps the cat hydrated, helps flush toxins, and makes them feel better. It sounds daunting, but most owners become proficient quickly, and most cats tolerate it well. Phosphate binders reduce phosphorus absorption from food. Given with meals, they bind phosphorus in the intestines, so it's excreted rather than absorbed. This protects the kidneys and prevents complications. Medications address specific problems. ACE inhibitors, or ARBs, reduce proteinuria and blood pressure. Famotidine or omeprazole reduce stomach acid and nausea. Maropitant, Cerenia, treats nausea and vomiting. Erythropoietin or darbepoetin treat anemia from decreased red blood cell production. Calcitriol, active vitamin D, prevents secondary hyperparathyroidism. Blood pressure, monitoring, and control prevent further kidney damage and protect other organs like the eyes and brain. Regular monitoring with blood work every 3 to 6 months tracks disease progression and guides treatment adjustments. Jennifer committed to managing Bella's kidney disease aggressively. Bella eats a kidney diet, though it took weeks to find one Bella would accept. Jennifer gives Bella subcutaneous fluids 3 times weekly, 150 ml each time. Bella takes a phosphate binder with meals and an ACE inhibitor for proteinuria. Bella has been stable for 3 years now. Her creatinine has increased slightly from 2.1 to 2.5, but she's still in stage 2. She feels good, plays, has energy, and maintains decent weight. The vet is pleased with how well Bella's doing and attributes it to Jennifer's dedication to treatment when kidney disease progresses. Despite best efforts, CKD eventually progresses in most cats. The kidneys continue losing function, creatinine rises, symptoms worsen, quality of life declines. End-stage kidney disease is heartbreaking. The cat stops eating despite appetite stimulants. Vomiting becomes constant. Mouth ulcers are painful. The cat is lethargic, weak, and clearly suffering. At this point, many owners choose euthanasia to prevent suffering. Some owners pursue dialysis or kidney transplant. Dialysis is available at specialty centers, but requires repeated sessions and is extremely expensive. Kidney transplant is performed at a few veterinary teaching hospitals. It costs $15,000 to $25,000, requires lifelong immunosuppressant medications, and has risks. Some cats do well post-transplant and live for years. Others have complications. It's a very personal decision based on finances, the cat's overall health, and owner commitment. Hyperthyroidism, the metabolism gone wild. The third member of the big 3 is hyperthyroidism. This is the most common endocrine disorder in older cats, affecting approximately 10% of cats over age 10. The thyroid gland, located in the neck, produces thyroid hormone which regulates metabolism. In hyperthyroid cats, the thyroid becomes overactive and produces excessive hormone, sending metabolism into overdrive. In over 98% of cases, hyperthyroidism is caused by benign enlargement of the thyroid gland called adenomatous hyperplasia. Thyroid cancer is rare. We don't know exactly why thyroid glands become hyperactive in older cats, though dietary factors, environmental toxins, and genetics may play a role. The classic hyperthyroid cat. Hyperthyroid cats have a distinctive presentation, ravenous appetite with weight loss. This is the hallmark. The cat eats voraciously, constantly begging for food, yet loses weight. Metabolism is running so fast they burn calories faster than they can consume them. Hyperactivity and restlessness. Hyperthyroid cats are often described as wired. They pace, vocalize, seem unable to settle. Some owners say their old cat acts like a kitten again, which seems positive until you realize it's pathological. Increased thirst and urination. Again, overlap with the other conditions. Vomiting and diarrhea. The GI tract is overstimulated. Poor coat quality. Despite increased grooming, the fur becomes unkempt, greasy, or matted. Behavior changes. Some hyperthyroid cats become irritable or aggressive. Others become more vocal, yowling frequently, increased heart rate and blood pressure. Thyroid hormone stimulates the cardiovascular system. Over time, this can cause heart disease. Marcus noticed Shadow was eating everything in sight but losing weight. Shadow had always been a calm, sedate cat, but suddenly at age 13, Shadow was pacing around constantly, meowing loudly, acting agitated. Shadow's fur looked terrible despite grooming. Marcus took Shadow to the vet. A blood test measuring total T4, the thyroid hormone level, was elevated at 8.5 mcg/dl. Normal is 1.0 to 4.0. Shadow was hyperthyroid, diagnosing hyperthyroidism. Diagnosis is simple. Blood work measures total T4, thyroxine. Elevated T4 confirms hyperthyroidism. Sometimes early or mild cases have T4 in the high normal range. The vet may recommend repeat testing in a few weeks or measure free T4, which can be more sensitive. Physical exam often reveals an enlarged thyroid gland, palpable as a lump on the ventral neck. The vet also checks heart rate, blood pressure, and body condition. Blood work checks kidney function because treating hyperthyroidism can unmask underlying kidney disease. The high metabolism from hyperthyroidism increases blood flow through the kidneys, which can temporarily inflate kidney function values. When hyperthyroidism is treated and metabolism normalizes, kidney values may worsen, revealing CKD that was there all along. Treatment options for hyperthyroidism. Hyperthyroidism has 4 treatment options, each with pros and cons. 1. Medication, methimazole. Methimazole is a drug that blocks thyroid hormone production. It's given orally, pill or liquid, or as a transdermal gel applied to the ear. It doesn't cure hyperthyroidism, but controls it by suppressing hormone production. Pros: non-invasive, reversible, relatively inexpensive initially, $30 to $60 monthly for medication, allows monitoring kidney function before committing to permanent treatment. Cons: requires lifelong twice-daily medication. Some cats develop side effects like vomiting, poor appetite, or facial itching. Rarely serious side effects like liver problems or bone marrow suppression occur. Requires regular monitoring with blood work every 3 to 6 months. 2. Surgery. Thyroidectomy. Surgical removal of the thyroid gland cures hyperthyroidism. Pros: permanent cure. No lifelong medication. Cost-effective long-term. Cons: requires anesthesia, which carries risk in older cats. Risk of damaging parathyroid glands located near the thyroid, causing life-threatening low calcium. Post-surgical complications include temporary or permanent hypothyroidism requiring supplementation. If cancer is present, rare, surgery may not be curative. 3. Radioactive iodine therapy, I-131. This is considered the gold standard treatment. Radioactive iodine is injected once. It's taken up by the overactive thyroid tissue and destroys it, while sparing normal tissue and surrounding structures. It cures hyperthyroidism in over 95% of cats with a single treatment. Pros: highly effective, no anesthesia needed, minimal side effects, cures the disease, no daily medication. Cons: expensive upfront cost, $2,500 to $2,500. Requires hospitalization at a specialty facility for 1 to 3 weeks until radiation levels decrease enough for the cat to safely go home. Some owners find the separation stressful. Small risk of causing hypothyroidism requiring supplementation. May unmask kidney disease. 4. Prescription diet. Hills YD, a prescription diet. Severely restricted in iodine can control hyperthyroidism because the thyroid needs iodine to produce hormone. Without dietary iodine, hormone production decreases. Pros: non-invasive, reversible, simple. Cons: the cat can eat absolutely nothing else. No treats, no other food, no hunting. In multi-cat households, preventing the hyperthyroid cat from eating other cats' food is challenging. If the cat stops eating YD, hyperthyroidism returns immediately. Not all cats accept the diet. Lifelong commitment to strict feeding. Marcus chose methimazole for Shadow initially. Shadow takes a pill twice daily. After 2 months on medication, Shadow's T4 normalized. Shadow gained back lost weight, stopped pacing, and seems much calmer. Blood work showed Shadow's kidney values were still normal, which was good news. Marcus is now considering radioactive iodine for a permanent cure. The vet explained that since Shadow's kidneys handled the medication trial well, radioactive iodine is likely safe and would eliminate the need for pills forever. Marcus is saving up for the procedure and plans to do it in the next 6 months. The overlap, when diseases coexist. Here's a complicating factor. These 3 diseases often occur together. A cat can have kidney disease and hyperthyroidism simultaneously, or diabetes and kidney disease. Managing multiple conditions requires careful balancing. For example, treating hyperthyroidism in a cat with kidney disease can worsen the kidney disease because normalizing metabolism reduces blood flow through the kidneys. The vet must carefully monitor kidney function while treating hyperthyroidism, sometimes accepting slightly elevated thyroid levels to protect the kidneys. Diabetic cats with kidney disease need insulin dosing adjusted because the kidneys clear insulin from the blood. Kidney disease affects fluid balance, which affects diabetes management. Hyperthyroid cats often have secondary heart disease from prolonged high heart rate and blood pressure. Treating the hyperthyroidism helps the heart, but if heart disease is advanced, the cat may need cardiac medications alongside hyperthyroid treatment. This is why comprehensive care from an experienced vet is essential. These conditions interact in complex ways, and treatment must be individualized. Monitoring senior cats. Early detection saves lives. The theme throughout this chapter is clear. Early detection dramatically improves outcomes. Cats diagnosed with stage 2 kidney disease live much longer than cats diagnosed at stage 4. Diabetic cats treated early have higher remission rates. Hyperthyroid cats treated before severe heart disease develops have better long-term health. Senior wellness screening is your best tool for early detection. For cats over age 7, annual blood work is reasonable. For cats over age 10, blood work every 6 months is ideal. This typically includes a complete blood count, chemistry panel to check organ function, thyroid testing, and urinalysis. Yes, it costs money. Annual senior screening runs $200 to $400. But consider this. Catching kidney disease at stage 2 instead of stage 4 could give your cat years of quality life. Diagnosing diabetes early improves the chance of remission, potentially saving thousands in long-term insulin costs. Detecting hyperthyroidism before heart damage occurs prevents cardiac complications. Lisa now does senior wellness screening for Oliver every 6 months. Oliver is 13 and so far healthy. Each time the blood work comes back normal, Lisa breathes a sigh of relief, but she knows that sooner or later, something will show up. When it does, catching it early will give Oliver the best chance. The emotional reality of chronic disease. Managing chronic disease in a cat is emotionally challenging. There's the initial shock of diagnosis, the fear of losing your cat, the guilt about whether you could have prevented it, the stress of treatment regimens, the financial burden, the grief as the disease progresses despite your best efforts. But there's also hope. Modern veterinary medicine can manage these diseases remarkably well. Diabetic cats can live for years with good glucose control. Cats with kidney disease can remain stable for years with proper treatment. Hyperthyroid cats can be cured completely. Your cat can still have quality of life. They can still play, cuddle, enjoy treats, bask in sunny spots. The disease becomes part of your routine, but it doesn't have to define your cat's life. And you're not alone. Online communities for owners of diabetic cats, cats with CKD, and hyperthyroid cats provide incredible support. People share experiences, troubleshoot problems, celebrate victories, and offer comfort during difficult times. Tap into these resources. Be kind to yourself. You're doing your best. Some days will be hard. Some days you'll mess up. Forget a medication, miss a symptom, make a wrong decision. That's being human. What matters is that you keep trying, keep learning, keep loving your cat. Your action plan for chronic disease prevention and management. Prevention strategies. Maintain healthy weight through portion control and exercise. Feed high-quality, species-appropriate diet. Ensure adequate hydration with canned food and multiple water sources. Regular dental care to prevent infections. Avoid toxin exposure. Annual or semi-annual wellness screening for early detection. If your cat is diagnosed, partner with your vet for a comprehensive treatment plan. Educate yourself about the disease. Follow treatment recommendations consistently. Monitor your cat closely and communicate changes to your vet. Keep detailed records of medications, symptoms, and progression. Set up systems for medication schedules and reminders. Prepare financially for ongoing costs. For quality of life, focus on what your cat can still enjoy. Adjust environment as needed for comfort. Continue play and enrichment as energy allows. Watch for signs of Suffering, and be prepared to make end-of-life decisions if quality declines. Celebrate good days and small victories. Chapter 7. Arthritis, Dental Disease, and Pain Recognition. Pain in cats is one of the most under-recognized and undertreated problems in feline medicine. Cats are masters at hiding discomfort. It's an evolutionary survival mechanism. In the wild, showing weakness makes you prey. But in our homes, this stoicism means cats suffer silently, while their owners remain completely unaware. Studies have shown that over 90% of cats over age 12 have radiographic evidence of arthritis. Yet most owners don't recognize their cat is in pain. Dental disease affects up to 85% of cats over age 3, causing chronic pain that goes unnoticed. By the end of this chapter, you'll learn to recognize the subtle signs of pain in cats, understand the most common painful conditions, and know how to advocate for pain management that can transform your cat's quality of life. Why cats hide pain so effectively. Cats evolved as both predators and prey. In the wild, showing pain signals vulnerability to larger predators. A limping cat is an easy target. A cat moving slowly due to arthritis won't catch prey efficiently. Natural selection favored cats who could mask pain and continue appearing normal despite injury or illness. This survival mechanism persists in domestic cats. They instinctively hide pain even when there's no predator threat. By the time a cat shows obvious signs of pain, they're usually in severe distress. Subtle signs appear much earlier, but most owners aren't trained to recognize them. Research from North Carolina State University's Center for Pain Management found that veterinarians often miss pain in cats too. In one study, vets assessed cats as pain-free when objective pain scoring systems indicated moderate to severe pain. If professionals struggle to recognize feline pain, it's no wonder owners do too. The subtle signs of pain in cats. Obvious signs, like crying, limping severely, or complete inability to move, get noticed. But cats rarely show these obvious signs until pain is extreme. Most chronic pain presents much more subtly. Behavior changes, decreased activity and playfulness, sleeping more than usual or in unusual places, reluctance to jump up or down from furniture, using stairs less frequently or going up-down differently, hesitating before jumping, avoiding favorite high perches, increased hiding, decreased interaction with family, irritability or aggression when touched, especially in specific areas, changes in grooming, either decreased grooming or excessive grooming of painful areas, mobility changes, stiff gait, especially after resting, shortened stride, bunny hopping instead of normal running, difficulty getting in, out of litter box, eliminating outside the litter box because the box is hard to access, difficulty posturing to urinate or defecate, reluctance to be picked up or held, facial expression changes, squinting eyes, flattened ears, tense facial muscles, whiskers pointing forward or pulled back, appetite and drinking changes, decreased appetite because eating hurts, dental pain, approaching food bowl but not eating, dropping food while eating, difficulty chewing or preference for soft food, messy eating, grooming changes, unkempt coat, matted fur, especially on the back where the cat can't reach due to arthritis, over-grooming specific areas that hurt, bald patches from excessive licking. Jennifer noticed Bella wasn't jumping up on the bed anymore at age 14. Jennifer thought Bella was just getting old and lazy. But then Jennifer noticed Bella hesitated before jumping on the couch too. Bella was using the litter box less frequently, and sometimes Bella eliminated right next to the box instead of inside it. When Jennifer took Bella to the vet for an unrelated issue, she mentioned these changes. The vet examined Bella and found significant arthritis in the hips and spine. Bella wasn't lazy. She was in pain, arthritis, the silent epidemic. Degenerative joint disease, or arthritis, is extremely common in senior cats. Studies using radiographs show that over 90% of cats over age 12 have arthritis in at least one joint. Yet only about 13% of arthritic cats receive pain medication. This massive gap between disease prevalence and treatment indicates how often arthritis goes unrecognized. Arthritis develops when cartilage in joints breaks down. Cartilage normally cushions bones, allowing smooth, pain-free movement. As cartilage degrades, bones rub together, causing inflammation, pain, and further damage. The condition is progressive and incurable, but manageable. Common sites for feline arthritis include the hips, elbows, spine, and knees. Cats who've had injuries or joint trauma are at higher risk. Overweight cats have increased joint stress, accelerating arthritis development. Some breeds like Maine Coons and Persians may be genetically predisposed to hip dysplasia, which leads to arthritis. Diagnosing arthritis. Diagnosis combines clinical signs and imaging. The vet watches the cat walk, feels joints for swelling or pain, and manipulates joints to assess range of motion and discomfort. Radiographs show characteristic changes: joint space narrowing, bone spurs, and irregular joint surfaces. However, the degree of radiographic change doesn't always correlate with pain severity. Some cats with severe arthritis on X-rays function relatively well. Others with mild radiographic changes are in significant pain. This is why veterinarians increasingly use quality-of-life questionnaires, asking owners about specific behaviors like jumping, playing, and grooming. Rachel noticed Miso stopped playing with her favorite feather toy. Miso used to leap and pounce enthusiastically. Now Miso watched the toy but didn't chase it. Rachel also noticed Miso's fur along her back was matted. Miso always groomed meticulously, so this was unusual. At the vet visit, Rachel mentioned these changes. The vet examined Miso and felt crepitus, a crackling sensation, in Miso's elbows and hips. Radiographs confirmed moderate arthritis. The vet explained that Miso wasn't playing because jumping and pouncing hurt. The matted fur was because Miso couldn't twist her spine comfortably to groom her back. Treating arthritis, multimodal approach. Arthritis can't be cured, but pain can be managed effectively using a combination of approaches. Weight management. Every extra pound increases joint stress. Weight loss in overweight arthritic cats significantly reduces pain and improves mobility. Studies show that weight loss alone can decrease lameness by 50% in some cats. Environmental modification. Make life easier for arthritic cats. Provide ramps or steps to favorite high spots. Use litter boxes with low sides for easy entry. Place food, water, and litter on the same floor level to minimize stairs. Provide soft, padded beds in warm locations. Place resources where the cat spends time so they don't have to seek them out. Physical therapy and exercise. Gentle, regular movement maintains joint flexibility and muscle mass. Encourage play at a level the cat can tolerate. Swimming or underwater treadmill therapy is available at some specialty centers. Supplements. Glucosamine and chondroitin may support joint health, though evidence in cats is limited. Omega-3 fatty acids have anti-inflammatory properties. Prescription diets like Hill's JD are formulated with high omega-3 levels. Audaquan is an injectable polysulfated glycosaminoglycan, given twice weekly initially, then monthly for maintenance. Some cats show significant improvement. NSAIDs, non-steroidal anti-inflammatory drugs. These are the most effective medications for arthritis pain. Meloxicam, Metacam, is the most commonly used NSAID in cats. It's given orally, initially daily, then many cats can transition to 2 to 3 times weekly maintenance dosing. However, NSAIDs carry risks in cats. They can cause kidney damage and GI ulceration. Cats on NSAIDs need regular blood work monitoring kidney and liver function. NSAIDs are contraindicated in cats with kidney disease, which is problematic since many senior cats have both arthritis and CKD. Other pain medications, gabapentin, an anti-seizure medication, is effective for chronic pain. It's well tolerated in cats and safe with kidney disease. Buprenorphine, an opioid, provides strong pain relief. It's given as an oral transmucosal liquid or as a long-acting injection. Simbadol. Tramadol is sometimes used but is less effective in cats than in dogs due to metabolic differences. Solensia, frunevetmab. This is a newer treatment, a monoclonal antibody injection given monthly that blocks nerve growth factor, reducing arthritis pain. Studies show significant improvement in mobility and activity. It's expensive, $75 to $150 monthly, but very safe, even in cats with kidney disease. Adequan injections. Polysulfated glycosaminoglycan injections help rebuild cartilage and have anti-inflammatory effects. Most arthritic cats benefit from combining several approaches: weight management, environmental modification, supplements, and pain medication. The vet adjusts treatment based on the individual cat's response. After Miso's arthritis diagnosis, Rachel implemented multiple strategies. Miso went on a weight loss plan, losing 2 pounds over 4 months. Rachel added steps to the bed and couch. Rachel bought low-sided litter boxes. Miso started gabapentin twice daily and received Solensia injections monthly. The improvement was dramatic. Within 3 weeks, Miso was playing again, grooming normally, and seemed much more comfortable. Rachel wishes she'd recognized the signs sooner, but is grateful that Miso is now pain-free. Dental disease. The painful truth. Dental disease is one of the most common and painful conditions affecting cats, yet it's often dismissed as cosmetic or minor. The reality is that dental pain significantly impacts quality of life, and severe dental disease can cause systemic illness affecting the heart, kidneys, and liver. By age 3, approximately 70% of cats have some degree of dental disease. By age 10, nearly 85% have dental problems. The disease progresses in stages. Stage 1, gingivitis. The gums are inflamed and red, especially at the gum line. There's plaque and tartar buildup. This stage is reversible with cleaning. Stage 2, early periodontal disease. Gums recede slightly. Tartar is moderate. Some bone loss may be visible on dental radiographs. Stage 3, moderate periodontal disease. Gums recede significantly. Teeth may be loose. Bone loss is evident. Infection and pain are present. Stage 4, advanced periodontal disease. Severe bone loss, loose teeth, oral pain, risk of jaw fracture, systemic spread of infection, tooth resorption, a unique feline problem. Cats develop a painful condition called tooth resorption, where the tooth structure breaks down from the inside. It's similar to cavities in humans, but caused by different mechanisms. Resorptive lesions occur in 20 to 70% of cats, depending on age. Resorption begins at the gum line or below, eating away at the tooth. Eventually, the crown breaks off, leaving painful roots behind. Affected teeth are extremely painful, but often look relatively normal externally. Dental radiographs are essential to diagnose resorption. Treatment requires extraction of affected teeth. There's no way to repair resorptive lesions. Stomatitis, severe oral inflammation. Some cats develop stomatitis, severe inflammation throughout the mouth. The cause isn't fully understood, but likely involves immune system dysfunction, possibly triggered by dental plaque, calicivirus, or other factors. Cats with stomatitis have intensely painful, inflamed gums and oral tissues. They drool, have terrible breath, paw at their mouths, stop eating, and lose weight. Treatment often requires extracting most or all teeth, full mouth extraction. It sounds drastic, but cats do remarkably well without teeth. They can eat canned food and their pain resolves. Signs your cat has dental pain. Cats rarely show obvious signs like pawing at their mouth or crying. Instead, watch for bad breath, worse than typical cat breath, decreased appetite or eating less, preferring soft food over dry, chewing on one side of the mouth, dropping food while eating, drooling, especially if tinged with blood, swelling of the face or jaw, bleeding from the mouth, pawing at the mouth, weight loss, unkempt fur from decreased grooming, behavior changes like hiding or irritability. Marcus noticed Shadow had terrible breath. Marcus also noticed Shadow would approach the food bowl, sniff the food, then walk away without eating. Eventually, Shadow would eat, but hesitantly, chewing carefully on the right side. Marcus took Shadow to the vet. Dental exam revealed severe gingivitis, multiple loose teeth, and 2 teeth with resorptive lesions. Shadow needed dental cleaning and extraction of 4 teeth. After the procedure and pain medication, Shadow's appetite returned immediately. Shadow started eating enthusiastically. Marcus realized Shadow had been in pain for months, probably years, and Marcus never knew. Dental cleaning and home care. Professional dental cleaning under anesthesia is the only way to properly clean a cat's teeth and address dental disease. The vet scales tartar from tooth surfaces, cleans below the gum line where disease starts, takes dental radiographs to identify hidden problems, and extracts diseased teeth. Anesthesia scares many owners, especially for senior cats. But modern anesthesia protocols are very safe. Pre-anesthetic blood work identifies cats at higher risk. Monitoring during anesthesia tracks vital signs. The benefits of addressing painful dental disease far outweigh anesthesia risks in most cases. Anesthesia-free dentistry, sometimes offered at pet stores or grooming facilities, is not recommended. It's purely cosmetic, cleaning only visible surfaces while leaving disease below the gum line untreated. It doesn't address pain or pathology. The cat endures restraint and fear without receiving actual dental care. Veterinary dental organizations strongly oppose anesthesia-free dentistry. After professional cleaning, home dental care can slow tartar accumulation. This includes daily toothbrushing with cat-specific toothpaste. Start slowly getting the cat used to having their mouth touched before introducing the brush. Dental treats and foods designed to reduce tartar, though less effective than brushing. Water additives that reduce bacterial growth. Prescription dental diets like Hill's TD that mechanically clean teeth as the cat chews. However, even with home care, most cats need professional cleaning every 1 to 3 years. Cats with dental disease history may need annual cleanings, pain recognition beyond arthritis, and dental disease. Arthritis and dental disease are the most common sources of chronic pain, but cats experience pain from many conditions. Cancer pain. Tumors can cause pain through invasion of surrounding tissues, pressure on nerves, or associated inflammation. Oral tumors are especially painful. Urinary pain. Cystitis, bladder stones, and urinary infections cause significant pain. We discuss this in the urinary chapter. Digestive pain, pancreatitis, inflammatory bowel disease, and GI obstructions are painful. Post-surgical pain. Any surgery causes pain requiring medication for days to weeks afterward. Trauma pain. Injuries from falls, fights, or accidents cause pain requiring treatment. The key message is this: if a condition would be painful in humans, it's painful in cats. Just because your cat isn't crying doesn't mean they're not hurting. The pain scale, assessing severity. Veterinary pain scales help assess pain severity objectively. The Glasgow Feline Composite. Measure Pain Scale is one validated tool. It scores cats on posture, comfort, vocalization, response to touch, and behavior. Owners can use simplified pain assessment at home. 0 to 1, no pain, normal behavior and activity. 2 to 3, mild pain, slightly decreased activity but still eating, playing, grooming normally. 4 to 6, moderate pain, noticeably decreased activity, some behavior changes, may hide more, reduced appetite. 7 to 8, severe pain, marked decrease in activity, hiding, not eating, vocalizing, aggressive when touched. 9 to 10, extreme pain, non-responsive, crying, complete inactivity, not eating or drinking. Pain above 3 to 4 warrants veterinary evaluation and treatment. Never let your cat suffer thinking they'll get used to it, or that pain is normal aging. It's not. Pain deserves treatment. Pain medications for cats. What works and what doesn't? Effective pain management in cats requires medication, while environmental modifications help arthritis and dental care addresses tooth. pain, medication is essential for adequate pain relief. NSAIDs, meloxicam is most common. Robenacoxib is another option. These are very effective for inflammatory pain like arthritis and post-surgical pain. They require veterinary prescription and monitoring. Opioids. Buprenorphine is the most commonly used opioid in cats. It's very effective for moderate to severe pain. Side effects are minimal. It can be given as an oral transmucosal liquid or long-acting injection. Gabapentin. Excellent for chronic pain, especially neuropathic pain. Well tolerated. Safe in cats with kidney disease. Can cause sedation at higher doses, but this usually resolves with continued use. Tramadol. Less effective in cats than dogs due to poor metabolism. Some cats benefit, but many don't. Corticosteroids. Prednisolone can reduce inflammation and pain in some conditions like cancer, IBD, or severe arthritis. However, long-term use has side effects and steroids can't be combined with NSAIDs. Amantadine, sometimes used for chronic pain in combination with other medications. Silencia, monthly injection specifically for arthritis pain. Local anesthetics, used during procedures or for targeted nerve blocks. What doesn't work? Acetaminophen, Tylenol, is extremely toxic to cats and causes fatal liver damage. Ibuprofen, Advil, and naproxen, Aleve, are also toxic. Never give human pain medications to cats without explicit veterinary instruction. The culture of pain management is changing. Historically, veterinary medicine undertreated pain in cats. There was a belief that cats tolerated pain better than other species, or that pain served a purpose by limiting activity and promoting healing. We now know both ideas are wrong. Untreated pain causes suffering, delays healing, suppresses immune function, and decreases quality of life. Modern veterinary medicine embraces aggressive pain management. Pain is considered the fourth vital sign after temperature, heart rate, and respiratory rate. Cats undergoing surgery receive preemptive pain medication before the procedure, pain medication during, and pain medication to go home afterward. If your vet isn't addressing pain, advocate for your cat. Ask, "Is my cat in pain? What can we do about it?" Some vets still undertreat feline pain, but most will respond positively to owner concerns and adjust treatment accordingly. Lisa had Oliver's teeth cleaned and 4 teeth extracted. The vet sent Oliver home with 3 days of buprenorphine. Lisa was nervous about giving medication but wanted Oliver comfortable. The buprenorphine made a huge difference. Oliver was eating soft food that evening, seemed relaxed, and recovered quickly. Lisa realized that if she'd declined pain medication, Oliver would have suffered unnecessarily, when pain medication isn't enough. Sometimes pain is so severe or chronic that medication alone doesn't provide adequate relief. Additional strategies include laser therapy. Low-level laser reduces. Inflammation and pain in arthritis, wounds, and other conditions. Multiple treatments are needed, but many cats respond well. Acupuncture. Some cats tolerate acupuncture well and experience pain relief, especially for arthritis and chronic pain. Physical rehabilitation, therapeutic exercise, massage, and stretching can improve mobility and reduce pain. Palliative care. When pain is from untreatable conditions like cancer, the goal shifts to comfort rather than cure. This may include strong pain medications, steroids for appetite stimulation and pain relief, and environmental adjustments to maximize comfort. Euthanasia. When pain can't be adequately controlled despite maximal intervention, euthanasia may be the kindest option to prevent suffering. Creating a pain management plan. If your cat has chronic pain from arthritis, dental disease, cancer, or other conditions, work with your vet to create a comprehensive pain management plan. Identify all sources of pain. Treat what's treatable. Extract bad teeth, treat infections, address reversible conditions. Establish treatment goals. Is the goal complete pain freedom, improve mobility, better appetite? Define success. Implement multimodal treatment. Combine medications, supplements, environmental changes, and other therapies. Monitor and adjust. Pain management isn't one and done. It requires ongoing assessment and adjustment. Keep a journal of your cat's activity, appetite, and behavior. Share this with your vet to guide treatment changes. Balance pain relief with quality of life. Some pain medications cause sedation. Find the balance where pain is controlled but the cat remains alert and engaged. Plan for flare-ups. Have rescue medications on hand for bad days. Jennifer's comprehensive pain plan for Bella includes daily gabapentin, monthly Silencia injections, omega-3 supplementation, environmental modifications, and quarterly vet checks to monitor progress and adjust treatment. Bella also has buprenorphine on hand for occasional bad days when arthritis flares up. With this plan, Bella is comfortable, active, and enjoys life despite age 15 and moderate arthritis. The bottom line on pain is not normal. It's not just part of aging. It's not something cats need to endure. Effective pain management is available and dramatically improves quality of life. Your job as a cat owner is to recognize subtle signs of pain and advocate for treatment. Don't accept, "There's nothing we can do," or "They're just getting old." If your cat is less active, hiding more, eating less, grooming poorly, or showing any behavior changes, consider pain as a possible cause. Talk to your vet. If your vet dismisses your concerns, seek a second opinion. Your cat deserves to be comfortable. With modern pain management, most cats can achieve freedom from pain and maintain quality of life well into their senior years. Chapter 8. When behavior problems are actually health problems your cat has. Started peeing on your bed. Or they're suddenly aggressive when you try to pet them. Maybe they're hiding all the time or yowling at 3 a.m. or attacking your ankles when you walk by. Your first instinct is probably to think it's a behavior problem. Bad cat, naughty cat, cat who needs discipline or retraining. But here's what most cat owners don't know. The majority of sudden behavior changes in cats have an underlying medical cause. A study from the Journal of Feline Medicine and Surgery found that up to 80% of cats presenting for behavior problems had an identifiable health issue contributing to or causing the behavior. That aggressive cat? Probably in pain. The cat peeing on your bed likely has a urinary tract problem. The cat hiding could be feeling sick. By the end of this chapter, you'll understand the critical connection between health and behavior, know which behavior changes warrant immediate veterinary attention, and learn how to distinguish between purely behavioral issues and medical problems masquerading as bad behavior. This knowledge could save you months of frustration, prevent damage to your relationship with your cat, and most importantly, identify serious health problems before they become critical. The fundamental principle: rule out medical first. Here's the golden rule of cat behavior. Before you assume any behavior change is purely behavioral, rule out medical causes first. Always. No exceptions. This means that when your cat starts doing something new or stops doing something they normally do, your first call should be to the vet, not a cat behaviorist. Why is this so important? Because treating a medical problem as behavioral doesn't just fail to solve the problem, it allows the underlying disease to progress untreated. A cat with cystitis who's urinating outside the litter box will continue suffering if you just add more litter boxes. A cat attacking you because arthritis pain makes them irritable won't improve with behavior. Modification. A senior cat yowling at night due to hyperthyroidism or cognitive dysfunction needs medical treatment, not punishment for being noisy. Veterinarians call this differential diagnosis, systematically ruling out possible causes starting with the most likely or most serious. For behavior changes, medical causes should always be ruled out before pursuing purely behavioral explanations. Sarah learned this the hard way with Whiskers. Whiskers started urinating on Sarah's bed. Sarah was frustrated and angry. She tried different litters, added more boxes, cleaned obsessively with enzymatic cleaners. Nothing worked. After 2 months of this, Sarah finally took Whiskers to the vet. Whiskers had a urinary tract infection. 3 days of antibiotics and the inappropriate urination stopped completely. Sarah felt terrible that Whiskers had suffered for 2 months while she treated it as a behavior problem instead of getting medical help immediately. Litter box problems, almost, always medical until proven otherwise. Inappropriate urination or defecation, eliminating outside the litter box, is the #1 behavior complaint from cat owners. It's also the #1 reason cats are surrendered to shelters. But here's the critical fact. The vast majority of litter box problems have a medical component. We covered urinary issues extensively in Chapter 4, but let's review the medical causes of litter box avoidance: urinary tract problems, UTIs, bladder stones, crystals, cystitis, or blockages cause pain during urination. The cat associates the litter box with pain and seeks alternative locations. Cats often choose soft surfaces, like beds or couches, or cool, smooth surfaces like bathtubs or tile floors. Digestive problems, constipation, diarrhea, inflammatory bowel disease, or parasites make defecation painful or urgent. A constipated cat may strain in the box, associate the box with discomfort, and defecate elsewhere. A cat with diarrhea may not make it to the box in time. Arthritis. Getting in and out of a high-sided litter box becomes painful. Squatting to eliminate is uncomfortable. The cat eliminates near the box or in easier-to-access locations. Cognitive dysfunction. Senior cats with feline cognitive dysfunction, cat dementia, may forget where the litter box is or forget they're supposed to use it. Diabetes, kidney disease, hyperthyroidism, these conditions cause increased urination. The cat needs to go more frequently and may not always make it to the box. The larger urine volume may overwhelm the cat's tolerance for a less than pristine box. Neurological problems. Conditions affecting the nerves controlling the bladder or bowels can cause incontinence or inappropriate elimination. If your cat suddenly starts eliminating outside the litter box, your first step is always a vet visit. The vet will do a physical exam, urinalysis, and possibly blood work, fecal exam, or imaging to identify medical causes. Only after medical causes are ruled out should you pursue behavioral interventions. Marcus noticed Shadow occasionally urinating right next to the litter box instead of inside it. Marcus cleaned the boxes obsessively, thinking maybe Shadow wanted them cleaner, but it kept happening. Marcus took Shadow to the vet. Shadow had early arthritis in his hips. Getting into the box with high sides was uncomfortable. The vet recommended lower-sided boxes. Marcus bought boxes with one low side for easy entry. Problem solved. If Marcus had just assumed Shadow was being difficult and never addressed the arthritis, Shadow would have continued being uncomfortable, and the problem would have worsened. Aggression. Pain is the leading cause. Sudden onset aggression in a previously friendly cat is a major red flag for pain. Cats in pain become defensive. They may lash out when touched in painful areas. They may become generally irritable and intolerant of interaction. They may redirect aggression, attacking anyone or anything nearby when they experience a pain flare. Common painful conditions causing aggression. Dental disease. Cats with painful teeth or gums may bite when you touch their head or face. They may become aggressive around feeding time due to anticipating pain when eating. Arthritis. Cats with joint pain may bite or scratch when picked up, petted along the back or hips, or when they have to move suddenly. A cat sleeping peacefully may attack if startled awake and forced to move quickly before joints warm up. Skin conditions. Allergies, infections, or parasites causing itchy or painful skin can make cats aggressive when touched. Abdominal pain. Cats with pancreatitis, IBD, constipation, or urinary problems may become aggressive when you touch their belly or try to pick them up. Hyperthyroidism. The hypermetabolic state can cause irritability and aggression. Neurological pain, nerve damage, or central nervous system problems can cause pain that manifests as aggression. Jennifer experienced this with Bella. Bella had always been sweet and cuddly. At age 13, Bella suddenly became aggressive when Jennifer petted her back. Bella would hiss and bite. Jennifer was hurt and confused. At a vet visit for something else, Jennifer mentioned the behavior change. The vet examined Bella's back carefully and found Bella flinched when certain areas along the spine were palpated. X-rays showed significant spinal arthritis. Bella wasn't being mean, she was in pain. With pain medication, Bella's aggression disappeared. She went back to being her sweet self. The pain-aggression connection in multi-cat households. In homes with multiple cats, pain-related aggression can trigger complex social dynamics. A cat in pain may become less tolerant of other cats. This can lead to redirected aggression, where the painful cat attacks other cats. Or the painful cat may become defensive, setting off territorial disputes. Other cats may sense the vulnerability and begin bullying the painful cat. If your previously harmonious multi-cat household suddenly has fighting or tension, consider that one cat may have developed a painful condition. A vet exam for all cats may identify the culprit. Treating the painful cat often restores peace. Rachel had 2 cats, Miso and a younger cat named Tofu. They'd always gotten along well. Suddenly, Miso started attacking Tofu. Rachel tried behavioral interventions, separating them, reintroducing slowly, using pheromones. Nothing worked. Finally, Rachel took both cats for vet exams. Miso had dental disease with several painful teeth. After Miso's dental surgery and pain management, the aggression toward Tofu stopped. Miso had been in pain and taking it out on Tofu. Excessive vocalization, the cat who won't stop yowling. Excessive meowing or yowling, especially in senior cats, is often medical. Common causes: hyperthyroidism. Hyperthyroid cats are often excessively vocal. The metabolic overdrive makes them restless and vocal. Cognitive dysfunction. Senior cats with dementia may yowl, especially at night. They seem disoriented, confused, or anxious. Hypertension, high blood pressure, can cause discomfort and restlessness leading to vocalization. Pain from any source. A cat in pain may vocalize, especially at night when distractions are minimal. Vision or hearing loss. Cats who are going blind or deaf may vocalize more because they feel vulnerable or can't locate family members. Kidney disease. Nausea and discomfort from CKD can cause increased vocalization. A cat who suddenly starts yowling needs a thorough vet workup, including blood pressure measurement, thyroid testing, blood work, and possibly imaging. Lisa's cat Oliver started yowling at night at age 14. Lisa was exhausted from being woken up every night. She tried ignoring it, tried playing with Oliver before bed, tried everything she could think of. Finally, Lisa took Oliver to the vet. Blood work showed hyperthyroidism. After starting methimazole, Oliver's nighttime yowling decreased dramatically. He still vocalizes occasionally, but nothing like before treatment. Changes in activity level, lethargy, or hyperactivity. We've touched on this in previous chapters, but it bears repeating. Significant changes in activity level are medical until proven otherwise. Lethargy can indicate pain from any source, infection or fever, anemia, heart disease, respiratory problems, metabolic diseases like diabetes or kidney failure, cancer, depression, secondary to pain or illness. Hyperactivity can indicate hyperthyroidism. Cat seems wired, can't settle. Neurological problems. Pain causing restlessness. Cognitive dysfunction causing anxiety. Reaction to medications. A cat who's normally active but becomes lethargic needs a vet visit within 24 to 48 hours. A senior cat who suddenly becomes hyperactive after years of being mellow also needs evaluation. Hiding behavior. The disappearing cat. Cats hide for many reasons, and sometimes hiding is normal. Cats need safe spaces to retreat when stressed, but sudden onset hiding or dramatically increased hiding usually indicates the cat feels unwell. Sick cats instinctively hide. In the wild, hiding when sick protects them from predators. Domestic cats retain this instinct. A cat who starts hiding much more than usual is often trying to tell you they feel bad. Medical causes of hiding: pain, nausea, fever. Any condition causing weakness or discomfort, anxiety from feeling unwell. Respiratory difficulty. Cats sometimes hide in small spaces when breathing is hard. If your cat suddenly starts hiding and won't come out even for favorite foods or activities, this warrants a vet visit. Don't dismiss it as the cat being antisocial. Something has changed, and it's likely medical. Sarah noticed Whiskers started spending all day under the bed, which was very unlike him. Whiskers had always been social and curious. Sarah coaxed Whiskers out, and he seemed fine, ate normally, but then went right back under the bed. Sarah took Whiskers to the vet. Whiskers had a fever from an abscess that wasn't externally visible. Antibiotics cleared the infection, and Whiskers went back to his normal social behavior. Grooming changes, over-grooming or under-grooming. Changes in grooming habits often signal health problems. Over-grooming or excessive licking can indicate skin allergies causing itching, parasites like fleas, pain. Cats sometimes obsessively lick painful areas, urinary tract pain, excessive licking of genitals, stress or anxiety, though this often has an underlying medical trigger, hyperthyroidism. Neurological problems. Cats who lick themselves, bald, develop hot spots, or have raw areas from excessive grooming need veterinary evaluation. The vet will check for skin problems, parasites, pain, and systemic illness. Under-grooming or unkempt coat indicates arthritis making grooming. Painful or difficult dental disease making grooming. Uncomfortable obesity preventing the cat from reaching all areas. General illness causing lethargy. Nausea from kidney disease, liver disease, etc. Depression from pain or illness. A cat who stops grooming and develops a dull, matted, or greasy coat is telling you something is wrong. Sudden coat changes warrant veterinary investigation. Jennifer noticed Bella's coat became matted along her back. Bella had always been meticulously groomed. Jennifer tried brushing Bella more, but the matting returned quickly. At the vet, they discovered Bella's arthritis made it painful for Bella to twist and groom her back. With pain management, Bella started grooming normally again, and the matting resolved. Appetite changes. Eating more or less. We've discussed appetite changes in the context of specific diseases, but it's worth emphasizing. Any significant change in eating behavior warrants attention. Increased appetite with weight loss suggests hyperthyroidism, diabetes, intestinal parasites. Malabsorption problems. Cancer-decreased appetite or anorexia can indicate literally dozens of conditions. Cats who don't eat for more than 24 to 48 hours risk fatty liver disease. Never let appetite loss go unaddressed. Sudden preferences for soft food or avoiding hard food often means dental pain. Approaching food bowl but not eating suggests nausea or mouth pain. Sleep pattern changes, sleeping more, sleeping less, or sleeping in unusual places. Cats sleep 16 to 20 hours daily normally, but changes in sleep patterns can indicate problems. Sleeping much more than usual may indicate pain making activity uncomfortable, illness causing fatigue. Hypothyroidism, rare in cats but possible after hyperthyroid treatment. Depression from chronic illness, medication side effects, sleeping less, restlessness, or inability to settle may indicate. Hyperthyroidism, cognitive dysfunction. Pain that worsens at night. Arthritis often hurts more when still. Anxiety from feeling unwell. Respiratory difficulty. Sleeping in unusual places, especially seeking very warm or very cold spots, can indicate fever, seeking cool spots, hypothermia or poor circulation, seeking warm spots, pain making normal spots uncomfortable, cognitive dysfunction, causing confusion. Rachel noticed Miso started sleeping exclusively on cold tile floors instead of her usual warm, soft bed. Rachel initially thought maybe Miso was too warm, but Miso also seemed lethargic and was eating less. At the vet, Miso had a fever from a UTI. After treatment, Miso went back to her normal sleeping spots. The behavioral versus medical distinction, how vets determine cause. So how does your vet figure out if a behavior change is medical or behavioral? The process involves 1. Comprehensive history. The vet asks detailed questions about when the behavior started, how it's progressed, what the cat's environment is like, what changes have occurred in the household, the cat's age and medical history, and exactly what the behavior looks like. 2. Physical examination. A thorough hands-on exam checking every body system. The vet palpates for pain, examines the mouth, listens to the heart and lungs, feels the abdomen, assesses mobility, checks body condition, and looks for any abnormalities. 3. Diagnostic testing. Based on history and exam, the vet recommends appropriate tests. For most behavior changes, minimum database includes blood work, CBC and chemistry panel, urinalysis, and thyroid testing in cats over 7 years old. Additional tests might include blood pressure, fecal exam, imaging, X-rays or ultrasound, or specialized testing depending on symptoms. 4. Trial therapy. Sometimes the vet may try a treatment to see if it helps, using response to therapy as a diagnostic tool. For example, if the vet suspects arthritis but X-rays are inconclusive, they might prescribe pain medication. If the behavior improves dramatically on pain meds, that confirms pain was the cause. 5. Behavioral assessment. Only after medical causes are ruled out does the vet or a veterinary behaviorist assess purely behavioral causes and recommend behavior modification. The key point: this is a systematic process, not a guess, and it always starts with ruling out medical causes. When behavior is purely behavioral, what that looks like. To be clear, purely behavioral problems do exist. Not every behavior change is medical. True behavioral problems usually have these characteristics: identifiable trigger, there's a clear environmental cause, a new baby, a move, construction, a new pet, change in schedule, etc. And the behavior started coinciding with that trigger. Consistent pattern. The behavior happens in predictable situations or contexts. For example, a cat who pees on beds only when owner travels is likely exhibiting stress-related behavior, not medical illness. Normal health screening. Full vet workup is normal. No abnormalities on exam or testing. Typical stress. Behaviors. The cat shows multiple stress indicators: hiding, decreased appetite during stressful times, changes in social interaction, all of which resolve when stressor is removed. Response to behavior modification. The behavior improves with appropriate environmental changes. Behavior modification techniques or anti-anxiety medication. Even with purely behavioral issues, always rule out medical causes first. Lisa's friend had a cat who started peeing on clothes left on the floor. Vet workup was completely normal. With detailed history, they identified the trigger. The owner had started leaving clothes on the floor after starting a new job with a different schedule. The cat was stressed by the schedule change and was scent marking the clothes for comfort. Environmental enrichment, pheromone diffusers, and picking up clothes off the floor solved the problem. But they only pursued behavioral solutions after medical causes were ruled out. The gray area: medical problems triggering behavioral problems. Sometimes a medical problem triggers a behavioral problem that persists even after the medical issue resolves. This is particularly common with litter box aversion. Example: a cat develops cystitis, causing painful urination. The cat associates the litter box with pain and starts urinating on soft surfaces like the bed. The cystitis is treated and resolves, but the cat continues avoiding the litter box because the negative association was formed. In these cases, you need both medical treatment for the original problem and behavioral intervention to retrain appropriate litter box use. This might involve new litter boxes in different locations, different litter substrate making the previously soiled areas inaccessible or unappealing, positive reinforcement for using the litter box. Sometimes anti-anxiety medication temporarily. Marcus dealt with this with Shadow. Shadow had a urinary blockage that was successfully treated, but afterward Shadow avoided the litter box and urinated on the bathroom rug. Marcus took Shadow back to the vet multiple times to ensure the blockage hadn't recurred. All testing was normal. The vet explained that Shadow had formed a negative association with the litter box. Marcus got completely new boxes, moved them to different locations, used different litter, thoroughly cleaned all soiled areas with enzymatic cleaner, and blocked access to the bathroom. Over several weeks, Shadow gradually started using the new boxes. It took patience and consistency, but eventually Shadow's litter box behavior normalized. Senior cats and cognitive dysfunction, when the brain ages. Feline cognitive dysfunction, FCD, is the cat equivalent of dementia. It affects a significant percentage of cats over 15, and even some cats in their early teens. FCD is a medical problem with behavioral manifestations. Signs of FCD include disorientation, getting lost in familiar places, staring at walls, seeming confused. Changes in sleep-wake cycles, sleeping more during day, active and vocal at night. Inappropriate elimination, forgetting litter box training or where the box is located. Changes in social interaction, decreased interest in family, increased clinginess, or increased irritability. Decreased activity and interest in play, aimless wandering or pacing. Decreased response to stimuli. The acronym DISHE helps remember signs: disorientation, interaction changes with people or other pets, sleep-wake cycle changes, house soiling activity. Changes anxiety FCD is diagnosed by identifying these signs in a senior cat after ruling out other medical causes. Blood work, imaging, and physical exam rule out other conditions that can mimic cognitive dysfunction. Treatment can't reverse brain aging, but may slow progression and improve quality of life. Environmental enrichment, mental stimulation through play, puzzle feeders, new toys, and interaction. Dietary management. Prescription diets like Hill's BD contain antioxidants and other nutrients that may support brain health. Supplements. S-adenosilmethionine, SAME, may benefit some cats. Omega-3 fatty acids support brain health. Medications. Selegiline, Anapril, is sometimes used, though evidence in cats is limited. Anti-anxiety medications may help with anxiety or nighttime vocalization. Environmental modifications, night lights to reduce disorientation, easy access to resources, keeping routines very consistent. Patience and compassion. Understanding the cat isn't being difficult but is experiencing brain changes beyond their control. Jennifer's Bella developed FCD around age 16. Bella started yowling at night, sometimes seeming lost in rooms she'd known for years. Bella occasionally urinated outside the litter box, something she'd never done before. Jennifer worked with the vet to rule out other causes. Diagnosis was FCD. Jennifer uses nightlights, keeps Bella's routine very consistent, plays calming music at night, and gives Bella extra patience during confused moments. Bella also takes a supplement containing SAME. While Bella's cognitive decline can't be stopped, these measures help Bella remain comfortable, and Jennifer feels she's doing everything possible. The importance of baseline behavior knowledge. To recognize when behavior changes indicate a health problem, you need to know what's normal for your cat. Every cat is an individual with their own personality, habits, and quirks. What's abnormal for one cat might be normal for another. Establish your cat's baseline by noting typical activity level and sleep patterns, normal appetite and eating habits, usual grooming frequency and coat condition, social behavior with family and other pets, litter box habits, frequency, location preferences, vocalization patterns, play preferences and energy level, response to petting and handling, favorite sleeping spots. When you know your cat's normal, deviations become obvious. You'll notice Miso usually greets you at the door but hasn't for 3 days. You'll recognize that Whiskers normally eats breakfast enthusiastically but has been picking at his food. You'll see that Shadow usually jumps on the counter but has been avoiding it. These subtle changes are your early warning system. They alert you to potential health problems before symptoms become severe. Your action plan for behavior changes. When your cat's behavior changes, step 1, observe and document. Don't immediately panic, but don't ignore it either. Note exactly what's different, when it started, how often it happens, and any patterns. Step 2, rule out obvious environmental triggers. Did anything change in the household? New pet, new baby, construction, schedule change, moved furniture? If there's an obvious stressor and the behavior is mild, you might monitor for a few days to see if the cat adjusts. Step 3. Schedule a vet visit. For any behavior change that persists more than a few days, is severe or concerns you see, the vet. Describe the behavior clearly and specifically. Bring videos if possible. Behavior is often better shown than told. Step 4. Follow through with recommended diagnostics. Don't skip blood work or testing because your cat seems fine otherwise. Remember, cats hide illness. Testing often reveals problems you can't see. Step 5. Try recommended treatment. If a medical cause is found, treat it appropriately and give it time to work. Many conditions take weeks to show improvement. Step 6. Pursue behavioral intervention only after medical causes are addressed. If testing is normal and the vet determines the behavior is not medical, then work with a veterinary behaviorist or certified cat behavior consultant for behavior modification. Step 7. Be patient. Whether medical or behavioral, behavior changes rarely resolve overnight. Consistency and patience are essential. The bottom line on behavior and health: your cat's behavior is a window into their health. Changes in behavior are one of the few ways cats can communicate that something is wrong. When you see behavior changes, don't dismiss them as the cat being difficult, stubborn, or spiteful. Cats don't act out of spite. They act in response to how they feel physically and emotionally. Medical problems cause behavior changes far more often than most people realize. Pain, nausea, discomfort, weakness, confusion, and fear from feeling unwell all manifest as behavior changes. By recognizing this connection, seeking veterinary care promptly, and advocating for thorough evaluation, you give your cat the best chance of having underlying health problems diagnosed and treated early. And remember, you know your cat better than anyone. If something seems off, trust your instinct. Even if you can't articulate exactly what's wrong, if your gut says your cat isn't quite right, that's worth a vet visit. Vets appreciate observant owners who notice subtle changes. These are often the owners whose cats get diagnosed and treated early, leading to better outcomes. Chapter 9. Preventive care, vaccinations, parasite prevention, wellness checks. Here's a statistic that should change how you think about cat health care. According to the American Association of Feline Practitioners, cats visit veterinarians only half as often as dogs, and nearly 40% of owned cats don't receive any veterinary care at all in a given year. This is tragic because preventive care is the single most powerful tool we have for keeping cats healthy, detecting disease early, and extending both lifespan and quality of life. A study published in the Journal of the American Veterinary Medical Association found that cats who receive regular preventive care live an average of 2 to 3 years longer than cats who only see a vet when they're sick. Think about that. 2 to 3 extra years with your cat simply by being proactive instead of reactive. By the end of this chapter, you'll understand exactly what preventive care involves, why each component matters, how to overcome barriers that keep cats from getting the care they need, and how to create a preventive care schedule tailored to your cat's age and risk factors. This isn't just about preventing disease, though we'll do that too. This is about giving your cat the longest, healthiest, happiest life possible. Why cats don't get the preventive care they need. Before we dive into what preventive care involves, let's address why so many cats miss out on it. Understanding the barriers helps you overcome them. Barrier 1. The perception that cats don't need regular vet care. Many people believe cats are self-sufficient and don't need the same level of medical attention as dogs. This is false. Cats get sick. They develop chronic diseases. They need preventive care just as much as any other species. Barrier 2. Cats are difficult to transport. Getting a cat into a carrier, into the car, and to the vet is stressful for everyone involved. Many owners avoid vet visits because the process is so unpleasant. We'll address this later with practical solutions. Barrier 3. cost. Veterinary care costs money, and preventive visits add up. However, preventive care is almost always cheaper than treating diseases that could have been prevented or caught earlier. A $200 annual wellness exam is far less expensive than $3,000 to treat advanced kidney disease that could have been managed if detected early. Barrier 4. My cat seems fine. Cats hide illness so well that by the time they seem sick, disease is often advanced. Waiting for obvious symptoms means missing the window for early intervention. Barrier 5. Fear of bad news. Some owners avoid vet visits because they're afraid of receiving a serious diagnosis. This is understandable but counterproductive. Not knowing doesn't prevent disease, it just ensures you can't treat it. The solution to all these barriers is education, planning, and commitment. You're already tackling education by reading this. Now let's cover the planning and commitment parts, the core components of preventive care. Preventive care has 5 main components: wellness examinations, vaccinations, parasite prevention, dental care, and screening diagnostics. Let's break down each one. Wellness examinations, the foundation of preventive care. A wellness exam is a comprehensive physical examination performed by a veterinarian when your cat isn't sick. The goal is to detect problems early, establish baseline normals, and provide preventive treatments. During a wellness exam, the vet weighs the cat and assesses body condition. Weight trends over time can reveal important health changes. A cat who's slowly gaining weight is at risk for obesity-related diseases. A cat losing weight may have an underlying illness. Examines the eyes, ears, and nose for abnormalities. Eye problems, ear infections, and nasal discharge can indicate various conditions. Listens to the heart and lungs with a stethoscope. Heart, murmurs, arrhythmias, or abnormal lung sounds can indicate cardiac or respiratory disease. Palpates the abdomen to feel internal organs. The vet can detect enlarged organs, masses, pain, or fluid accumulation. Checks the lymph nodes for swelling that might indicate infection or cancer. Examines the skin and coat for parasites, lesions, hair loss, or poor condition. Assesses the mouth and teeth for dental disease, oral masses, or inflammation. Evaluates musculoskeletal system by watching the cat move and manipulating joints to check for pain, stiffness, or reduced range of motion. Palpates the thyroid gland in older cats to check for enlargement, suggesting hyperthyroidism. Discusses behavior, appetite, urination, defecation, and any owner concerns. This comprehensive exam can detect problems before symptoms appear or before owners recognize them as concerning. A heart murmur detected on routine exam leads to cardiac workup before heart failure develops. Dental disease caught. Early is treated before painful abscesses form. Weight loss noticed by the vet prompts investigation before the cat becomes dangerously thin. Sarah takes Whiskers for wellness exams every 6 months now that Whiskers is 8 years old. At one exam, the vet noticed Whiskers had lost half a pound since the last visit 6 months prior. Sarah hadn't noticed because she sees Whiskers every day and the change was gradual. The vet recommended blood work. Results showed early kidney disease. Because it was caught at stage 2, Whiskers started a kidney diet and supplements immediately. The vet said if Sarah had waited until Whiskers showed obvious symptoms, the disease would have been much more advanced and harder to manage. That routine exam potentially added years to Whiskers' life. Vaccination, protecting against infectious disease. Vaccines protect cats from serious, potentially fatal infectious diseases. Vaccination is one of the greatest achievements in veterinary medicine, dramatically reducing the incidence of diseases that once killed countless cats. However, vaccination is not one size fits all. Modern vaccination protocols are individualized based on the cat's lifestyle, risk factors, age, and health status. The days of giving every cat every vaccine annually are over. Instead, vets use risk assessment to determine which vaccines each cat needs and how often. Core vaccines are recommended for all cats regardless of lifestyle because the diseases they prevent are widespread, serious, and the vaccines are very safe. FVRCP, feline viral rhinotracheitis, calicivirus, panleukopenia. This combination vaccine protects against 3 viruses. Feline herpes virus, viral rhinotracheitis, causes upper respiratory infection. Feline calicivirus causes upper respiratory infection and oral ulcers. Feline panleukopenia, feline distemper, causes severe, often fatal gastrointestinal disease, and bone marrow suppression. FVRCP is given as a series of vaccines in kittens, with boosters at 1 year and then typically every 3 years in adult cats. Some cats at higher risk may receive it more frequently. Rabies, required by law in most areas. Rabies is fatal and transmissible to humans. Even indoor-only cats should be vaccinated because bats can enter homes. Rabies vaccine is given at 12 and 16 weeks of age, boosted at 1 year, then every 1 to 3 years depending on local laws and the specific vaccine used. Non-core vaccines are given based on individual risk assessment. FELV, feline leukemia virus, recommended for cats who go outdoors, live with FELV-positive cats, or have unknown FELV status. FELV is transmitted through close contact, bites, and from mother to kittens. It causes immune suppression, cancer, and ultimately death. All kittens should receive the FELV vaccine series. Adult indoor-only cats with no exposure risk may not need ongoing FELV vaccination. FIV, feline immunodeficiency virus. A vaccine exists but is not commonly used because it interferes with FIV testing and the protection it provides is questionable. Most vets don't recommend it. Bordetella and chlamydia. These vaccines protect against bacteria causing upper respiratory infections. They're generally only given to cats in high-risk environments like shelters or catteries. Lisa's cat, Oliver, is indoor only. Oliver receives FVRCP every 3 years and rabies as required by law. Oliver doesn't receive FELV because he has no exposure risk. Jennifer's cat. Bella goes outside occasionally and lives in an area with many outdoor cats. Bella receives FVRCP every 3 years, annual rabies, and the FELV vaccine series followed by boosters every 2 years. Same species, different risk factors, different vaccination protocols, vaccine considerations and controversies. Some cat owners worry about vaccine safety, particularly about vaccine-associated sarcomas, which are cancers that can develop at injection sites in rare cases. The risk is very low, estimated at 1 in 10,000 to 1 in 30,000. Vaccinated cats, but not 0. To minimize risk while maintaining protection, vets give vaccines in specific locations, usually limbs rather than between shoulder blades, so if a sarcoma develops, it can be surgically removed. Vaccines are given only as frequently as needed based on risk assessment. Some vets recommend antibody titer testing to check immunity levels instead of automatically revaccinating. The risk-benefit analysis overwhelmingly favors vaccination. The diseases vaccines prevent are far more common and deadly than vaccine reactions, but it's reasonable to discuss your specific cat's risk factors with your vet and develop an individualized vaccination plan. Parasite prevention, year-round protection. Parasites affect cats in multiple ways. Some are merely annoying. Others transmit diseases or cause serious illness. Effective parasite prevention protects your cat and, in some cases, protects human family members too. Fleas. These tiny external parasites cause itching, allergic reactions, anemia, especially in kittens, and can transmit tapeworms and certain bacterial diseases. Even indoor cats can get fleas, brought in on people's clothing or through screen windows. Modern flea prevention is highly effective. Monthly topical products like Revolution Plus, Brevecto Plus, or Advantage Multi-Kill fleas and often prevent other parasites too. Oral products like Comforties are also available. The key is year-round prevention, not just treating when you see fleas. By the time you see fleas on your cat, your house is infested with flea eggs and larvae, requiring extensive treatment. Ticks. Less common on cats than dogs, but cats can get ticks, especially outdoor cats. Ticks transmit diseases like Lyme disease, ehrlichiosis, and anaplasmosis. Many flea preventives also kill ticks. Intestinal parasites, roundworms, hookworms, tapeworms, coccidia, and giardia can infect cats. Some are transmitted from mother to kittens. Others come from hunting, infected prey, or from contaminated environments. Some intestinal parasites are zoonotic, meaning they can infect humans, particularly children. Kittens should be dewormed routinely starting at a young age. Adult cats should have annual fecal exams to check for parasites, with deworming as needed. Outdoor cats or cats who hunt may need more frequent deworming. Heartworm. Yes, cats get heartworm, though less commonly than dogs. Heartworm disease in cats is serious and often fatal. There's no approved treatment for feline heartworm, so prevention is critical. Monthly heartworm preventives like Revolution or Advantage Multi protect against heartworm, as well as other parasites. Rachel gives Miso Revolution Plus every month, year-round. This single product prevents fleas, ticks, ear mites, roundworms, hookworms, and heartworm. Rachel sets a phone reminder for the first of each month. It's simple, effective, and gives Rachel peace of mind that Miso is protected from multiple parasites with one product: dental care. More important than you think. We covered dental disease extensively in Chapter 7, but it's worth repeating here. Dental care is a critical component of preventive care. Regular professional dental cleanings prevent painful dental disease and the systemic health problems it causes. Most cats need professional dental cleaning under anesthesia every 1 to 3 years, starting around age 3-5. Cats with dental disease history may need annual cleanings. The frequency depends on individual factors like genetics, diet, and home dental care. Between professional cleanings, home dental care can slow tartar accumulation. Daily toothbrushing with cat-specific toothpaste, dental treats, or foods designed to reduce tartar water additives that reduce bacterial growth, dental wipe, or gels. Marcus brushes Shadow's teeth 3 times a week. It took several weeks to train Shadow to tolerate it, starting with just letting Shadow taste the toothpaste, then gently rubbing Shadow's gums with a finger, gradually introducing the toothbrush. Now it's part of the routine. Shadow still needs professional cleanings every 18-24 months, but home care extends the time between cleanings and keeps Shadow's teeth healthier. Screening diagnostics, finding problems before symptoms appear. Blood work and other diagnostics done when your cat seems healthy can detect disease early when it's most treatable. Screening recommendations vary by age. Young adult cats, 1-7 years. Baseline blood work at initial adult exam establishes normal values for your cat. Repeat screening every 1 to 2 years or before anesthesia. Mature adult cats, 7 to 10 years. Annual blood work including complete blood count, CBC, chemistry panel, and thyroid testing, T4. Annual urinalysis. Senior cats, 10+ years. Blood work and urinalysis every 6 months. Blood pressure measurement annually or semi-annually. Additional testing is indicated by exam findings or symptoms. Blood work detects kidney disease before symptoms appear, diabetes, hyperthyroidism, liver disease, anemia, infection or inflammation, electrolyte imbalances. Urinalysis detects kidney disease, diabetes, urinary tract infections, bladder stones or crystals, bladder cancer, sometimes. Blood pressure measurement detects hypertension, which is common in cats with kidney disease or hyperthyroidism and can cause blindness, stroke, or organ damage if untreated. Jennifer does semi-annual senior wellness visits for Bella, now 16. Each visit includes blood work, urinalysis, and blood pressure measurement. Over the years, this screening has caught Bella's kidney disease early, allowing years of successful management. Detected early arthritis, prompting pain management, and identified high blood pressure, preventing blindness. Jennifer spends about $800 annually on these preventive visits. But this investment has kept Bella healthy and likely prevented thousands in emergency care costs, creating your cat's preventive care schedule. Every cat needs an individualized preventive care plan. Here's a general framework: kittens, under 1 year. Series of FVRCP vaccines at 6 to 8 weeks, 10 to 12 weeks, and 14 to 16 weeks. FELV vaccine series, 2 doses, 3 to 4 weeks apart. If at risk, rabies vaccine at 12 to 16 weeks, monthly parasite prevention. Starting at 8 weeks, spay-neuter at 4 to 6 months, fecal exam to check for intestinal parasites. Baseline blood work before spay-neuter surgery. Young adults, 1 to 7 years. Annual wellness exam. FVRCP booster at 1 year, then every 3 years rabies booster at 1 year, then every 1 to 3 years per local laws, FELV booster annually, or every 2 years if at risk, annual fecal exam. Baseline blood work and urinalysis, then every 1 to 2 years, monthly year-round parasite prevention, dental cleaning as needed, typically every 1 to 3 years, mature adults, 7 to 10 years. Annual wellness exam, consider semi-annual. Continue vaccination schedule. Annual blood work, urinalysis, and thyroid. Testing annual fecal exam. Annual blood pressure check. Monthly parasite prevention. Dental cleaning as needed, likely annually. Seniors, 10 plus years. Semi-annual wellness exams. Continue vaccination schedule. Discuss with vet whether to continue or modify based on health status. Blood work and urinalysis every 6 months. Semi-annual blood pressure checks. Annual fecal exam. Monthly parasite prevention. Dental cleaning as needed, with careful anesthetic monitoring. Additional diagnostics as indicated. This is a general framework. Your vet may recommend more or less frequent care based on your individual cat's health status, risk factors, and findings on exams. The special case: indoor-only cats. Many owners assume indoor-only cats need less preventive care. This is partially true for some things, lower parasite risk, no FELV exposure, but false for others. Indoor cats still need regular wellness exams to detect age-related diseases, core vaccines. Rabies is legally required in most places. FVRCP protects against viruses that can be brought in on clothing or through windows. Dental care, screening blood work, parasite prevention. Fleas and intestinal parasites can affect indoor cats. The myth that indoor cats don't need veterinary care contributes to indoor cats receiving less preventive care than they need. Indoor cats develop the same age-related diseases as outdoor cats. They get dental disease, kidney disease, hyperthyroidism, diabetes, and cancer at similar rates. The only difference is exposure to certain infectious diseases and parasites. Sarah's Whiskers is indoor only. Sarah used to think Whiskers didn't need vet care because he never went outside. After Whiskers developed a urinary blockage at age 5, Sarah learned that indoor status doesn't protect against many health problems. Now Whiskers gets regular preventive care, including annual exams, vaccinations on an appropriate schedule for indoor cats, dental cleanings, and age-appropriate screening. Being indoor doesn't mean being invincible. Overcoming the transportation barrier, making vet visits less stressful. The difficulty of getting cats to the vet is a major barrier to preventive care. Let's address this with practical solutions. Carrier training. Make the carrier a normal part of your cat's environment, not something that only appears before scary events. Leave the carrier out with the door open. Put soft bedding inside. Feed treats or meals inside the carrier. Let your cat nap in it. When the carrier becomes a safe, familiar space, getting the cat into it for vet visits becomes easier. Calming aids. Feliway spray applied to the carrier 30 minutes before use can reduce anxiety. Gabapentin, a prescription anti-anxiety medication given 2 hours before vet visits, reduces stress significantly. Many vets now routinely prescribe gabapentin for anxious cats before appointments. Low-stress handling. Some veterinary clinics are certified fear-free or cat-friendly. Practice, meaning staff are trained in low-stress handling techniques. These clinics use pheromones, quiet exam rooms, gentle handling, and cat-friendly practices. Seek out these clinics if available in your area. House call vets. Mobile veterinarians come to your home, eliminating transportation stress. House call services are becoming more common and can be worth the extra cost for very anxious cats. Separate cat clinic days. Some clinics have designated cat-only hours or days, eliminating the stress of barking dogs in the waiting room. Planning ahead. Schedule appointments during quiet times. Bring familiar-smelling blankets. Use a covered carrier to reduce visual stress. Feed a light meal before travel to prevent car sickness, but avoid full meals immediately before. Rachel's cat, Miso, used to be terrified of the vet. Rachel started giving Miso gabapentin before appointments. She uses a carrier with Feline spray. Rachel covers the carrier with a towel during transport. Rachel found a fear-free certified clinic. These changes transformed vet visits. Miso is still not thrilled, but she's manageable instead of panicked. Rachel no longer dreads vet visits, so she doesn't avoid them, which means Miso gets the preventive care she needs. The financial aspect. Making preventive care affordable. Cost is a real barrier for many cat owners. Preventive care requires ongoing investment. Here are strategies to make it more manageable. Wellness plans. Many veterinary clinics offer wellness plans where you pay a monthly fee covering annual exams, vaccinations, fecal exams, and sometimes discounts on dental cleanings or diagnostics. These plans spread costs over the year instead of large lump sums. Pet insurance. Insurance helps with unexpected illness or injury costs, though most plans don't cover routine preventive care. However, by protecting against large unexpected expenses, insurance frees up money for preventive care. Low-cost clinics, community clinics, humane. Societies and mobile vaccine clinics offer basic preventive services at reduced cost. These may not provide comprehensive care, but can cover vaccinations and basic exams affordably. Prioritization. If you truly can't afford everything, work with your vet to prioritize. At minimum, ensure annual exams, core vaccines, and parasite prevention. Add other components as finances allow. Budgeting. Set aside money monthly for veterinary care. Even $25, $50 monthly adds up to $300 to $600 annually, covering basic preventive care. Care credit. This healthcare credit card can be used for veterinary expenses, often with interest-free promotional periods. Communication with your vet. If cost is a concern, tell your vet. Many will work with you to create an affordable plan, suggesting which diagnostics are most essential versus which can wait. The reality is that preventive care costs money, but it costs far less than treating advanced disease. Jennifer spends about $800 annually on Bella's preventive care, 2 wellness visits with blood work, vaccinations, parasite prevention, and occasional dental cleanings. She once calculated that if she'd skipped preventive care and Bella had developed undetected kidney disease, heart disease from untreated hyperthyroidism, or suffered a urinary blockage, emergency treatment could have cost $5,000, $10,000, or more. Preventive care is an investment that usually pays for itself by preventing expensive crises. Special considerations for different life stages. Preventive care needs change as cats age. Understanding these changes helps you provide appropriate care. Kittens. The first year is crucial for establishing health. Proper vaccination, parasite prevention, spay, neuter, and early socialization set the foundation. Kittens also need protection from household dangers, securing toxic plants, chemicals, and small objects they might swallow. Kitten-proofing prevents injuries requiring emergency care. Young adults. These are typically the healthiest years. Preventive care focuses on maintaining health, preventing obesity, and establishing good habits like dental care. Many young adult cats receive minimal veterinary care because they seem fine. Don't fall into this trap. Annual exams and age-appropriate screening matter even when your cat looks healthy. Mature adults. Disease risk increases. Screening becomes more important. Watch for subtle changes indicating early disease. This is when many chronic conditions like kidney disease, hyperthyroidism, and diabetes begin developing. Early detection makes huge differences in outcomes. Seniors, expect health issues. The goal shifts from pure prevention to early detection and management of age-related conditions. Semi-annual exams and blood work aren't excessive. They're appropriate for the disease prevalence in this age group. Focus on quality of life, pain management, and maintaining function as long as possible, the role of diet in preventive care. While we haven't dedicated a full chapter to nutrition, diet is a fundamental component of preventive health. Proper nutrition prevents obesity, supports organ function, and may reduce disease risk. Basic nutrition principles: feed high-quality food appropriate for your cat's life stage. Cats are obligate carnivores. They need animal protein, not grain-heavy foods. Maintain healthy body weight through portion control. Consider canned food for higher moisture content. Avoid overfeeding treats. Provide fresh water always. Special diets may be recommended for specific conditions. Kidney diets for CKD, urinary diets for urinary problems, dental diets for oral health, weight loss, diets for obesity. Work with your vet to choose appropriate nutrition. The preventive care mindset being proactive, not reactive. The biggest shift needed for effective preventive care is mental, moving from reactive, "I'll take my cat to the vet when something's wrong," to proactive, "I'll take my cat to the vet," regularly to prevent problems and catch issues early. This mindset change is hard. It requires investing time and money before there's an obvious problem, accepting that wellness visits are not optional luxuries, planning ahead with scheduling, following through even when inconvenient, trusting that prevention is worthwhile even when you don't see immediate results. But this mindset change is also the most important thing you can do for your cat's health. Marcus adopted this mindset after Shadow's near-death experience with urethral blockage. Marcus realized he'd been reactive, only taking Shadow to the vet when obviously ill. Now Marcus is proactive. Shadow sees the vet semi-annually. Marcus doesn't wait for symptoms. The preventive care has kept Shadow healthy for 5 years since that crisis, catching and managing problems early. Marcus wishes he'd adopted this mindset from day one, but is grateful he learned before it was too late. Your preventive care action plan. Step 1. Know your cat's current preventive care status. When was the last vet visit? Are vaccinations current? When was the last blood work? Dental cleaning? Create a health record with dates of all preventive care. Step 2. Schedule your cat's next preventive care visit based on age and health status. Don't wait for symptoms. Make the appointment now. Step 3. Prepare questions and concerns for the vet. Write them down so you don't forget during the appointment. Step 4. Discuss with your vet what preventive care schedule is appropriate for your individual cat. Ask about vaccination protocol, recommended frequency of wellness exams, when blood work should be done, parasite prevention recommendations, dental care plan. Step 5. Create a calendar or reminder system for preventive care. Set reminders for monthly parasite prevention, annual exams, vaccination boosters, blood work, dental cleanings. Step 6. Budget for preventive care. Set aside money monthly or explore wellness plans, insurance or low-cost options. Step 7. Address transportation barriers. Carrier train your cat. Ask about anti-anxiety medications. Find a cat-friendly clinic. Step 8. Commit to the plan. Make preventive care a non-negotiable priority, not something you do if time and money permit. Chapter 10. Your Cat Health Action Plan and Emergency Preparedness. We've covered an enormous amount of information in this video. Emergency recognition, digestive problems, urinary issues, respiratory disease, chronic conditions, arthritis and pain, behavioral health indicators, and preventive care. You now know more about cat health than most cat owners will ever learn. But knowledge alone doesn't save lives. Action does. This final chapter is about taking everything you've learned and turning it into a concrete, actionable plan. We're going to create your personal cat health management system, a framework for staying organized, recognizing problems early, making informed decisions, and being prepared for emergencies. This is your roadmap for giving your cat the healthiest life possible, customized to your individual cat's needs, your lifestyle, and your resources. By the end of this chapter, you'll have a complete action plan that you can implement immediately. The Cat Health Binder, your central organizational system. Let's start with organization. Managing cat health effectively requires keeping track of lots of information: vaccination records, medication schedules, vet visit notes, blood work results, symptom logs. A centralized organizational system keeps everything accessible when you need it. Create a cat health binder, physical or digital, with these sections. Section 1, Basic Information. Cat's name, age, birth date, microchip number, and registry information, description and photos. Helpful if your cat gets lost. Your vet's contact information, including after-hours emergency number, emergency vet contact information. Pet Poison Control Hotline, 888-426-4835, your cat's normal vital signs, resting respiratory rate, typical weight, known allergies or medication sensitivities. Section 2, Medical Records, vaccination history with dates and due dates for boosters, all vet visit summaries, blood work results with dates, diagnostic imaging reports, x-rays, ultrasounds, surgical records, hospitalization records. Section 3, Current Medications and Supplements. List of all medications with dosages, frequency and purpose, start dates for each medication. Refill information supplement list, adverse reactions or side effects experienced. Section 4, Health Tracking. Weight log, symptom diary. We'll discuss this more shortly. Behavior observations, appetite and litter box tracking if needed. Section 5, Emergency Plan. Emergency protocol, what to do in various emergency situations. Transportation plan for getting cat to emergency vet emergency contact list who can help if you're unavailable. Financial plan for emergency costs. Sarah created a digital health binder for Whiskers using a cloud-based folder accessible from her phone. Each vet visit, Sarah photographs the visit summary and blood work results and uploads them to the folder. Sarah has a medication list that she updates whenever anything changes. When Sarah travels, her cat sitter has access to the folder so they know all of Whiskers' medical information and can provide it to a vet if needed. This system has saved Sarah countless times when a vet asked, "When was his last blood work?" or "What medication is he on?" The answers are at Sarah's fingertips. The daily health check, making monitoring a habit. Early detection requires paying attention, but paying attention is vague. Let's make it concrete with a daily health check routine that takes about 2 minutes. Every day observe. Eating. Did your cat eat their meals normally? Any decrease in appetite? Drinking. Is water consumption normal, increased, or decreased? Elimination. Did your cat urinate and defecate? Was it normal? Any straining, blood, diarrhea, or unusual frequency? Activity. Is your cat's energy level normal? Playing, exploring, interacting as usual? Behavior. Any hiding, aggression, excessive vocalization, or other changes? Grooming. Is the coat normal? Any over-grooming or under-grooming? Breathing. Is breathing quiet and effortless? Count breaths occasionally to know what's normal. Mobility. Moving normally? Jumping, climbing, and walking without hesitation or stiffness. This mental checklist becomes automatic with practice. You're not obsessively monitoring every second. You're simply being observant during normal interactions. When you feed your cat, you notice if they eat enthusiastically. When you scoop the litter box, you note whether output is normal. When you play with your cat, you observe their movement and energy. Most days, everything will be normal. But when something changes, you'll recognize it immediately because you know what normal looks like for your cat. The symptom diary. Tracking changes over time. When you notice something abnormal, start documenting it. Memory is unreliable. You might think your cat has been vomiting a lot lately when it's been twice in 3 weeks, or you might not realize your cat has gradually stopped jumping because the change was so subtle. A symptom diary provides objective data. When you call the vet, you can say, "My cat has vomited 6 times in the past 5 days, all in the morning, shortly after eating," instead of, "My cat has been vomiting." The first gives the vet actionable information. The second is too vague to assess severity. What to track in a symptom diary? Date and time of symptom. Exact description of what you observed. Frequency and duration. Any apparent triggers. What the cat was doing before and after. Response to any interventions. Jennifer keeps a symptom diary for Bella. When Bella's arthritis flares up, Jennifer notes the date, what Bella was doing when Jennifer noticed the problem, severity on a scale of 1 to 10, and any pain medication given. Over time, patterns emerged. Bella's arthritis is worse in cold, damp weather. Bella struggles more in the morning but loosens up during the day. This information helped the vet adjust Bella's pain management plan to give medication at night, so Bella has maximum coverage in the morning. Monthly health assessments, the bigger picture. In addition to daily observation, do a more structured assessment monthly. Weigh your cat, track weight trends. Gain or loss of more than 5% of body weight warrants investigation. Body condition score. Use a 9-point scale where 5 is ideal. Feel ribs, spine, and hips. At ideal weight, ribs should be easily felt but not prominently visible. Dental check. Look at teeth and gums if your cat allows it. Note tartar buildup, red gums, or bad breath. Coat and skin assessment. Check for hair loss, bald patches, lumps, or skin lesions. Behavior evaluation. Using a standardized questionnaire. Or your own notes, assess activity level, social interaction, appetite, grooming, litter box habits. Compare to previous months to identify gradual changes. Rachel does monthly health checks for Miso on the 1st of each month. Same day, Rachel applies parasite prevention, making it easy to remember. Rachel weighs Miso, feels Miso's body condition, checks teeth and gums, looks over Miso's coat, and notes any behavior changes. This monthly ritual has helped Rachel catch several issues early, including weight gain that prompted a diet adjustment before obesity developed. The emergency preparedness kit, being ready before crisis hits. We discussed emergency recognition in Chapter 1, but let's talk about practical preparedness. When emergency strikes, you won't have time to gather supplies or look up information. Prepare now. Create an emergency kit containing cat carrier. In good condition, large enough for your cat to stand and turn around. Keep it accessible, not buried in a closet. Emergency contact list. Your vet, emergency vet. Poison control. Trusted friends who could help in a crisis. Medical records. Copy of vaccination records. Current medications. Recent blood work. Medical history. Keep in the carrier or attached to it. 72-hour supply of medications, in case you can't get home or pharmacies are closed. Food and water. Shelf-stable canned food and bottled water for 3 to 5 days. Litter and disposable litter box. Disposable aluminum pans work well. First aid supplies. Gauze, bandages, hydrogen peroxide, styptic powder, stops bleeding, digital thermometer, tweezers, blanket. Comfort items. Familiar smelling towel or toy to reduce stress. Leash and harness. In case carrier is damaged or you need to move your cat, store this kit in an accessible location. In natural disasters, you may need to evacuate quickly. Having supplies ready means you can grab and go. Marcus created an emergency kit after a close call when a wildfire threatened his area. Marcus had to evacuate with 20 minutes notice. He grabbed Shadow and threw random items in a bag, but forgot Shadow's medications and had no food. Fortunately, the evacuation was brief, but Marcus realized how unprepared he was. Now Marcus has a fully stocked emergency kit. It includes 3 days of Shadow's medications in a waterproof bag, canned food, a disposable litter box, copies of Shadow's medical records, and a photo of Shadow, helpful for lost pet posters if they get separated. Marcus checks the kit every 6 months to replace expired items. Financial preparedness, the reality of veterinary costs. Veterinary care costs money, sometimes a lot of money. Financial unpreparedness is one of the main reasons cats don't receive needed care. Let's address this honestly. Expected costs, annual wellness exam, $5,150 vaccinations, $2,050 per vaccine, annual blood work, $150 or $300 dental cleaning, $300, $800 parasite prevention, $150, $300 annually. Total annual preventive care, approximately $700, $2,500 unexpected costs. Emergency vet visit, $500, 3 Sono Plus, hospitalization, $1,000, $5,000 for surgery, $500, $5,000 for chronic disease management, $500, $3,000 for annually advanced diagnostics or specialist care, $500 to $3,000 for strategies for financial preparedness, emergency fund, set aside money specifically for vet expenses. Even $50 monthly creates a $600 buffer in a year. Pet insurance. Monthly premiums typically range from $25 to $60. Insurance covers a percentage, usually 70–90% of eligible expenses, after a deductible. It's most valuable for unexpected illnesses or injuries. Research policies carefully as coverage, exclusions, and reimbursement rates vary widely. Wellness plans. Some clinics offer monthly payment plans covering routine care. Care credit or scratch pay, healthcare financing options that allow payment over time, often with interest-free periods. Communication with your vet. If you're facing financial constraints, discuss it openly. Many vets will work with you on payment plans or help prioritize essential treatments. Lisa has pet insurance for Oliver. It costs $40 monthly. When Oliver needed emergency surgery for a urinary blockage costing $3,200, insurance reimbursed 80% after Lisa's $250 deductible, so Lisa paid about $900 instead of the full amount. Over Oliver's lifetime, Lisa has paid more in premiums than she's received in claims. But insurance gave Lisa peace of mind and meant she could afford emergency care without financial devastation. For Lisa, it's worth it. Decision-making frameworks. When you're overwhelmed. Facing difficult medical decisions for your cat can be overwhelming. Should you pursue aggressive treatment or focus on comfort? Is surgery worth the risk? When is it time to consider euthanasia? These decisions are deeply personal, but frameworks can help. The quality of life scale. Evaluate these factors on a scale of 1 or 10. Hurt. Is pain controlled adequately? Hunger. Is the cat eating enough to maintain? Strength? Hydration. Is the cat drinking adequately or receiving fluids? Hygiene. Can the cat stay clean or does elimination cause distress? Happiness. Does the cat express joy or interest in things they once enjoyed? Mobility. Can the cat move around comfortably? More good days than bad. Are there more good days than difficult days? Total scores above 35 suggest acceptable quality of life. Scores below 35 suggest suffering may outweigh quality. This isn't a rigid formula, but a tool for honest assessment. The burden versus benefit analysis. For treatment decisions, consider benefits, likelihood of success, expected improvement in quality or length of life, reversibility of problems, burdens, risk of complications, recovery time and difficulty side effects, stress to the cat, financial cost impact on your ability to provide care. If burdens significantly outweigh benefits, it may be reasonable to choose less aggressive or palliative approaches, consulting your vet and getting second opinions. Your vet is your partner in these decisions. They can provide medical information, prognosis, and options, but the final decision is yours. If you're uncertain or uncomfortable with a recommendation, seeking a second opinion is completely appropriate. Jennifer faced this when Bella was diagnosed with kidney disease. The vet recommended aggressive treatment, including subcutaneous fluids at home. Jennifer felt overwhelmed. She sought a second opinion from an internal medicine specialist. The specialist agreed with the treatment plan and explained it more thoroughly, giving Jennifer confidence to proceed. That second opinion helped Jennifer commit to the treatment plan that has kept Bella healthy for 3 years. The euthanasia decision, the hardest choice. Eventually, most cat owners face the decision of when to euthanize. This is profoundly difficult. Some guidelines. Euthanasia may be appropriate when quality of life is poor despite maximal treatment. The cat is in uncontrollable pain. The cat has stopped eating despite appetite stimulants and cannot be sustained. The cat has lost interest in everything and seems to be suffering. Treatment options have been exhausted. Further treatment would cause more suffering than benefit. It's better to be a week early than a day too late. Allowing your cat to suffer because you can't bear to let go is not kindness. When quality of life is gone, euthanasia is the final act of love, ending suffering peacefully. Euthanasia is not giving up. It's recognizing that death is inevitable and choosing to make it peaceful rather than prolonged and painful. Trust yourself. You know your cat. You know when they're suffering. When that voice inside says, "It's time," listen to it. Marcus had to make this decision for a previous cat who developed cancer. Marcus pursued treatment initially, but the cancer progressed. The cat stopped eating, stopped playing, just lay in a corner looking miserable. Marcus agonized over the decision. Finally, Marcus's vet said something that helped. When we can't add days to their life, we add life to their days. And when we can't add life to their days anymore, we give them a peaceful end. Marcus scheduled euthanasia for the next day. He spent that final day giving his cat favorite treats, gentle pets, and soft words. The euthanasia was peaceful. The cat passed in Marcus's arms. Marcus grieved deeply, but knew he'd done the right thing by ending suffering. Resources and support systems. You don't have to navigate cat health alone. Resources and support systems exist. Your veterinarian, your primary resource. Build a good relationship. Ask questions. Communicate concerns. Veterinary specialists, internal medicine specialists, cardiologists, oncologists, surgeons, and other specialists are available for complex cases. Your vet can refer you. Online communities, forums and Facebook groups for specific conditions, feline diabetes, kidney disease, FIV+, etc. Provide support, information, and shared experiences. Books and reputable websites. Cornell University's Feline Health Center, International Cat Care, AAFP, American Association of Feline Practitioners, and veterinary school websites offer evidence-based information. Veterinary teaching hospitals offer advanced care and often have lower costs than private specialty practices. Local cat rescue organizations often have resources for low-cost care, financial assistance, or referrals. Pet loss support, hotlines, counseling, support groups help with grief after losing a pet. Sarah connected with an online feline diabetes support group when Whiskers was diagnosed. The group has been invaluable. Experienced members answered Sarah's questions, shared dosing tips, provided emotional support during difficult times, and celebrated victories when Whiskers' glucose was well controlled. Knowing she wasn't alone made managing Whiskers' diabetes much less overwhelming. Putting it all together, your personalized action plan. Now let's create your personal cat health action plan. Customize this based on your cat's age, health status, and individual needs. Immediate actions. Due this week. Create your cat health binder, physical or digital. Gather all existing medical records and organize them. List all current medications and supplements. Save emergency vet contact information in your phone. Check that your cat's microchip registration is current. Assess your current supplies, carrier, first aid kit, medications. Schedule your cat's next vet appointment if overdue. Start daily health observation habit. Short-term actions due this month. Complete your emergency preparedness kit. Set up calendar reminders for monthly parasite prevention. Set up calendar reminders for upcoming vet appointments and vaccination boosters. Evaluate your financial preparedness, emergency fund, insurance, etc. Do a comprehensive monthly health assessment. Begin carrier training or anti-anxiety preparations. If your cat is difficult to transport, review and update your cat's diet to ensure it's age-appropriate and high quality. Establish a dental care routine. Ongoing actions. Maintain long-term. Daily health observations, monthly health assessments, and weight checks. Keep Health Binder updated with vet visit notes, blood work, etc. Adhere to preventive care schedule appropriate for your cat's age. Monitor for behavior changes that might indicate health problems. Stay educated about feline health through reputable sources. Maintain emergency fund or insurance coverage. Reassess your cat's needs as they age and adjust care accordingly. Rachel printed out a customized action plan for Miso. Rachel checked off items as she completed them. Creating the health binder took an afternoon. Setting up the emergency kit took a few hours spread over a week. But now Rachel has systems in place. Rachel's daily routine includes observing Miso during feeding and litter box, cleaning. Rachel has monthly reminders for health assessments and parasite prevention. Rachel has semi-annual vet visits scheduled a year in advance. This organization has transformed how Rachel manages Miso's health. Nothing falls through the cracks anymore. The long-term perspective, your cat's entire health journey. Think of your cat's health as a journey spanning their entire lifetime, not a series of isolated events. Each life stage brings different challenges and needs. Kittenhood. Establishing good health foundations through proper nutrition, vaccination, parasite prevention, and spay-neuter. Preventing behavioral problems through socialization and environmental enrichment. Young adulthood. Maintaining optimal health, preventing obesity, establishing preventive care routines, and enjoying these healthy years while staying vigilant for early signs of problems. Mature adulthood. Increasing screening frequency, watching for early disease, addressing minor issues before they become major, and maintaining quality of life as the body begins aging. Senior years, managing chronic conditions, prioritizing comfort and quality of life, making difficult decisions about treatment intensity, and knowing when to shift focus from cure to care. End of life, ensuring comfort, managing pain, making the euthanasia decision when appropriate, and grieving the loss while celebrating the life you shared. Your role as a cat owner evolves through these stages. In kittenhood, you're establishing foundations. In young adulthood, you're maintaining health. In mature and senior years, you're managing decline. Throughout, you're providing love, care, and advocacy for your cat's well-being. Jennifer has been with Bella through all these stages. Bella came to Jennifer as a kitten. Jennifer provided all the right care: vaccinations, spay surgery, good nutrition, preventive care. Through Bella's young adult years, Jennifer maintained wellness visits and kept Bella at a healthy weight. When Bella entered the mature years, Jennifer increased screening. Now at 16, Bella has kidney disease and arthritis, both well managed. Jennifer knows Bella won't live forever. The thought breaks Jennifer's heart, but Jennifer finds comfort knowing she's given Bella the best care possible at every stage. When Bella's time comes, Jennifer will have no regrets about missed opportunities or neglected care. That's the goal, to reach the end of your cat's life, knowing you did everything you could. A final word: the transformation you've achieved. If you've watched this entire video, you've completed nearly 2 hours of intensive cat health education. You now know more about feline health than many cat owners will learn in a lifetime. You understand emergency recognition, digestive problems, urinary issues, respiratory disease, chronic conditions, arthritis and pain, behavioral health connections, preventive care protocols, and how to create comprehensive health management systems. But more importantly, you've transformed your ability to care for your cat. You can now recognize emergencies requiring immediate action, identify subtle signs of illness before they become critical, distinguish between urgent and non-urgent symptoms, Understand common diseases and how they're managed. Recognize pain in a species that hides it expertly. Connect behavior changes to underlying health problems. Implement comprehensive preventive care. Make informed decisions about your cat's health. Advocate effectively for your cat with veterinarians. Be prepared for emergencies. Create and maintain organized health management systems. This knowledge has practical, real-world impact. It will help you catch diseases early when they're most treatable. It will save you money by preventing expensive emergencies through proactive care. It will extend your cat's lifespan and improve their quality of life. It will deepen your bond with your cat as you become more attuned to their needs and more confident in meeting them. Your cats are counting on you. Your cat can't schedule their own vet appointments. They can't tell you when they're in pain. They can't research their symptoms or advocate for appropriate treatment. They're completely dependent on you to be their healthcare champion. That's a significant responsibility, but you've shown you're willing to take it seriously by investing hours learning about their health. That commitment matters. That commitment saves lives. So here's my challenge to you. Take what you've learned and use it. Don't let this be information you passively consumed and then forgot. Act on it. Create your health binder this week. Schedule that overdue vet appointment. Start doing daily health observations. Put together your emergency kit. Make preventive care a priority, not an afterthought. Your cat's health is in your hands. You now have the knowledge and tools to do an exceptional job protecting it. And before you go, I want to remind you about one more resource that can help you on this journey. Throughout this video, we've touched on emergency situations and the critical importance of knowing what to do when crisis strikes. If you want detailed, step-by-step emergency protocols specifically for senior and disabled cats, the cats most vulnerable to health crises, I've created a comprehensive guide called Emergency First Aid for Senior and Disabled Indoor Cats. It covers emergency procedures, home care techniques, and critical interventions that can save your cat's life while you're getting to the vet. It's designed as a companion to what you've learned here, giving you the confidence to act in those terrifying moments when every second counts. You can find it linked in the description. The journey continues. Cat health is a journey, not a destination. There will be challenges. The cat will get sick at some point. It's inevitable. They'll develop conditions requiring management. Eventually, you'll face the heartbreak of saying goodbye. But with the knowledge you now have, you can navigate those challenges better. You'll catch problems early. You'll make informed decisions. You'll give your cat the best possible care through every stage of life. And when you reach the end of your cat's journey, you'll be able to look back knowing you did everything in your power to give them a long, healthy, comfortable, happy life. You'll have no regrets about missed warning signs or delayed care. You'll know you were the advocate your cat needed. That's the true value of everything you've learned today. Not just the facts and protocols, but the confidence and capability to be an exceptional cat parent throughout your cat's entire lifetime. Thank you for caring enough about your cat to invest this time in learning. Thank you for being the kind of owner who goes beyond the basics to truly understand feline health. Your cat is lucky to have you. Now go take action. Your cat's healthiest life is waiting for you to create it.